Hello and welcome to day 4 of the Health Coach Summit. Now, you're probably going to say, what's the guy doing here in the garden, right? Well, to be honest, I'm running so late in terms of getting back to the studio, but then I thought, hey, actually, that's a great opportunity to talk to you at the beginning of day 4, the beauty of being a health coach, right? You can be anywhere, right? You can't even be in the garden. You can do your fitness, your pillar number 2 of lifestyle medicine while you talk and chat and work with your clients. And actually, for me, I started doing that about 3-4 months ago. I talked to Stefan actually from the American College of Lifestyle Medicine, and we had a long call, like an hour, and he was running and walking in the beach and wherever he was, and he said, I do this all the time. Like I make sure I get my exercise in, and while I exercise, I make phone calls and even talk to clients and so on, right? So I started doing that as much as possible. So it's kind of like serves as a little demonstration, the beauty of being a health coach, and you're not locked into an office, and for me, especially, I sit on the computer a lot, but now since I've been doing that, using a mobile, right, it's just beautiful. It's amazing, right? And that's part of the lifestyle, I think, that health coaches love. And so I guess that's one of the habits that I'd like you to start integrating. Check, where you work, how you work, and get out more and use the technology that we have. And I don't want to talk a lot more about that in the last talk today with the Healthy Wealthy Health Coaching for Everyone, because that was really our motivation why we developed that. But now, most important, I want to introduce Dr. Jane Oelke, because she's absolutely amazing. She's so experienced, and you're going to learn so much from her. The topic is going to be kind of the integration with therapy and health coaching, especially if other credentials like Dr. Jane has. We're calling her Dr. Jane. I just love that sound. She's a naturopath, homeopath, and a Ph.D. and has so many skills in so many different ways. And she's an NBH-HWC certified, Lifestyle Prescription University certified health coach. Is also a Lifestyle Prescription University degree in our degree program, a committee. She's reviewing and approving and giving feedback of the degree, the master's and the PhD degrees. And so incredible what she does. And thanks for being here, Dr. Jane. Really, really appreciate it.
Well, good morning where I'm at, Ben. Yes, looks sunny where you're at, and actually I live right on Lake Michigan, so we're enjoying the weekend here in the sun too. So when I get a chance, so that's great.
Yeah, thank you again. Now again, you talk about therapy and integration, health coaching, how you do this in your busy practice, and yeah. So take it away from here, and everybody again type into the chat box. Ask questions, use Dr. Jane's knowledge, and really ask all these questions that, about scope of practice, which I know that was always a big topic the last 3 days. And so she will help you with that. And one thing I forgot, Dr. Jane is also teaching an NBH-HWC preparatory course if somebody needs help to prepare for the NBH-HWC exam. Here we go. Thank you, Jane. Take it over from here.
Well, good morning. I'm going to put my PowerPoint on. Actually, I'm talking also about, Johannes would ask me to speak about long COVID. So actually, I'm going to speak about how I work with clients about that. Let me share my screen so that you can see what I'm doing here. I'm going to go to this one here. That's the one that works, I know. So let's go to this. Yep. Slideshow from currents from beginning. Okay, and display settings. Okay. Yeah, we were talking about therapy integration, and Johannes and I talked about long COVID, make it a little bit more specific about the topic. And so I wanted to talk about, as Johannes says, I'm a naturopathic doctor with about 30 years experience, specializing in homeopathy, homeopathic remedies, energy medicine. I'm based out of Southwest Lower Michigan, right on Lake Michigan, like I said. So I was at the beach yesterday, and I plan on going to the beach tonight. Actually, I got a concert at the beach tonight. So it's going to be a fun, long weekend for me. So yeah, I just wanted to share with you how I kind of work with clients. Like I said, I'm a naturopath, but I'm also a health coach. And I became a health coach officially about a few years ago with lifestyle prescriptions. And I've also taken the Real Balance courses and some other courses too, to make sure I understood what I was doing. I am certified too through NBH-HWC. So yeah, so it's interesting. We're going to talk about that today. We're going to talk about long COVID health coaching and how I integrate I call my doctoring with my my health coaching. It's like wearing two different hats and things like that. So we're going to talk about COVID. Basically, I'm going to minimize me so I can see. Okay, so I call in the beginning. So in the beginning, we talked about COVID. I mean, it's been about 3 years now, early 2020. I heard about, I think it was in January, this novel coronavirus was declared that it's beginning in China and coming into the United States. They were basically 3 symptoms back then. They were looking for high fever, coughing, and shortness of breath. And as it got more popular and more integrated throughout the world, they found out there was a lot of included loss of sense of smell and taste, and headaches and blood clots. So there was we all shut down in March, as we remember, the whole world, which I thought was truly amazing that the whole world was involved in this. So in the beginning, it was a lot of fear going on. When I'm talking to clients, what can you do? I was working with my clients, what can you do to prevent this? I was using homeopathic remedies and trying to not to get everybody into the fear-based mentality that was going on here that we were hearing about. So it was just very interesting to kind of know some of the things in the beginning from the functional medicine background of what was happening and what was not happening, so I began talking to my clients about this. So I sent out a newsletter in January of 2020. It was called Don't Be a Good Host. And that's because what we know about viruses is that they need a host. They cannot reproduce on their own. They need to attach to your cells before they can continue to live or reproduce and things like that. So once they get inside your tissues, the virus can copy itself, and then it can infect more tissues in your lungs and airway and making it more contagious. So then you're breathing it out and sharing it with others. So if you're not a good host, if your cells and your mucous membranes are slippery, they won't this virus won't attach to it. So I was talking to my clients on how to keep your mucous membrane slippery enough that the virus won't attach to it. And it was that was a very well recognized newsletter for one of the ones I wrote. So it was just interesting. So again, viruses need a host. If you don't give them a good host, they cannot live on their own. So there was a lot of fear about where the virus was living in the very beginning. Would it be on our boxes of our food and all that kind of stuff? So, but again, how does what we didn't know about this virus is that it was a SARS-CoV-2 virus, which was I call it gain-of-function virus that was evolved from SARS-CoV-1 from 2003, and it had these spike proteins that make the virus easier to infect our cells. So it has this little picture on the left here, those little spike proteins. Not all viruses have those, and so they basically can attach to our cells easier. And so the virus goes into the alveoli of our lungs, where the fluid builds up due to inflammation, causing the blood oxygen levels to drop, creating shortness of breath. So there was a lot of problems with blood oxygen going down into the 80s and people ending up in the hospital, putting on ventilators, trying to get their oxygen level back up. So there's more natural ways of doing that, and we're going to just kind of go into what we didn't know. So this SARS-CoV-2 virus, has these extra spike proteins that we need to deal with and be able to move less often. So some of the long COVID symptoms, some of the things. So I helped my clients, in the beginning not have COVID, but then I started after a while people getting long COVID symptoms where they persist for 4 or more weeks after initial COVID infection. So, or after getting the COVID shots. Sometimes I've had some clients, I know I had COVID. I didn't have it till like end of 2021, early 2022. And I had the shortness of breath and all that, those things, but it only the symptoms lasted about 5 to 10 days at the most. And then I was back on my feet, back to normal, whatever that is, by 3 weeks, and so like clients would call, how long does this take for it to go away? I'm not getting back to normal. I heard a lot about this, what do I need to do to get my energy back? So these are some things that, dealt with a lot as a functional medicine doctor, helping them trying to figure out where the energy was weakened. And so it was a lot of, a lot of fear, a lot of frustration, things like that going on. So, so I looked when it's a long COVID, it's basically 4 or more weeks. When it lasts more than a month, goes into, or people have reoccurring infections too. So symptoms of long COVID include brain fog. A lot of people can't think like they used to, can't remember, concentrate, memory problems, headaches, concentrated headaches, blurred vision, changes in eyesight, loss of smell that lasts a long time. Some people up to a year, they don't smell or taste something. Taste is also another issue. Nerve pain or twitching. A lot of people come in like they're nervous, like the whole fingers and toes are just twitching, almost like neuropathy, but not quite. Breathing difficulties, heart rate fluctuations, dramatic blood pressure swings, again, blood pressure going up and down. So a lot of cardiac and lung issues, which we're going to talk about later. And then long COVID after infections occur when early treatment was withheld. So sometimes when people were told to wait till it got worse, they got worse and they ended up in the hospital. So when they ended up in the hospital, it took a lot longer for them to recover because of some of the, because they didn't act on it quickly enough, and then it took longer for their bodies to recover. Also, some of the vaccines are causing some long COVID symptoms because they're not preventing the disease or preventing transmission of the disease, but they can come even if you didn't have any official COVID infections or don't think you did. Some people actually still have long COVID symptoms. We'll talk about why here in a minute. So reactions to the mRNA vaccines include strokes. The CDC has recognized that there's many more strokes in people over 60. They're monitoring it, so it's kind of interesting. They're monitoring it, but not doing anything about it. Pulmonary embolisms, blood clots, basically rashes from the some of the preservatives that are in the vaccines. Seizures. I've had 2 clients with seizures after getting the vaccine. Myocarditis. I've had 5 or 6. One very young, or five of them are very young, had myocarditis. They were told not to exercise for 6 months after having the vaccine. And even autoimmune diseases. Some people are getting reoccurring cancer that's been in remission, and they're getting cancer coming back after these vaccines because it affects their immune system. And so I'm talking to a doctor at a oncologist around here, one of his clients, and he says, yeah, they're seeing a lot more cancer, and actually blaming the vaccine on it, which I thought was super interesting. So what's causing long COVID? So, why does this happen? There's so many different theories about why, but these are some things I've kind of researched and just wanted to share with people. So one of the things I test for in my testing is inflammatory cytokines. Cytokines are signaling factors that activate our T cells. T cells are little, I call little green men, army men that kind of control or manage our immune system. And they don't work to they don't create the antiviral response. These inflammatory cytokines actually create inflammation. What happens then to the B cells, and then a specific type of monocytes are white blood cells, become elevated. And these monocytes are kind of the white blood cells that actually help, let's say, just kind of to determine how your body's dealing with an infection. It's basically what it is. And they found that 73% of monocytes carry the coronavirus proteins in the long COVID patients. So they're stuck in, those monocytes are stuck trying to continue to fight this infection. Also, persistent microscopic blood clots can linger after the SARS-CoV-2 infection. Once it clears, it should be clearing out quicker, and it's not quick clearing out the way it's supposed to. And then these clots can interfere with the oxygen delivery, can affect our brain and cause a lingering brain fog or poor memory issues. Then the third one I looked at, residual spike proteins lodged in our tissues can take over a year to clear after a serious infection. So sometimes if your body doesn't know how to clear, if it doesn't do a good drainage or clearing of detox, these spike proteins can stick in your cells. And each of the mRNA COVID vaccine instructs your body actually to create more of these same spike proteins. And when these excess spike proteins are continually produced, many of the COVID vaccine recipients continue to report long COVID-like symptoms. So it just doesn't go away like it's supposed to. And I put some of the references of where I got this information in here in case you're wondering. So, and then they're finding out that CDC is recognizing that all mRNA shots injure hearts of all recipients. So basically the mRNA spike proteins in the COVID shots travel throughout the body and accumulate in various organs and that end up expressing their spike protein long-term. So depending on how your body deals with these spike proteins, it can stay in your system for a long time. And according to CDC, all mRNA shots create elevated troponin levels. Troponin is a protein that indicates our level of heart injury, even if you don't have symptoms. So if you did a blood test after a vaccine, they're going to have elevated troponin levels, which I thought was very interesting. And then recent Swiss research found that the rate of subclinical myocarditis is 100 times more common than in clinical myocarditis after shots or injections and stuff. So again, they're finding out that it doesn't always show up, but it's there in people after they take these mRNA shots, because those shots are programming your body to create these spike proteins in response to hoping to fight off that specific SARS-CoV-2 virus created in, well, depends on what you talk about, but 2019. So I know we're not talking about nutrition here, but some of the things that I recommend to my clients, I don't do anything with any medications as a naturopath. I don't recommend, I can't recommend medications, so I'm not going to talk about those, but some of the things you may hear from people about what they do for treating long haul COVID symptoms. Basically, some of the things I recommend to my clients are vitamin C, a good quality vitamin C, helps calm inflammation, it helps get things moving in your body. It's a simple the other antioxidants are good too, but vitamin C plus, A and E are helpful, but vitamin C specifically helps prevent the spike protein from attaching to your cells. It easily makes your cells more slippery, as I mentioned, keeps the virus from attaching to your cells. Vitamin D is super important, making sure, I actually recommend my clients to get their vitamin D level blood tested, because if they don't have enough vitamin D, they're going to be about 60% more prone to viruses of any sort, not just the COVID virus. We've heard about dandelion extract. There's teas and there's herbs and things. Again, they help prevent the spike protein from binding to your cells. It's a simple liver, like a liver cleanse that kind of keeps things flowing. Also recommend NAC, N-acetylcysteine is a glutathione precursor. It really kind of activates antioxidants, so it works really well with vitamin C to reduce inflammation and increase energy metabolism. So if someone's super tired, these are some of the things I recommend. Quercetin, we recommended quercetin when you had the virus with zinc to make the zinc work better. Quercetin is actually helpful for the heart circulation. It's a flavonoid that combats the neurotoxic effects of the spike protein. It's used a lot for allergy reactions. So if someone's got extra allergies or weakness in the heart, quercetin is a great thing. And then the nattokinase. Nattokinase is a proteolytic enzyme from soy. And again, this is almost like a natural blood thinner you take in between meals to help reduce blood clots or the blood clotting factor. That's what actually made my COVID go away just in a few days once I started taking that to improve my oxygen levels. So that's been a big help for a lot of people who want to continue, especially who have continuing issues with blood clots or weakness in the breathing issues and things like that. So those are nutritional things that you may hear about from people. There are other things too. There's many different things people recommend, but these are some of the, I call the basics that seem to have worked over all the, the ones that I've worked with. So how do we coach for long COVID? See, we talked about that a little bit already, that, what are the common concerns that people have? And this even comes during this whole pandemic time. People come in, they're tired, people loss of ability to do what they used to do. Even if it's at the bottom, where did I say that? Oh yeah, the fifth one down. But with this whole pandemic, we lost of certainty. Our lives have all changed. We have this fear-based type of thinking nowadays, and lots of frustration that things are not where they used to be, especially with children in schools, and they feel like they've lost some of their I call the innocence of how the germs, how germs are spread between people and things like that. But yeah, with adults, loss of energy is a common symptom. Ability to do what we used to do. We don't have the energy. We're not recovering the way we want to. Lingering mental fatigue or brain fog. Again, with our brains affected by some of the spike protein, and that gets into the system and doesn't want to get rid of it. And so it can affect our ability to think and our just cognitive ability to do what we need to do with our memory. Continued breathing issues or weaknesses. I still work with clients a lot on breathing issues. So we're looking at what can help to improve their breathing, even besides any supplements. You want to look at, I call breathing exercises. I read a couple books recently, one called Breathe, and how important it is to breathe through our noses instead of our mouth. And I'm breathing through my mouth right now when I'm talking, but when you're sitting quietly, you should be breathing through, or sleeping, you should be breathing through your nose. And that's one way of making sure that you're actually, we have filters in our nose to keep the virus from attaching in there better than we do in our mouth. So if you're breathing through your mouth, you're more prone to getting the virus to come into your airways, because your breathing is indirectly. So breathe through your nose. I'm actually going to be teaching a class about that. It was just requested by a few people to teach a class about that. So anyway, trust issues and medical treatment options. Sometimes a lot of people come in, they said, they felt like they weren't listened to by their doctor. The doctor didn't do what they wanted to do, didn't give them treatment options they wanted. So they felt like they were not treated well, and some of their lingering COVID symptoms are because of that. And then, of course, loss of certainty since the pandemic. This is, everyone's been affected by this excess fear-based thinking and this frustration that we've all had of, everything shutting down and having to regroup. And, I was not even sure I'd have a practice after it was done, because I thought we'd be able to do this again, and things all shut down for a while. But things are going really well, and things are coming. People are coming back. They're looking for help. They're looking for help from people who can help them understand themselves and things like that. So, and then loss of ability to function in life as desired. So, again, sometimes people are not able to, with their jobs or with their schooling, they're not able to function as they were before, if they've got long COVID symptoms, or are not healing the way they're supposed to. So these are some things that are things I've worked with coaching clients who are I take off my doctoring hat, which I'll talk about in a minute, and turn on my coaching hat. So common beliefs I hear people say to me, I thought I was strong enough to deal with this. People who are, I eat right, I do all this stuff, but I still got it, that kind of thing. That's how I felt. I mean, kind of glad I actually got it when I got it, because now I can be more empathetic to people. I don't tend to get the flu and that kind of a thing. So I haven't had the flu in over 30 years. So I don't usually get sick, but I did get sick because I actually put my guard down. It was Christmas time. And dealt with it and got exposed to it 4 times before I actually got it, and directly. And then when I had it, I totally understand, how long it took to actually come back from it. So, I thought it was stronger. I could fight it off, and I couldn't. But that's actually a good thing. I'm glad I had it, like I said. Anyway, but it only lasted a few weeks. Few days, actually 3 weeks to actually recover. So a lot of people are, they feel like they lost some of their integrity because they thought they were healthy enough to deal with it, and it's taken a lot longer to heal. So I hear that a lot. And it took me down and taking longer to recover than ever before. And again, the same thing is that it's just taking longer to recover. Or if you get recurring COVID symptoms, some people have had it 3 or 4 times, 3 or 4 different variants. What are you supposed to do about it? So I always say coach through the regeneration phase. We talk about the stress phase where the body is in stress phase, but when your body goes through regeneration, this can take time. It's not something that, and that's usually when we get symptoms of fatigue and inflammation and congestion and that heart issues, things like that. So we want to let the client know that, and this is part of the major coaching part is coaching them through. They understand they have to take care of themselves at this time to actually regenerate their tissue so that they can again go on to their healing phase. This is the healing, I call it part of the healing phase is the regeneration phase, regeneration of tissues. So this is coaching for long COVID. So in lifestyle prescriptions, we use this organ, mind, brain chart. I think you can download it if you're part of this coaching, if you don't have it already. And this is just a part of it that I cut out of there. And we're going to look at the heart and lung part of it today, because that's kind of the most common symptoms of long COVID are related to the heart and the lungs. So basically the heart muscles, the myocardium, that's where people have the myocarditis. The complex theme of that is feeling overwhelmed or overloaded. So with, again, with this, I think just about everybody had some overwhelm of, what's the world coming to when we got into this long COVID 3 years. It's been almost 3 years before it totally has gone away, supposedly. And so the kind of feeling overwhelmed, and that can just by itself can cause stress in our bodies. So when you add other things to it, the reaction, the myocarditis of some people getting that, and then some people with this, the heart issues, the weakness in the heart, and all this can actually add issues to it. Then there's the coronary arteries and veins not feeling loved or loss of territory. So coronary arteries, again, the blood flow, they have to be strong in the heart, right around the heart, to keep the heart strong. So not feeling loved or loss of territory. So we've been isolated. That's another issue. A lot of people are coming back to, being near people again. We're trying to stay 6 feet away from everyone. That's been an issue, that kind of a thing. So then lungs, there's different parts of the lungs here. So there's lungs, bronchial mucosa, again, territorial fear or scare frights are, again, fear and fright. There's been a lot of, that can cause a lot of breathing issues on its own, a lot of congestion in your bronchial tube and heart trouble breathing. Then there's the lungs, bronchial goblet cells, suffocation, fear. So again, fear, having trouble breathing again, feeling suffocated. That's when I had the low oxygen levels, I call hyperventilating. Basically, is what I was doing. That was not that was fearful. I was telling my daughters, like, just watch me. Make sure I'm not, don't faint or something like that. And then lungs, alveoli, again, death fright. Again, fear of death. Fear of fear of not being able to breathe again. So these are some parts of the organ, mind, brain chart that relate to the heart and lungs. We're going to look at that more specifically in the next couple of slides. So the heart stress, again, the emotions for heart stress is overwhelm, lack of enthusiasm, and vitality. So not feeling like you have enough energy it's part of the heart stress, because the heart's continuing giving you energy every time it pumps. Psychosocial stressors, the myocardium, the heart muscle. Low self-esteem, especially regarding efficiency of the heart, questioning the survival due to weakness. And you can see how that would relate to some long-term illnesses and even this, the COVID issues, things like that. So again, survival, weakness, feeling like if you've got myocarditis, they tell you can't exercise for like 6 months because it's too hard on the heart muscles. So it's again, it's a weakness in there, and you have to help people come back from that. Coronary arteries, loss of boundaries, vitality is reduced, not feeling loved. Again, feeling isolated from each other, that can affect the coronary arteries. That again, another thing that we dealt with COVID is this, the isolation stuff. So you heard these are some expressions of heart stress. You nearly gave me a heart attack when someone says that. That's related to this heart stress. I was worried to death. I try to tell clients not to say things like that. It's like, no, it broke my heart. People have died of, broken heart syndrome because they again, being loss of touch, things like that, from being isolated from each other. So again, all these things can cause heart stress over and above, just the virus and things like that. So things that work with just about anybody that you meet related to health coaching is helping them keep their heart healthy. It's very important. Then there's lung stress. Again, grief, sadness, detachment. In Chinese medicine, each of the organs is related to an emotion, and in Chinese medicine, grief is the emotion related to the lungs. It's again fear of death or suffocation, fear of being prevented from expressing yourself. So basically not being able to say what you want to say, and just suffocating your energy, that kind of a thing as part of the lung stress. Or especially say that that person takes sucking air out of me, they're taking all my energy. That's again, lung stress, you have trouble breathing, both not just physically, but emotionally, and mentally, you're not able to express yourself. So again, that can affect your lungs and help you hold your breath. So find out when you're holding your breath, if you're stressed out or you're holding your breath, you will be affecting your lung stress. So why do we do health coaching? So why is health coaching important in all this? So basically, I think it's super important. Doctors have their place, but health coaches are super important in supporting the client and understanding where they are. And we're going to go into that here. Health coaches zero in on the behavioral nature of health to promote personal awareness of possibilities available to create transformation. So basically helping people understand who they are and what they can do to they express themselves better, but to live with intention. We're going to talk about that here in a minute. So doctors and even naturopaths can prescribe. I don't prescribe, but I educate. So I can't legally prescribe or treat as a naturopath. Doctors can. I educate, educate clients a lot and help them make better decisions, I hope, as a doctor. But it's not the only thing that we need. We need somebody that can help the client get engaged to actually improve their personal awareness of their specific health and heart habit triggers. So what's causing them maybe not to heal, and trying to help them figure that out is what I figure health coaching is doing. So you listen to your client and you hear them tell you their story and their triggers and things like that, and relate to that. So on the right here is I call the subjective units of transformation scale, finding out where they're at when they're starting off, and then finding out where they want to go. So your transformation is going to transform them into better than just neutral health, but into improved health. So when I look at coaching for wellness, I borrowed some of this from different places. Some of it's from Real Balance, from other places. There's 5 focuses. One of the things I look at is first, I was building self-efficacy with my clients. I try to help them understand how to live with intention. And when you live with intention, you help them to live a healthier, more active, and more conscious life. So being conscientious is, I've read about that, is very helpful in keeping you healthy. Is basically being conscientious about what you do, doing things with intention. Being conscientious is doing things the way you should be doing it right. When you do something I go mediocre, then you're not again progressing the way you're supposed to. So living with consciousness and intention is helpful. There's Ellert Bandura's four ways of enhancing self-efficacy. Here, his areas of helping clients understand where they're at. So mastery experiences, acknowledge what they've done before, how they've been successful before. How was their health before they got sick? Start with small successes. What have they done before to be right, to move in the right path, and then how can they continue to move forward, track their progress. Some of us I wear a couple different, like a Fitbit, just to see where I'm at. How many steps do I walk a day? And that actually, my Oura ring tells me my respiratory rate, which is actually how I found out I had COVID, because it told me my respiratory rate was super high. And I had a fever, and I'm like, oh, okay, I was sick. So it actually told me I was sick, even though I wasn't feeling good. It told me I was sick. So I could progress, and then came back to normal pretty quickly. But it was interesting that with technology today, we can actually track progress pretty much. And a lot of times they'll even tell you your pulse oxygen level in some of these things, so you can find out where you're at and track progress. And this helps clients measurable. We want measurable reactions to things. So being mastery, helping them know where they're at, where they've been successful before, and then continuing with mastering their lives is super important. Vicarious experiences, observe someone else to perform the task you can identify with positively. Find a role model, and again, finding out people have been successful before. What have they done? Research that. Help others research them. Who have they seen? Their clients seen that has been helpful before? In helping them get better. What have they done? Verbal persuasion, again. Giving constructive but encouraging feedback. So again, acknowledging where they're at, using positive psychology. When clients see progress, they will continue. So even just a little progress, they will see it continue, where they can do more than they did before. So again, measuring their reaction, and then encouraging even the small gains is very, very helpful. And then physiological states, again, physical state affects our confidence level. So are you, I call acting like a depressed person, or are you acting like someone who wants to go out there and make changes physically? So are you physically, sitting up straight, I call it, or are you kind of just slouched over and not happy about things? So even just physically moving your body so that it's actually, in a more positive state is helpful for self-efficacy. So that's number one. Oops. There it goes. Number two, coaching for wellness is nurture vision and intrinsic motivation. Okay. Again, assess the current level of awareness, find out where they think they're at, and where they want to go. Envision and determine areas of focus to work on. So what do they want to focus on? Again, we're looking at the client's agenda, not mine. We're looking at what they want to work on, what they think they can do. Factor in key elements such as readiness for change. So where are they on the readiness for change scale? Are they, they may not be ready for action yet. Are they contemplating where they're at, or even pre-contemplating? Again, finding out where they're at, finding the pros and cons of what they're doing, pros of, what's working and cons of what's holding them back. So again, get client thinking, why do they want to regain their health? What is their reason for living? That's super important in coaching somebody, finding out why they want to be healthy. Again, whether it's, with their family issues, their own issues, they need to take care of themselves. Why do they want to regain their health? What kind of goals in life? So I had a client a few weeks ago with cancer, and I asked him this. He didn't know. He just, it's like, he doesn't think he's going to have a life, so he doesn't even want to think about it. But again, we need to think about that. What is their attitude toward their significance and success and their ability to influence? So what is their attitude? Is it a positive attitude? Is it a negative? Do they want it? Some people want to be told what to do, but we want to get people to understand that they are the ones making the progress, and they're important in proving their significance of themselves and their success. So I know in Real Balance they talk about the well life vision, and this is some of the questions from that. So what would your life be like if you were living to the fullest, healthy, well, and functioning at your very best? So what is the ideal life that you would be living right now if you were healthy? Where do you want to be? And that's super important to ask. What are the key aspects of your vision? Doing more of, or doing less of? What would you want to be doing more of, or what would you let go of? Like, what's not important in your life that you might be doing right now? There's some things that are not significant enough. You just want to let them go. What do you want to do more of? What would you like? What would you look like at your ideal level of wellness? Again, physically, mentally, emotionally. What would you look like? What? How would you act? Who would you be with? We're going to talk about connection here in a little bit, but again, what would your life be looking like? And I think this is important. So if you have a way of knowing where you're going, it'll keep you progressing in the right direction. Focus on skills and capabilities is number 3. Listen for useful attributes they can use on their journey towards a healthy and happier life. So basically, what are the skills that they already have? What have they done successfully before? What can move them forward on what's going on? Listen for habits, practices, and patterns in 2 categories: the ones that clients are aware of and what they are not aware of. Some of the fun things I find out when I'm coaching people is helping them realize, what they just said about something they're interested in. What they have been aware of, maybe not aware of, but they've been successful with before. So I said, we said you've done this before. Is this, this is I think it was a client I had this last week. I can't remember what she said. I caught her, I caught her. I didn't caught her, but I listened and I heard what she said. As I reflected it back to her, and she's like, "Well, yeah, okay, that's true." So it's kind of I call it a kind of a listen for their skills and what they're not saying or not thinking they're saying. So explore with clients what they want to understand about their lives and behaviors. Stimulate new ideas and challenges. What are they curious about? Again, when you listen to them, you can hear them say about these things. So it's very interesting to see what their interests are and help them create this passion for what's going on. Focus on what they can accomplish, realize, and create. Again, what do they want to accomplish? Go back to the life vision, help them use their skills and capabilities to accomplish what they want to and create what's possible. What's possible in your life, and using those capabilities to move forward. And number 4, again, we're not perfect. So create relapse prevention strategies. So we're all going to go kind of up and down in our healing process. You know, where some days are good, some days are not good. So you want to be empathetic with clients. Like I said, I was kind of glad I got COVID also I could be more empathetic. If I didn't have it, I wouldn't really know what it felt like. So you want to understand their world, you know, what's going on with them, appreciate them with no judgment, or, you know, just not judging what, because again, people are going to think differently. You might not agree with everything I said about COVID, but again, you have to understand where they're coming from, understand their feelings, and communicate that understanding so they understand that you understand what's going on in their life. Follow the emotional energy. Again, notice what they're passionate about, what they're excited about, what they're committed to, what is their motivation, and what challenges do they have in the way of success. Or they say, well, I want to do this, but, you know, what's the but? You know, but is the challenges in a way of success. You know, if there's a person that they're blaming, or if there's other issues going on, you know, what are their, I call it, Dr. Eamon, I studied with him, he talked about the ants, the automatic negative thoughts. Look at their self-talk. It's one actually lower down here. You know, listen for their self-talk. Is it positive or negative? Are they talking to themselves? Are they blaming others? Are they judging others? Are they saying, I always do this wrong, or I never get this right, or something like that? Those are called ants, and the automatic negative thoughts. So you want to help clients override some of those, understand that. So change is not a simple logical process. Clarify the qualities they hope to get to related to their values and goals. So again, helping them, again, seeing where they're progressing, weekly or whenever you meet with them monthly, just basically make sure that they realize where they were and where they're going, and how they can actually, when something they do get in trouble, what they can do. So develop strategies for overcoming challenges, new insights or perspectives, what worked in the past and new possibly something they might not have tried before. And then the 5th one is community and environmental support. So again, with this COVID pandemic, we've been isolated from each other. I'm so glad we're all back, coming back to meeting with people. But we need to be healthy family and friend connections. We need to have connections. And then one of the biggest things they're talking about now is this loneliness factor, which can cause heart stress. And one of the major causes of heart attacks is loneliness. And because we've been isolated, that's been an issue. So even as a health coach, you can help the person not be so lonely. As a goal as a health coach is just acknowledge them, be there. If they don't have anybody else to be with, you can be their health coach, whether you're online or, you know, in person, things like that. It's better than in person. I totally believe that. But even online is helpful, you know, just someone to talk to, someone they can relate to. Healthy work environments and communities. Again, look at your people that you're hang out with, but in your environment. Is your environment conducive to your health? Is it, you know, where you want it to be? Is it, you know, you're breathing clean air and drinking clean water? We're not talking about nutrition here, but, you know, it's just looking at the work environments, communities as a support of your health. Connect with people who will encourage you. You know, again, if you're with negative people, you're going to become more negative. So again, being the coach that's, you know, the positive aspect in their life may be the only one that they have, that they can understand that they can be helpful. So that's very important. Identify and recruit sources of support for the journey. Again, I always ask my clients, who supports you? You know, who do you have somebody that you can talk to? Do you go someplace, you know, there's a group of people that support you, whether it's a church group or a community service group, or even a community centers, things like that, someplace where you go to get support for your journey. Secure accountability methods to ensure success. Again, as a coach, you want to help them, you know, be more accountable. That's why a lot of people come to me for coaching. They want to make habit changes, and they can't do it on their own, you know, and so a lot of us can't do it on their own. So again, what can we do about this? So basically, these are I call the 5 focuses for coaching for wellness. So, for example, coaching for heart issues, you know, the conflict, myocardial muscle, feeling overwhelmed. I can't handle this situation. This goes beyond my capability or capacity to heal. So again, people have this conflict and it's affecting their heart energy. So you want to reframe the situation. These are some things you can do. You can help them understand that they can handle the situation if they can get them to basically understand I can handle the situation if I approach it systematically with curiosity and a plan. So again, looking at the way of progressing the way they're supposed to. So break down the situation into smaller parts to deal with and integrate. So again, creating small changes over time so they understand their progress. And then get a bigger picture of the situation to help them decide what to prioritize. So if there's a lot of little things, depending if they're chunking up or chunking down, you can find out, where they want to be again with their life vision, things like that. And then understand as a health coach, you're there. I don't have to do this all on my own. I can get help. So you're the help. They're part of the help that they're going to get with this coaching the heart issues. So this, I believe, is one of the last slides. Anyway, long COVID health coaching overview here, basically. So focus on their specific needs. Again, there's a lot of things we can do to help the client, to help them build a self-efficacy. Tell them to live with intention. Are you living with intention? Even when you exercise, what's the goal of exercising? Are you exercising just to exercise, or are you exercising to build up your heart health, or you're building up your lung capacity? If you're doing breathing exercises, are you progressing the way you're supposed to? Things like that. Nurturing vision and intrinsic motivation. Find their why. Why do they want to be healthy? Again, we all have reasons for that, various reasons. It's always interesting to find out, and to help the clients understand who they are, where they're at, why they want to be healthy. That was something I never did before, really, as a functional medicine, and find out their why. But now I totally switched that to actually helping them. Why do they want to be healthy? Where are they going? If you have a roadmap, where you're going. If you don't have a roadmap, you can be lost forever. So again, where are they going? Focus on skills and capabilities. Explore what they can accomplish, realize, and create. Again, what do they want to create in their life? What do they want to realize? And again, even if some people say, well, I really don't know, just pretend. What would you want? What would your life be like if you could have what you want? So focus on skills and capabilities. And then create relapse prevention strategies. Again, tactics to overcome challenges. So we all have challenges in life. Things don't always go the way that we want them to go. And again, understanding where they are and helping clients understand where they are is super important in coaching clients and helping them understand what they can do. And then reminding them again when they come back and say, oh yeah, I should have done this, or they again reminding them that they can do that. And then community and environmental support. Who can they count on? Besides you, as a coach, you're not going to have you forever, but who else in their life can they count on? Who can they go to listen to their needs? So this is, just an idea of how you can, do your the health coaching and helping with long COVID, but any type of illness that's going on in your life. Combining, if you do a therapy, like other types of therapy, talking to your clients as a health coach so that they, again, can progress in the way that they want to. So I want you to thank you for participating in this health coaching summit. It's, it's actually listened to some of it, and the last few days it's been great. Again, my name is Jane Oelke. I'm a naturopath in Southwest Lower Michigan and stuff. So thank you for having me. I'm going to stop my sharing, and I'm going to look for the chat box and see what I can find here. So if you've got questions, please send them to me. I'm trying to find my mouse. I can't find my mouse. Huh. Shoot. Okay. I can't stop the share. Okay. Here it is. Okay. Okay, I'm back. So let's see if there's any. I'm looking to update the chat box. I can. I don't see anything. So, any questions? I don't see any questions. Okay, I'm not sure. There's about 10 minutes to the next hour, so let me see if someone comes in. Okay. Yeah, we're talking about other types of modalities that can work with health coaching. I've worked with one client or one practitioner who was a reflexologist, and he always told me, as a reflexologist, people will tell you your life story. So he said, I wish I did health coaching back then because I could do I could, while I was massaging their feet, we could actually do health coaching. So some other modalities, like not just naturopathic doctors, but other modalities can actually go on, as I say, basically help with health coaching. Massage therapists, I'm not sure so much they are focusing on helping their clients, but a massage therapist could easily add health coaching as an adjunct therapy. I do some pulse electronic magnetic frequency therapies, scalar energy, right frequencies. And while they're doing that, I've done some health coaching. So it's kind of a double duty. So we can actually help with that. So I know there's a lot of, like say, basically health coaching modalities that can work together with other therapies. So I don't know if you have, again, we have to change our hats, so we go from basically, I let my clients understand that this is going to be a combination. If we do the pulse electronic or scalar right frequencies while they're doing the right frequencies, I'm actually health coaching. It's almost a double session. They're getting two benefits, both the energetic frequencies, and they're also getting the health coaching while we do it, because I do one for sugar addiction. And it's very interesting. So it's 40 minutes of 40 minutes of the the 40 minutes of the session of doing the reduction of the sugar addiction issues. And then while we're doing that, we talk about why, why they have sugar addictions, why do they have issues with that? And basically, we're just trying to help them out with that. So I just want to let you know, yeah, there's, we got about 10 minutes, and I don't have to see the chat to see what the questions are. I'm looking to see if I can find out. Oops, I turned the chat off. Okay. Anybody got any questions? I can't look at the chat. Let me see if I can find the chat link. Oops, that's not it. Well, you can see me, but I can't. Okay, so lately for the health coaching. Here it is. Okay. Looking at it now, so see if I can find the chat box. So, oh, here it goes. Okay, so now I shouldn't be able to. Oh, here's a live chat. Okay, so now I found it. Okay, all right. How would you deal with a post-COVID client who has already a diagnosis from his doctor? Okay, PTSD. Okay, should we start with the from where he's at now? Okay, we definitely, well, yeah, again, find out where he was at, where he at now. PTSD, again, that's part of the fear-based things that are going on in their life. Yeah, so basically, it's a lot of fear, anxiety, looking at that. That kind of a thing. So I can see where that, yeah, start off where they're at now, finding out where they're at. If they have a doctor's diagnosis, that's helpful, so that they understand that it's not just in their head, that there's a physical thing going on. So basically, then you can focus on where they're at. Okay. Oh, wish we'd slow down. I always talk fast, but I only hit an hour. So, okay. Let's see. Let's see. I always talk fast. So let's see, I don't see any other specific questions going on here. Oops. Oh, am I not recommending to get COVID boosters? That's up to you. People can do what they want to. I'm not, I'll say I'm not vaccinated at all, but I'm sensitive to vaccines, so I can't. I know I can't, and there's a lot of people who can't take them safely. So yeah. So you can decide what you want to do. Even your clients can decide, again, if they just think it's important, let them to take them. But again, caution them that not everybody is. Some people are having reactions to them, and they're being recognized. So that's, yeah. So other questions? Let's see. Yeah, it's some of the using the therapy for the PTSD trauma, again, coaching for anxiety, that kind of thing, looking where it's showing up in their body, showing up, in, well, maybe not just in the maybe affecting the adrenals area. Again, focusing for energy, how they can look at their sleep patterns, looking at whatever they can do, breathing patterns. Breathing patterns are super important in reducing anxiety. Like I said, there's a book I was reading called Breathe. And called Breathe, and then there's another one called The Breathing Cure. There's two of them, similar but different, and they're both very good on breathing and how important it is to breathe well, especially for PTSD, anxiety, depression. When we're stressed out, like I talk fast, if I'm on caffeine, I talk even faster. So, but again, looking at what's called triggering your issues with that kind of a thing. So basically, we're looking at different things like that. So I'm hoping you're, what else? As a nurse clinician, your presentation was excellent, very clear. Oh, thank you. Concise and full of important portions. Thank you. So I'm just trying to read the chat here as I'm going. So basically, yeah, so we're just about up to the top of the hour. We've got a few more minutes. But yeah, I'm glad we're done with this pandemic, basically, and just kind of stay healthy. We still need to stay healthy. We should keep our clients healthy. We can't just let our guard down now that it's officially over, supposedly, so I don't know if it is, that kind of a thing. So basically, we'll just kind of keep ourselves healthy. And that's the base, keeping just when we know we're on the right path and we're progressing, we're keeping control, we feel in control of our life, we're going to be healthier and living with intention. I think that's the big thing. So okay, thank you for sharing your experiences. Okay, thank you. Okay, thanks for the resources also. Okay, go. All right. Yeah, so you'll have some of the information when you can watch this again later. There's some references here. So I know it's about 3 minutes to the next client or next presenter. We're going to probably be taking a break here in a little bit. Let me see if I can put this down. So I can see me. Okay, so now I can see what you see. Oops, so I can't do that. I'm going to stop that. Okay, sorry, but now you can see me with my glasses. So basically, we're going to go on to the next presenter. I'm going to introduce her, and let me stop this. Okay, back. So, Johannes is busy trying to get to where he's supposed to go. So I'm going to introduce Cathleen Beerkens. And she's the founder of Wellness Revolution. She's a teacher and a health coach, and she's going to be speaking to us about how to help our clients manifest. I don't know if she's ready. Are you ready, Catherine?
Yes, thank you so much. Thank you for the presentation.
Oh, good. Yeah, thanks for being here. And I know we've got a couple minutes. I don't know if you want to start early or if you want to wait a couple minutes.
Well, I think we should give everyone a break, right, for a minute?
Yes, we should. Yeah, 2 minutes.
Yeah, okay. I come in 2 minutes. Great.
Okay. Well, yeah, 2 minutes. We'll give everybody a break, take a break, go get some water, and have a good, healthy weekend. Thanks.
Hello, everyone. I'm so delighted to have this opportunity to speak today on one of my favorite subjects. And I must say, learning to manifest is what we're actually here to do on the planet. And it is amazing because it took me many years to realize that was what so many people were longing to do. And I think I have really, I'm definitely trying to be the example in my own life. And I think that as a health coach, and I'm going to end the presentation. I think that's what we have to do. Ultimately, we have to be the leaders in our own life. So I'm going to share my presentation and get started. And I just want to say thank you to all the organizers of this. I think it's really wonderful that we do this and we share our information for everyone to learn from. Okay, so let's get started. How do we help our clients manifest? And what does it mean anyway to manifest? And I love this. What I think and feel and speak, I manifest. Now, actually, the word abracadabra in Hebrew means I create what I speak. So we are creating all the time. We just are growing right now in consciousness to understand that. I think each of us are our own level of understanding this, but we are learning this. So what I want to cover today is, what is manifestation? What does that mean? What does it mean to manifest? What are timelines? What is the cycle of creation? I'm going to talk a little bit about science, look at quantum physics, looking at our life stories and our roles that we use to create. I'm also going to talk about the importance of the conscious and the subconscious states. I'm going to talk about the moment of now and how we help our clients to change. How do we really do that? Because if they stay the same and we stay the same, nothing will change, right? So how do we do that? We're going to look at all those things: beliefs, values, perceptions, thought forms, feelings, emotions, decisions, actions, and behavior. And then, of course, reviewing the science of manifestation and having a summary and any questions you have. So let's start. Manifesting. What does it actually mean? Well, it means that we bring an experience or something we're wanting to happen into form, into our reality. So by putting an intention in the field and working with learning to kind of be in charge of your own energy, you make a vision and you dream and you become in alignment with that, and it becomes your experience. So that's what manifesting is. Now, we are always choosing the timeline that we'll manifest in, even if we're not really conscious of that. So we're on a line. Let's say we have goals, like as health coaches, we have goals, but we have, every day this is happening, every second, with what we think and how we feel and how we direct our energy is going to determine what timeline we end up coming to in our life. So people can say, well, what is a timeline? Well, they are like different roads that offer different opportunities and possibilities that the soul can choose to experience. So it can be anything you want. And most of the time in the past, we weren't even aware we were doing this. And so often we had, and it still happens today, people have a lot of things showing up in their life and they're not happy with what's showing up. And that's because they're not aware of the power of their own intention in the whole process. So I think in my life, many of my clients and many of the people I've helped have come for this problem. They're stuck. They don't like what's showing up in their life and they want to make changes. They just don't know how. And one of the things that I've realized in my life is that we are spiritual beings having a temporary human experience. And I can say this for myself because I was a nurse and I learned this very young when I worked with cancer patients, but it was very intense, to see people suffering with all these diseases and realize that they had such a limited time and that they had a lot of things. I worked on and had a neck floor, and they had a lot of things that disabled them. They couldn't talk, they couldn't speak. They were really in struggles to just survive. And I realized then that we are not our body, but we but we have to take care of it. It's like, this is just a car, an automobile, and we have to really take care of it. And we're not very good at that. And we should, and this is one of the things I believe health coaches will lead the way in. So what are we really? Well, and science is showing us that we are energy, we are consciousness. This is a big word. All energy has different frequencies. Everything in the universe, everything in our world has a different frequency. And all frequency is vibrating at a different rate. And so our very way of thinking, our way of being, our way of feeling is going to bring to us or not what we would like to have come in our life. And so one of the laws of the universe is you can only really attract what you have become. And this is a very powerful statement, but it really is my experience. So if people are not peaceful, but they would like peace, it doesn't work, right? And if you would love to have a really abundant life, but you always feel you're going to lose money, or you don't feel you're good with money, or whatever you feel about your relationship with money. These are just two examples, but there are many. I could spend a whole day on those, on all the thoughts that we could have, right? So John Hagelin wrote that, we are the creators, and that's really a big concept, not only of our own destiny, but ultimately we're creators of the universal destiny, and really the creators of what happens in the universe, not only on Earth, because we're all interconnected. So we create our reality is a huge concept that we're just starting to understand in a really more holistic way on this planet. And it isn't an easy concept to live it. Like, we can understand it and we can know it on some level, but to become it is quite another thing. So one of the things that is important when you work with your clients is to help them to connect to everything and everyone, to understand that they are unlimited, that they're not, many come and many believe that they're limited. They think that what is showing up right now in their life is what is always going to show up. And this is what the hand they're dealt, and this is, they can't see a way out. And so asking, like, who are you? Who are you? That is a really good question, because it helps people to start to go back, like, yeah, who am I? And of course, we all go through it all the time. We answer that question at different times in our life. But sometimes when we're in these moments, when we don't know where we're going, it's a good question. And the next question is, what do you really want to experience and create? Because, that I notice is a huge issue. People are stuck. They don't know where they want to go, but they actually don't know where they want to go. So they have to do some digesting. And what happens, and we're going to talk about yin and yang in a minute, but what happens so often in the society we live in right now is it's so hectic. It's so crazy. It's so busy. We get so overwhelmed, and it is making us distracted from what we're really here to do. And so most of the time, people come and show up in my life, and that's the question they're not sure about. When I ask them, well, what would you like to experience? This is what you have now. This is what's showing up. You have a job you don't like, or you have whatever it is. What would you like? What would that look like? And they haven't thought about it. It's really difficult to imagine. Well, one of the things about energy, and we are energy, it's always emotion. So we're constantly changing these timelines, even if we're unaware. So the old you and the new you, you're never the same. It's like you can't go back in time, really. So when you go back and talk about the past, there might be a value in that. I think in psychotherapy there is, but for coaching, I hardly ever do it, because really what matters right now for you creating your life differently is you thinking about who you are right now, the new you. And so that's going to be the new timeline of you. And so we create with two forces of energy. One is yang, and that is really outward movement, very light. It brings it, you go out into something, you think of something, you make an intention, and it's movement, it's action, it's you doing things and expressing your consciousness in life. And examples of that would be like exercising, or like what I'm doing now, speaking, buying a house, creating an art project, whatever you bring into the world. Yin, that's a whole different energy. It pulls in, it's dark, it actually is the form and the digestion that comes after. It gives feeling about what you have created. You become conscious of it. You integrate what you have brought in the world into yourself to become something new. Now, we do this every night when we sleep, when we meditate, resting and digesting. This is yin energy. I love these pictures. It really shows the energy in a different way. But this is important for us to understand as we are health coaching, because there is this cycle of creation. And so often what happens is we do not, and this is really intense, but we do not even realize we're in these cycles. And so yang cycle would be, you think of something you want to bring into the world, you make an intention, you start going out there, you do the work, you make goals, you go start doing it, you take that ad for the new job, you go show up, you do the new job, start a new exercise or whatever you're doing. And so you do all the rightful action, and eventually you manifest what you wanted to manifest. But the thing that happens so often in this world is either we get distracted and we never stick to it, and then we don't manifest because you actually have to stick to something in a way, because you'll just jump a timeline and it won't show up. Or we get caught that we don't rest and digest. And if we don't rest and digest, we lose a lot. This is not balanced. And some people have, for instance, they go out in the world and they start to create something and they have something bad happen, or something happens that they don't like, an outcome that is not what they expected. And then it's very difficult for them. They're in yin, and it's very difficult for them to go back in the yang. They're fearful of going out back into life. In a way, we saw this with COVID, right? We were forced into yin. We were forced into resting and digesting, and not being able to go out there and interact with everybody. And so these two energies we're always interacting with, and both need to be balanced. They're all different. When people are young, they're definitely more in yang than when they're older. But the reality is we need to help our clients with where they're at. Like, what is it they need? Do they need to rest and digest, or do they need to go out and create? Where are they? And some people are constantly jumping. So what they'll do is they'll start a project or an intention, and they have like a lot of intentions, but they never do any of the rightful actions. That's also something that can happen. So what can we do as health and wellness coaches? Well, we can inquire and explore about this cycle. So with manifestation, we can ask questions like, what are you trying to manifest? How motivated are you to manifest this? And what are you resisting? What's coming in the way for you to see that this could be a possibility? Digestion, we can ask questions like, how has this been for you, this relationship or this job? What does acceptance of losing this job look like or feel like? And what have you learned from having had this job? That's a really good question. So these are different focuses for where you're at in this creative cycle. Ultimately, consciousness wants to expand. And as a health coach, we're really helping our clients to become more aware, to see more of possibilities, and to expand their container, to grow. And the thing is, you can't actually make this leap until you're ready for that leap. And that's so often what we see, like a real fear of growing someone's container, because it takes responsibility. When you do take the jump and you do make the leap, you are taking on more in a way than you did before. And so you have to be able to contain it. So how do we really create the story we want? This is so often what we are asking. Quantum physics is really showing us something. It is a beautiful, I love the science. I think it's so amazing. It is the understanding of the nature of reality. And we have to understand at this point that we are just learning. It's like baby steps. We're just starting to understand. It's fascinating. But quantum physics is the study of matter and energy and its behavior at the atomic and subatomic levels. All matter has a kind of rest energy, a theory of relativity. Quantum physics looks at how energy at the atomic and subatomic work. And we call this, or they call this, the quantum realm. And it sort of is strings and strands of frequency. And the quantum realm is also called the universal field. So in physics, they explain that. And I love this. They say, there's another world beneath our fingertips. You can't see it. It's far too tiny for that. But beneath the level of the cells and molecules, beneath every level of atoms, the quantum realm obeys a completely different set of laws. And this is what we're just really starting to understand. Now, John Hagelin also writes about physics, and he says there's been a big progress in theoretical physics during the past decade. And we're starting to understand that this universal field is based now on superstring theories. So he identifies the universal field as a phenomena in the universe, and also neuroscience is starting to show this also. And I love this picture because it's sort of like, if you can just put yourself there, we're always dealing with this field. We're always in it. We're not separated from it. It's us. And so it's an ocean of pure existence. It's an intelligence, and it sort of is constantly bringing into reality many things that we as a collective and we as are co-creating, let's say. So our consciousness, what we do know, and this is what quantum mechanics and quantum physics are showing us, our consciousness has an impact on matter. And Nissim Harmein, he's a physicist, researcher, and speaker. He believes that consciousness has this impact on matter. He says this, and he says, early in the field, scientists were baffled to find that simply observing an experiment influences the outcome. This is quite a powerful statement for all of us, because what this means is that tiny particles don't choose a state of matter until they are observed. And so this means that as human beings, we have a tremendous power over our experience and what's happening to us. Our observations and perceptions tremendously matter. So we're constantly creating, and we do that through our life stories. So we have many stories in our life. If you've lived as long as I have, you have a lot of stories. Yes, I'm writing a book now, and I'm thinking about that all the time, all the things I've been through already. But it's amazing. They have stories and chapters, and so often when we're in the thick of it, and maybe things are showing up that we're not so happy about, or it feels weird, or we're not sure we're going, we forget we're the directors. We forget we're weaving the plot daily. And the other thing is, we're not the story. So often people come and they bring all the emotions of that story, or all the whatever it is of what happened, but they're not the story, actually. So that's the interesting part of us as human beings. We're helping our clients take responsibility for the stories that are showing up, like they are the CEOs. They're the chief executive officer of their life. They need to take the responsibility, but it isn't easy to take responsibility when things are showing up and you don't understand, and you don't understand yet the full impact that your beliefs in your subconscious. And, we're just starting to really, I'm going to talk about that in a second, but we're just starting to understand this at a deep level. So we play many roles all day long in our stories. I feel like what's happening right now, as the consciousness is raising very quickly, people are becoming much more aware of roles in general, maybe because we've been seeing movies, and they're asking, like, when I think of myself as a nurse, I know I loved the hero role. Oh my gosh, I love that. I loved to be the hero. I loved as a nurse to take care of people and save them. And, but what I realized is that, at a certain point in my life, I just couldn't do that anymore. I was getting exhausted, saving everybody, helping everybody. I think I realized, oh gosh, and then I was helping people that didn't even want to be helped. And that's one of the things in health coaching we know we shouldn't be doing, right? People have, it's client driven, right? They have to choose it themselves. So I think for me, we're getting to a point where we're becoming very aware of these roles. And I would say it's really important to ask questions like, if you're working with your clients, if you were to change your role in the story, what would you change first? Or what role does food play in your story? What role do you play in the story you shared with me? How would you narrate the story from the role of your partner? I mean, very interesting question. What role would you like to play in your new job? What kind of voice or role do you want from me as your coach? So we can ask questions about the roles people are playing in their life. And this can be very helpful to help them get out of their story, actually, to help them snap out of it and say, oh, is this what I really want? So we have a conscious and a subconscious. This is really proven now. Freud wrote about it in The Human Mind, the Mental Iceberg. What he was getting at here is that the conscious state, which is what's happening right now in this class, I'm teaching, you're listening, and soon we'll be talking. Thoughts are coming, perceptions are happening. In the conscious state, you can go to the past and you can go to the future. But then you have your subconscious state, and that is all your fears and doubts and everything underneath the surface that's always happening. The thing is, the subconscious state can only exist in the now moment. It's what they've proven now is that most of what's showing up in our life, if we're not directing our subconscious, is from the subconscious, 90%. Isn't that amazing? So only 10% of what we actually, so we say, oh, I want to buy a new house. I'd like to have that in my life, or I'd like to save money for that. But in our subconscious, we think, oh, you'll never get that job. You're not going to get that paid that much. You're not worthy of that. So that doesn't happen. So this is so powerful. So I ask this to you now, where do you spend your time? This is really important, because when we're always thinking about what happened, oh, I did such a bad job on this thing, or whatever, we have that tendency to overanalyze what we did or how we behaved or what happened. Eventually, we get very depressed with that. That's not a healthy, that's not a good creator moment. We can't create from there. We also can't create from the future. When we put things in the future and we worry, we're not going to end up with those things. We're not, because the only place we can actually manifest something is from the actual moment of now. So, as creators, we want to create. So that's why that question, where do you spend your time, is very powerful. So without directing our conscious state, without being aware, by being in the now, our creations become very chaotic. We don't end up getting what we really want. So we can help our clients live in the now moment. We can help by asking questions about the present moment. We could say, how could you live more consciously in the now? What would that look like this week? How would you describe your life in the present moment? Tell me about how you perceive your health in this moment. How does your present situation serve you or not serve you? So we can ask a lot of questions about the now moment, and I think that is very powerful. So ultimately, we want to be more conscious of our subconscious, and we want to direct our subconscious, because if we don't direct it, it's like a tape, an autopilot, just going all the time. So we have to help our clients to practice observing their thoughts. I know that sounds crazy, but we can all do it better, to really look at what we're thinking about all day long. What is our self-talk? What are the emotions connected to that? I loved in the first day how they talked about emotions and how important emotions are. Imagine a life as a human being without emotions, that you couldn't feel anything. Emotions help us know how we're doing. So if we can't have emotions and we can't even have a conversation about it, and everybody feels uncomfortable about it, where are we going to go, right? So we need to be able to deal with emotions. So what we do know about this is what we focus on expands. And if we don't direct the subconscious thoughts, they will take over. So what we do is we help our clients manifest by looking at these areas, this triangle. We help them look at their beliefs, their values, their perceptions, their thought forms, their feelings, their emotions, their decisions. We help them make decisions, actions, behaviors, and eventually results. But it's important to do all the other work before we ever get to manifesting. And that's the thing, because our thoughts are actually real. Our thoughts are energy. They project into that quantum field, that universal field, and they create matter. So that's really amazing. If we've thought a thought, it's already there in the other realms, which is really quite amazing. So what are your thoughts all day? What do you value? This is really important because this is what you're focusing on. And if you're thinking every day of the bills that are coming in and another bill comes in, and then you're thinking that something else is breaking down in the house and the gas is very expensive, you can't afford, inflation's happening, and then this is where we are, right? This is not a good state. So we also have our self-esteem and our self-worth. That is a frequency that projects. And if we have a very low self-esteem, that's a very small container. And so many times it's easier to be in the small container because it's safer, it's more comfortable. But as somebody is growing and they're growing in their consciousness, they do want this to get bigger. They do want to grow and have their container expand. So working with your clients on self-esteem, to believe in themselves, to love themselves is huge. It's a huge part, because what you feel you deserve ultimately and what you can contain will be what is showing up in your life. Just like this. So see, this is a container, it's a glass. Let's say this is your creation. You put in it what you think, you ask for what you want, you go for it, you intend something, you put it. But if you can't contain it, guess what? It's not going to stay. You're going to go to, you're never going to be able to hold it. So this is why many people have trouble with manifesting what they want. The other thing about beliefs is we don't get what we want. That word, I keep using it, but we get what we believe. Wanting, the minute we use the word wanting, it's also a frequency, the word wanting. Wanting is in the future. If I want something, I'm never going to have it because I'm wanting it. So I'm going to keep wanting it. I'm telling the universe, I want it. But if I have it, if I am it, then that's a whole nother thing. So, Gandhi wrote, your beliefs become your thoughts become your words become your actions become your habits become your values, and your values become your destiny. Beliefs make belief systems. So belief systems are like the stories that we tell ourselves. They define our personal reality of who we are and who we will become. And so belief systems are part of what happens. So the other day we were having this discussion. I have a very large family on both sides of the ocean. And I was saying, well, okay, why don't we just, one of the students, my student said this to me, and it really was profound. She said, why don't we not say, I know this, or this is right, or this is the right way we do things, or this is the only way. Why don't we just say, I believe, or I think, this is my belief. And when she said that, I was like, yeah, if the whole world just said, I believe, that would be a whole different, right? We could really connect a lot better with each other. So what we do know is that we're going to ask questions about thoughts, emotions, and storylines, and they are always connected. And all of it has different frequencies. So when we're hanging out in fear, we're at a very low frequency all day long, or anger. Or have you ever just gone by somebody and you can feel that? You can feel that they're angry or they're in grief. I mean, if you tune in, we are connected, and you can start to feel where people are at. When you're coaching, you can also pick up on this. But the thing is, where is your client? Where are you hanging out? But where's your client hanging out? It's so important, if you really want a joyful life, a loving life, that you hang out there, that you are joyful, because that's then what you will bring to you. So limiting beliefs, there are many, and always they're there with my clients and with students. A big one, I'm not good enough. Nothing I do works. Life is hard. Life is hard. Or you have to suffer in life, or there's no time. We had that the other day. There's not enough time. Anyway, these are all belief systems that are in our subconscious, operating on autopilot, bringing to us our reality. So when we're making decisions, and that can be really difficult to make a decision, I always try to listen for their words and reflect that back. But I always ask a question of what would be if you were to choose this direction, which of these is your highest calling when you go in? What feels lighter? I know that sounds crazy. One time I had to make a decision. It was a big one. I was living in America. My husband was going to start, he had to change jobs. We were very young. We had 2 kids. And he said to me, okay, I have 2 choices. We can move to New York, or we can move to the Netherlands, where I could go into a family business. And the first thing I wanted, my yang me was like, I want to move to New York and get my nursing Ph.D. That's what I wanted, I thought. But when I went in and I really thought of that decision and I thought of New York, I got really heavy. So I said, no, we're going to go to, even though it would be harder for me, if that's what do you want that? I asked him, and he was like, okay, I think I would like for a couple of years, if that's okay. So we went there. And the weirdest thing was, when we were about to move back, he was going to be working on the 77th floor of the World Trade Center. So that's I still think of that to this day, chilling decisions we make and consequences. So I was so like, wow, I made that decision. I was going to decide to go to New York, but then I looked in, I felt. So one of the things about decisions too, I see this all the time with my clients. If things are not working, they're trying to get this new job, they're trying to get this new thing, and they're not in the flow. It doesn't go. It's like this road. And so when this is happening, it's almost like the universe saying, guess what? You got to go in another direction. This one is not the right direction. So we have to pay attention. The other thing that happens with clients is they self-sabotage, just like this picture. When their mind and emotions are not in alignment with their subconscious, we do it because we want to be comfortable. So we all have different patterns, and we all do this all the time to protect ourselves, like from getting that big container. Like if I got that big container, I'd have to do more. I'd have to do this. Well, people could be criticizing me. They could be looking at me. Oh my goodness. Well, like here I am giving this lecture to you. We make ourselves vulnerable when we grow, when we make this container bigger. And so we have this, all of us have the ability to self-sabotage at that moment. So we have to help our clients identify these self-sabotaging behaviors and habits, and very common ones for health coaching are comfort eating, right? Procrastination, maybe the lack of commitment to something, or an addiction. And the why behind it is maybe fears, like fear of relationships, or fear of failure and success, or feeling unworthy. Now, this is a fun. So we help our clients to manage the thoughts, feelings, and words. And the most important thing is, as we're reflecting back in the coaching process, we think, are they aligned? Are their thoughts and feelings and words aligned with what they want? Because if they are not, they will not manifest. Honestly, it's just not going to happen. All of these have to be in alignment for them to bring into their reality. So the perception matters, our glasses, how we see things. So a lot of times we have to ask a lot of questions about the perception, because our perception is never our client's perception. I can tell you that. Maybe sometimes, but most of the time I'm really surprised. We're all different. The behaviors are different in their life, their actions. And so how does your client perceive their life story? How realistic are their goals? How will they handle the changes? Like asking questions about that. How committed and motivated, we've heard a lot about this, but it's so important. What behaviors actually need to change for them to manifest and reach their goal? What actions? Because nothing will happen if you remember the yang. You have to also make rightful action. You have to stick with it, or it's not going to happen. So we help our clients make goals about rewriting beliefs and changing behaviors and action. And I like this. So we help our clients look at these, to look at what's not serving them, what's serving them. We ask them questions like, how would you rewrite your story? Or what beliefs and behaviors and actions will be part and serve the story you wish to manifest? That's a good question. I like that because it really helps them to see things. So we help them to change habits bio-individually, and I love this one. One of the things I do is to, of course, client-driven and one step at a time, not too much, like work on one habit at a time, but place little notes everywhere. They love that. I give them that idea and they just remind themselves of ideas, of positive affirmations about what to remind them of what their beliefs are every day, their thoughts are, their self-talk, to make a new habit joyful, to listen to subliminal audios and videos to lighten up to what makes you happy. If something's like joyful, a music that you love, that listen to it every day. That brings your frequency up. And obviously discipline and commitment, but more so what we're realizing, yes, that matters, but what really matters is that all those things are in alignment. And it starts with intention. So creation starts with intention, with the end in mind. So we think of the end game. What is it that, not to be attached to it, but to make the goal, to make it, because the intention creates our reality. So visualizing it, feeling it, aligning this vision with the beliefs. And, the bottom line is where our attention goes, the energy flows. So this is a really good thing to remember. Now, I love Lynn McTaggart. If you're not familiar with her book, The Field, I one time met her and, I really like her. I have actually, it's really true. Her work is about the energy field. She has done many experiments on the field she takes a leaf, and that was one of her first ones, and they did an intention over the leaf. And actually, then they compared it to the other leaf, and the leaf had more light. It's pretty amazing. And also she did intention experiments where they would work in groups and make intentions, and they would see and monitor that. It's really fascinating. So there are many ways we connect to our universal field all day long and these are the conscious ways, but unconsciously we're doing it all the time also. So many people do it through prayer or meditation, intention, visualization, what I was just talking about, understanding the new sciences like quantum physics, breath work. We've heard a lot of people talk about that. Sound balls. Oh, I love that. I've been working with that this year. Chanting, grounding, earthing, exercising, yoga, all kinds of exercising. And these are conscious ways to connect to the field and raise your frequency. Another thing we can do with our clients is to ask them questions about when they have manifested and what that felt like. So we can really ask them, that's the one question I go in the past with, because if they don't feel they can ever manifest, I ask, well, are there times in your life that you manifested that you wanted to create something and it worked? What were you feeling like at the time? What were you thinking about? What were your patterns every day once that happened? Now, this is a little complicated, but I'm going to try to make it simple because I know we're short of time. But we work with our clients on ceilings and basements. Ceilings and basements, what is that? That's helping them to have the greatest vision that they can to manifest the biggest, the outside their container. So the ceiling is the highest expansion and manifestation possible that they can imagine, and that could be true for them. The basement is the lowest level of expansion and manifestation possible. The thing is, what happens to people a lot of times, they're about to manifest this amazing thing. They've been wanting it forever, and then they self-sabotage. They go to the basement. So they go to the lowest because it's comfortable. That whole idea of self-sabotage. So to manifest and matter, we actually have to raise our ceiling and basement. I'm going to give you an example of this for us as health coaches. So what you could ask this to yourself today, if you're an active health coach and you have your own business, what is the lowest amount you could accept as a coach for payment of services? What could you raise that level to feel comfortable with? And what is the highest amount that you could feel worthy of accepting and receiving for services? So that's how you can work with ceilings and basements. And also we can work with high mileage questions like, where would you like to be? I love this picture, by the way. It's really giving the overview, right? You're really looking. So where would you like to be in 1, 5, and 10 years? And the thing is, I have done this and I've even written it and I've had my clients write it. I don't know if you've done this, but it's powerful. Like I look back, I've written things, and then years later, I find this, and it happened. It's like, oh my goodness. So what would it look like? What would it feel like? This is important. The other thing is personas. We all are different times, right? We have different triggers. The angry you is different than the happy you. We're all humanity is like, we can be everything. It's quite amazing, actually. So all different parts of you have needs. And what often happens is we react unconsciously or subconsciously to get the need met. But what we're helping people with as coaches, we're helping them meet their needs more consciously. So this is wonderful. So, I love this work, and I think it's really the future. We're going to need a lot of coaches where we're going. So manifestation is really what we call reverse engineering. It's actually becoming the energy you want to attract without attachment. So I give you an example of an easy thing to do, like think of a parking spot. I know this sounds crazy, but just think you have it. It's going to be there, but don't attach to it. Don't need it. Needing is also a future word. So we cannot need. So any need in any creation does not show up. So let go of the attachment, trust, and know that it's there. That parking space is there. The other thing I do is traffic. If I'm getting into a lot of traffic and I see it coming and I'm going, I can feel my whole blood pressure going up. Oh no, I'm going to be late. Then I think, no, Kathleen, stop, breathe. I say it'll flow easily and quickly. Now try it it's amazing. It works. So I think the more you feel how great it would feel to have what you would like, and you feel it, you create a ripple of positive energy in the world, in that universal field. And the thing is, what you can do is work with your clients on the resistances to that container growth, because that's the problem. Also, help them to see synchronicity and understand it, because when you're about to manifest something, you start to see synchronicities. Things start to show up, which is so exciting, that guide you, that say, yeah, you're on the right path. This is it. Keep going. And so there's a book written called The Trust Frequency. Everything has a frequency. That trust is so powerful, because when you trust, you say, I'm sovereign, I own it. I'm going to do this. And so how true is this belief for you? Imagine that you trust that you're going to get that job, and you feel that you got it already, or you're going to have that amazing new relationship that you want in your life, or you're going to be able to have a new diet that is good for you, that's your best relationship with food, or whatever you want to think about that. Now, I teach this tool to my students that I kind of created with some help, and I call it the Oven of Grace. So you're welcome to use it. It's amazing. It works. So look at this. This is us. We have our oven, which connects us to the universal field. And an oven is like a place where we cook things, right? We just bake. And so the first thing we do with our oven is we incinerate anything in that oven that's, we clean it, we get rid of what we don't need. And so I say to all my clients, and I also help people heal. So I say, what you say every day is, I give permission for everything that does not belong to me and serve me to leave. You just let things go. That's very important every day to do. And then you create an image, you drop a image of what you want, this intention, whatever it is that you want to bring into your reality. You drop it in your oven. You just drop it. You don't push it. You don't force it. You don't check it every 5 minutes. You just drop it. Then you trust it, and you let that oven do it. You trust the process. You don't hold on to when, and you don't hold on to how. Everything is possible, and miracles are happening every day. That's a great line. So expect the miracles. That I cannot explain enough how powerful it is to expect miracles in your life. So this is the Oven of Grace. And I always say, put what you love in your oven, have passion for it, and compassion. It's really important. The other thing you can do with your clients is to practice for 7 days to attract something. So you can ask them to write down something they want, an intention, practice every day to think about it, to feel it as if it already happened, make a couple actions every day, write them down that are related to that goal, and see. If you do this for a week, it's powerful. It really is. It's like we are creating every day from our thoughts. And if we direct them, it's much more powerful. So as a coach, we are an example. How we live matters. Our clients, they don't necessarily know about our life, but we have to be the example. We have to become really good at this. This is, and not only manifesting, but also digesting. Both are very important, yin and yang. And so often as a coach, our clients mirror our story. Like I see people showing up that I have to learn something. It's amazing how this happens. So just to summarize, the science of manifestation is, this is it. I'm going to say it one more time, but what is really important is to practice it. We can know it. I've shared this with you today. You probably already know it on some level, and maybe you've already been listening to people who talk about it. And many spiritual leaders are out there coming to help us with this, scientists also. But we have to practice it. Well, this is the whole point, and we have to start to do it. So we have to align our intentions, with the body, mind, emotion, and spirit complex. We connect to the field, and when that happens, and to the ground, to ground too. And when that happens, manifestation has already happened in the etheric plane. It's been proven. That's amazing, isn't it? And then we connect to the feeling of it, and we bring it in the emotional plane, and then it shows up eventually. When it doesn't show up, it's not the right path at that time. And that's the trust you have to have. But I promise things are going to be, what I see happening is that this is getting easier for people. They're starting to understand it, and they're starting to be able to work with it and make things happen much faster for themselves. So we can change our timeline, but we have to imagine ourselves differently. So can you imagine yourself the hero of your story every day? I love this picture. What timeline will you manifest? How can you change your future self? And I love this picture, this video, because it sort of is what happens. And we can change this direction at any moment, and we are. So anyway, I come back to all of you. I stop sharing, and I answer questions. I don't. Is there a chat box? Let me look. Let's see. I'm not sure if there's a chat. Hello? I don't know. Is anyone here? Oh, yes, here, somebody answered here. Okay. Yes, someone says, I've worked with these intention groups as well. It can make an enormous difference for the one you set your intentions for. It can be, absolutely. We can make intentions for others also. Can you give an example of connecting with the subconscious to help? Yes, I can. So I think it's very important when you come to, like, let's say you want to create something and you're thinking, I want to change something in my life. I really want to, let's just do money because it's very literal and it's very, people are going to have a lot of issues with money this year. That is for sure, as all the money things are changing. So let's say we all have a relationship with money. We have a relationship with everything. We have a perception. So what we have to do is we have to come into contact with what is our relationship with money? How are we manifesting? Are we able to manifest? Is it difficult all the time? What's showing up? That's the first question. Depending on what's showing up, we know what's in the subconscious. Because if constantly bills are showing up, all difficulties, headaches, everything breaking down. Now, granted, as a society, we are also co-creating. So there are certain themes, like we didn't have COVID in our subconscious, but what we did have is we had perceptions of illness. We had how we dealt with it, our fears of illness. And now we're going to have the same with money this year. So I ask you, I think you go in and you say, what is my resistance to money, or what is my resistance to abundance? Because both of them, if we are a creator, we can create anything, and we don't have to create poverty or lack. But we often find ourselves in that. So if we're in that cycle, we have to look at the subconscious. That's where we start. So ask yourself questions about what is showing up in your life. And if things are just showing up well, if you're happy with what's there and you have a wonderful job and you're attracting clients and you're able, whatever's there is what you want, then you're okay there. But if it's not, then that's the issue in the subconscious. There's a block. So you have to ask critical questions. I hope I helped you there. Does anyone else have a question? So lovely to be with all of you. I can't see a chat like last time I saw a chat. This time I don't see a chat. Hi there, Johannes. You seem busy. You're in the car. Hello. Anyway, he's connecting to audio. Last time I spoke, I could see everybody's chat. I can't do that today, but it doesn't matter. I hope I'm answering their questions. Does anyone else have any other questions? Can you give an example? Yeah, so Carla asked the same question again. Can you give an example of connect with the subconscious? The subconscious is any fear that you have. It's any belief system that you have is in that subconscious. It's every relationship you have with anything in these areas I've talked about. Your self-esteem, your relationship with money, your relationship with other people, your beliefs about yourself, any beliefs you have, even positive, are in the subconscious. It's not only negative. It's just that the limiting beliefs that so often are plaguing us are keeping us stuck, and that's why they become more obvious. So I hope that's helpful. Yes, yes, Akashic records. That is a very good question. Would Akashic record work in the same way that we are able to access the quantum realm? Yes. So I can definitely say to you that I think what's happening right now is more and more people are beginning to use other senses, not just sight, like the ones we know about, like seeing, hearing, all the things, the basic ones, smelling. We're starting to use our third eye more. This is the time when this is happening on the planet, and everyone's at a different level. So the Akashic records are information about each. We each have our own record, and that is information about. I mean, that's so complicated to go into, but it's yes, Akashic record work. Understanding every person is understanding every person and their background. We can all do that in the future. There will be no secrets. And imagine a world without secrets. That will be a different world. Yes, NLP is any way to reprogram the subconscious is powerful. NLP is very powerful. Hypnosis is powerful. EFT, all new ways, kinesiology, all new ways of working to reprogram the subconscious are very powerful tools that I think all coaches could end up becoming NLP practitioners or EFT, because that's a powerful tool that connects together and you can help people in a more holistic way, let's say. Yes, Linda. Yes, so my course, we all have our courses, so you can look online. Anybody else? How would you introduce the topic who might not understand? Yeah, I think you can start with goals, because like what would you like to have happen in your life? You don't have to use the word manifesting if they're not ready for that, because it might be a little bit like it's a word that is kind of out there, but it's really not out there. But maybe we just weren't taught it when we were young. The new kids, these young kids now, they hear it all the time. But yes, the older you are, the more we didn't hear it. So when you're talking to clients that might not have heard it, might not be comfortable, what would you like to bring in your life? What would you like to see? If you were to imagine your life differently, what would that look like in the best possibility? It doesn't have to be the word manifesting. It can be sort of scary, I think. And also using the word creator can be scary because people are like, what? May not be ready for that. Many people are not even realizing, or they're waking up to the idea that they're spiritual beings, having a temporary earthly body experience. Some people are not even aware of that. They're not thinking about that. They're just kind of living their life, surviving. And so, yeah, we have to meet our clients where they're at. So this is important information I'm presenting, but you can use what will help you with your life. Anything else I can help you with? If clients have a lot of anxiety, would it be help? Yes, yes. Remember the law, what you focus on will expand. Now, I will say this to you. I am a nurse, so I believe in the physical too. I believe in the connection of mind, body, and spirit. I believe that many people are having anxiety right now, and it's physical. It's because their gut is a mess. They're not eating. The food is not good. I mean, I could get into all this, but you guys kind of probably understand this. And if we don't have the right neurotransmitters, enough good bacteria, well, this is the gut-brain connection, we'll also get anxious. So I can't say it's only that you think manifesting in joy and suddenly you're there. Not at all, because if you're not doing anything to balance the yang in your life, if you're not doing anything yin at all, you're not directing that energy to calm down, to have quiet time, to assimilate what has happened, then over time, this builds up. You know, when people get older and then their stomachs are really, really big, because not only have they, been eating a lot maybe, or have a lot of toxicity, that's another thing, but also they could, I know we could have had a lot of experiences and not had time to digest what happened. So yes, I do believe we can help clients with affirmation work, with bringing new thoughts and reprogramming in the EFT way, not trauma. That's not our work as health coach. But I do believe we can change a lot just with exercise. People who start, can you imagine you start doing exercise, you didn't do anything. A lot of people are just behind the desk all day long, and then they start to do exercise, maybe eat a little better, and they start getting better neurotransmitters. They start feeling better, having more energy, and endorphins are really also related to feeling good. So it's holistic. It's not just one thing, but definitely our thoughts matter. So yeah, you could ask your client if it's about beliefs and their thought process. We could ask them if they want to work with affirmations that week. Sure. To try to see, or meditation, or whatever they would like. There's so many forms. Any other questions? I think it's time to see. It's been so nice to be with all of you. Thank you so much, Johannes, and everybody who put this together. And well, I hope you enjoyed it, and I look forward to seeing you all another time. Thank you.
Kathleen, thank you so much for being here. What a wonderful presentation.
You're welcome, Johannes.
Thank you so much.
No problem. It's lovely to be here, and I look forward to connecting with you again. Okay.
Yeah.
Everyone take care. And I assume, do you want me to introduce?
No, I think we're good. We're good. So we're going to be back. We have a couple of minutes break. We're going to be back with our next speakers. Thanks, Kathleen, again, especially the conscious spiritual aspect of health coaching, such an important concept or skill to have. So thanks again so much.
You're welcome, Johannes. Bye, everybody.
Thank you. Bye-bye. We're back in a few minutes. Hello, everybody. Welcome back to Health Coach Summit Day 4. We have another set of amazing speakers coming up. Type in the chat box how you do. And let me introduce our next speaker. Dr. Michael Derrick, how are you? Are you in here already? Let me see. Let me bring you in.
There we go. Sorry.
I am
here.
How are you?
Super excited to be here.
Sorry?
Super excited to be here.
Yes, thank you for being here and for speaking about a topic that I think we all as health coaches love and really need to learn a lot more, which is about habits. How to use habits, what they are, and you're going to introduce or share and open up, I'm sure, also about your background, right? You are founder of the Health and Wellness Coaching Academy, Nutritional Factors, and I'm sure you're going to talk a bit more about that. But thank you for being here. Really appreciate it.
Oh, thanks for having me, Johannes. It's going to be great. It's been the summit so far. Lots of good info, lots of good topics, and a lot to digest.
Yeah, a lot to digest. That's why everybody gets pretty much a recording so they can really use this as a reference guide, also your talk. So thank you so much. So we're going to have 40 minutes again with about 15 minutes afterwards Q&A. Is that okay?
That's perfect.
Perfect. Here we go.
Perfect.
Enjoy.
I'm going to get my slides pulled up here and we will get going. All right. So I'm going to make me big for a teeny bit and then I'll shrink myself down for just a bit. So I like Johannes said, I'm Mike Derrick. I'm the medical director at the Health and Wellness Coaching Academy. It was founded by Janet Jackson. I know she's got a really cool name. Not the Janet Jackson that you've heard of, different Janet Jackson, but I'm the medical director there. I'm a physician by training. Really, really excited to be here. Habits are something that I love. As I deal with patients from the medical side of my practice, habits really do make a big difference. They make a difference in my personal life as well as in my patients' lives. And the more we understand about habits, really the more effectively we can use them to enact change in our own lives as well as the lives of those that we work with on a daily basis. So a little bit of background. I'm a medical doctor by training. I treat patients on a daily basis. And one of the things that we are sadly notorious for as doctors is we're not always good at communicating simply and effectively. So I have tried in my presentation to keep it fairly basic. I don't want to use a ton of jargon. I want it to be simple, actionable steps that we can take in our own lives and that you can utilize in your life as a coach in order to help those that you're working with to find greater levels of success, greater levels of health, greater levels of wellness in their own lives. So I'm going to start off with a brief story. In the 1970s, there were some charter flights that would go and they would fly from New Zealand. And they would fly and sightsee over Antarctica. And so it was a really beautiful way to enjoy and see nature without necessarily being in sub-zero temperature from the comfort of an airplane. But what happened was there was one flight and the flight plan was changed ever so slightly by just a few degrees. And that was not communicated to the pilots. And because of that, they were at a point where they thought they were in a good open safe space and they were descending, but in reality, there was a mountain in front of them. And it led to a pretty serious type of accident. The real tragedy is that it was just a few degrees. You know, when they left the airport, the pilot wouldn't have noticed that they were heading in a totally different direction. And those small degrees of change in our lives, in our clients' lives, in my patients' lives, they really have a significant long-term impact and outcome. And so that's really what we're trying to do. We're trying to enact small degrees of change purposefully to lead to better outcomes for both ourselves as well as those that we're working with. So really, we're going to talk today about systems and how we can use a system, a trusted and proven system, to enact positive change in ourselves and in those that we work with. If we want to solve a problem, we got to follow a proven system. If we want to change a habit, following a proven system is really going to be the most efficient way that we're going to get there. Success demands a system, a plan of attack. If we don't have that, we're way more likely to fail. If our clients don't have that, they're way more likely to fail and lead to lots of frustration, things that we don't want to have for them, that we don't want to have for ourselves. And so if we can utilize a proven system, we're going to find much greater success. So when talking about systems, a system has a lot of different parts. Really, like I talked about, the benefit of using a system is you're way more likely to find success. You're much more likely to use your efforts efficiently. You're not going to waste as much time, waste as much energy. You're not going to have as much frustration, and you're going to see a lot more of what you're hoping to see for you and your clients. The building blocks of the system, we're going to go over inputs, the processes that we go through, the outputs, as well as the feedback that we get. So inputs, those are the things that go into our system. The goals, the processes, those are going to be actions. The outputs are the results. And we're going to talk about each of these levels individually. So the inputs of our systems, it's really important to know that if we put quality into our system through the input, we're going to get quality out. The overall system is really only as good as the starting point, which is going to be your input. So your inputs for your systems, for your client systems, those are going to be their goals, their objectives. They're going to be the energy they take in. And so a good system will help develop positive goals and objectives, will help them to be energized and excited about the changes that they're planning on making or that you're planning on making. It's all the things that enter into the system as we get started. Now, then we lead to the processes. We have all these inputs, but now we have the actual action. Action is very important. Without action, we really don't get anywhere. You can have lots of goals and dreams, but without the process, the action, the steps that we take, you're really not going to make any difference. You're not going to have any positive change. So really, we need to set up a sequence. We need step-by-step things that we're going to do to get us to the outcomes that we want. Then we move on to the outputs. Outputs is what we're all looking for. We all want the output. But if we neglect our processes, if we neglect our inputs, we're not going to get the outputs we want. And oftentimes, as people come to me in my medical practice, to you in your coaching, they're going to be looking for a different output. It's easy to focus on outputs, but often we need to put more of our focus on our input and our processes in order to get those outputs we desire. Outputs can be positive. We achieved our goal. We achieved the metric that we set, but they can also be negative. We didn't achieve it. We fell short. And so outputs are important as far as how they feed back into the system with what we achieved. As far as feedback goes, feedback, very, very important. There's in the coaching process, there's a lot of feedback that happens both from the coach. So you're talking to them about kind of what you see is going on, but a lot of the feedback is them talking to you as the coach about what they did, how they felt about it. That is feeding back into themselves. And sometimes people just need that sounding board. That's one of the really great things about health coaching that we don't have as much time for in the medical field. I can't sit for an hour and talk to every single patient. I could, but my practice manager would be really unhappy with me. But as a health coach, you have the time to slowly work through these things, to listen in depth, to ask them open-ended questions and help your clients to think through these things. Now, feedback should be timely. If you're getting feedback way late, it's not going to have as much impact. If we're getting it at a timely manner, it's going to be much more effective at spurring further movement, further change. And it's great if it's actionable. Now, it may not feel actionable at the moment, but that's, again, one of those benefits of discussing it where you as the health coach, and that's where health coaches can benefit from being coached. You get to discuss it, and maybe you have this feedback, but you're not sure what to do with it. And the coach can help a person work through on how does that become actionable? What can we do with that? And then we just kind of flip back and go back through the loop. Now, the power of habits, very, very powerful. Our habits have the power to shape who we are, our character. They determine who we are now. They determine who we're going to be in the future. Habits are they're actions that are performed fairly subconsciously. We don't have to think about them. We just kind of do them. You can think about them, but often we don't. Part of that is evolutionarily designed. When we have things that we do on a regular basis, we don't want to have to think about them. We don't want to use all the energy mentally to think about and run through, how do I breathe? We just do it as a habit, as a reflex. Now, with habits, there's specific cues and triggers that can lead to them. And we'll talk a little bit more about that and kind of how we can modify some of those things. But over time, our habits become fairly ingrained. The downside of that is when we're young, no, it's not really talked about a whole lot as far as habits and planning out and designing your life for what you want. So a lot of the habits we have are from the environment we've grown up in, from the people around us. And so they're not necessarily designed. And if we don't have habits and patterns that are designed, often they can be negative. They may just be neutral. But if they're neutral, they're still not moving us forward. So they may not be terrible habits, but if they're not good habits, maybe we can modify them and replace them. And then they can be positive habits. And then we can see the success that we want to see. Your clients can see the success they want to see in their lives as they're modifying those habits. We do know that as habits are further ingrained in the brain, the neural circuits that perform the habits become stronger and stronger. And so breaking habits, making new habits, it does take time. And that's an important thing to review with clients and with ourselves when we're trying to change. It's not something that is always real immediate. It takes a little bit of time for that rewiring in the brain to happen. Now, habits, they can become, if they're really ingrained, they're like autopilot. So that plane was on autopilot, but the autopilot was off by a few degrees from where they thought they were going. And because of that, they ended up in a totally different place. And that's where I talked about if we haven't, and most of us have not, actively and intentionally determined what our habits are, where that autopilot is taking us, then we're not going to end up where we want. And that's part of the reason that people will come to a health coach. They want something different. They want something more. They may know what change they want, but they don't know how to get there. And so we get to help as they change that direction just a few degrees. And over the long run, they're going to find greater levels of success. Now, the positive side of the autopilot tendency of habits and of our brain is if we can form positive habits, positive autopilot tendencies, then we will get to where we want to be no matter what. Our automatic patterns will take us there, but they need to be patterns that are well thought out, planned out, and will get us there. Now, it's not usually that you get one good set of habits set up and then you're just going to make it, because often that goalpost moves. You have a goal, you get to that goal, you're really excited, you help your client get to a goal, but then they realize, I want more. I like this level of, wow, I accomplished things. I did things. I wanted to do this thing and I did it. So it does keep modifying and changing, and an adequate plan will allow for that. Hey, we may have gotten where we wanted to go, but now we want to go further. We want to go more. But we can work on, hey, how do I modify my positive autopilot to get me there? And then it's not just this grueling grind every day. It can become much more of a smooth journey than an awful trudging process. So the process of change, like I talked about, it's not something that always happens overnight. There are certainly stories where it happens overnight. It would be great if we could just like flip a switch and we just get there. That doesn't always happen. But a planned out, a well-designed system can lead us there over time. We could hope for that overnight change, or we could plan for the consistency that will lead to change with a well-designed system. Difficult to change habits, they're there, but we can absolutely change. I see people change all the time in my medical practice. It's something that is a very routine part. And that's one of the things I love about when I work with younger patients. They don't have habits at this point. They have them, but they're not as ingrained. And so it's so fun to help them to design those habits so that they hopefully can grow up and lead healthy lives. In the adult world, it's so rewarding to see someone who has negative habits, negative patterns, and we're helping them to modify those so that they can start to see more success. It leads them to such a feeling of success. So the system we've designed at the Health and Wellness Coaching Academy by Nutrition Factors is the KEEP system, a process for a better life. So we're going to go over all of these sections. There's knowledge. We're going to evaluate, exchange, have a positive mindset, and deal with consistency. So we're going to start off with knowledge. Knowledge is really the fundamental base starting point to modifying our habits. So we need to take a close look at ourselves and understand what it is we're doing. And if it's the person we're coaching, we need them to be willing to take a really close look at themselves. If we don't have a knowledge, if we don't have an understanding that what we are doing, what our autopilot is not serving us or is negative, then there's just not going to be that level of desire for change. And so knowledge is really the first place we need to start. We need the person we're coaching. We need ourselves to realize, hey, this is where I am. This is what's actually happening. And I need to modify that. A really silly story from my life is there was a point when I was on the beach with a friend, and I thought it was going to be the perfect time for a picture. It was a great picture opportunity. The sun was setting. I was on this beautiful beach and the water was there, and I was sitting there. And so I had my friend, I was like, hey, take a picture from this angle. It's going to be perfect. It's going to look so great. And so he got his camera and he got all ready to take a picture of me. And he said, hey, Mike, you got to sit up more. You're a little bit too slouched in the picture. Well, I was sitting there and I didn't feel like I was too slouched. I felt like I was fine. I didn't need to sit up anymore. I don't want it to be an unnaturally erect picture where I look like a robot on the beach. I want it to be a relaxed beach picture. It was going to be so good. So I immediately dug my heels in, as we do so much when we get feedback from other people that's not necessarily solicited. I dug my heels in and I was stubborn about it. And I really shouldn't have been, because when I got the picture back, this was back in the day of film that you had to develop. So I got the film developed and I looked at the picture and it looked awful. The sunset looked great. The beach looked great. The ocean was beautiful. And there I was, and I was just so slouched over, it ruined the picture. And I see that picture and I hate that picture, but I see it and it reminds me and has taught me a very valuable lesson. I didn't know that that's how it appeared. Now, once I saw that picture, once I was able to fully look at, hey, that's what I'm actually doing. That's me in that picture, and that's what it looks like. Maybe I should have listened to that feedback a little bit more. Maybe it wasn't solicited, but I think I should have listened to it, and it caused me, I had to go back and say sorry. Hey, man, I should have listened to you. But that's something we work with in gaining knowledge and helping our clients understand what it is that they're doing. And another great example from my life is when I was in my undergraduate. So before medical school, I was in an upper division anatomy class. And anatomy is very much, you do dissection, you learn about the body and the different parts, and lots of learning that way. But the teacher was really a solid professor. He wanted us to not just learn about the body, but he wanted us, because he knew most of us were going into medical professions, he wanted us to be proficient at speaking, because he knew that you may have all the knowledge in the world, but if you can't communicate it, it's just not going to work. You need to be able to communicate it in an efficient way. So he had us do these presentations, these 20-minute long presentations about different parts of the body. Not super exciting topics, but lots of presentations. One of the things he would grade us on, in addition to content, was how we did our public speaking, which was really weird to me because it was an anatomy class. He would sit and he would count every single filler word that we put into our presentation. Every but that didn't need to be there, he would count it. And at the end of the presentation, he would tell you, you said 47 times a minute. And there was one person in our class, and if you asked him, he wouldn't have said he was a bad public speaker. He didn't think he was a professional, but he didn't think he was terrible. And I don't think he was terrible, but he said a lot. All throughout his presentation was just scattered with ums and uhs. And he had a great presentation. He had good knowledge, good information. He shared it in a good way, but those killed his presentation. And so when he would tell me, hey, you did these things in your presentation, and when I look back at it, I would say, oh man, I really did do those things. And then when you saw other people do it, when someone say, hey, you're doing this, and you see other people do it, you say, oh my goodness, that he's totally right. I need to modify that. So we need in our own lives, as well as in the lives of our clients, to help and begin with increasing our knowledge about what it is, what habits we have, what patterns are already set in our lives. And we need to be very specific about this. So at number one, it requires a great ability to self-reflect. Our clients, ourselves, we just need to take some time. We need to look closely at who we are and what we are and why we are the way we are. So classic ways to do it, there's habit trackers, there's journaling. Journaling is a very great thing in it, but it needs to be specific. It can't just be a list of, I woke up, I went to work, I did these things. It's got to be fairly specific. And then as you're keeping a specific diary, a specific journal of the processes of your day, you will begin to notice, one of those things that I want to maybe change about my life that I thought about that I maybe don't like is right here in my schedule. I see it at this point. So then they can start looking back and say, hey, what do I notice in my journal that happened before that? What cues led me to that? Was it feelings? And that's where when we journal and when they journal, it's got to be fairly specific. What feelings were we feeling before? What situations were we in? What positions? What locations? So there's a lot of different factors that we don't always think about. They're not conscious. Again, these are autopilot things. And so it takes some digging to uncover what it is that our baseline habits and things are. So it helps them to identify the patterns, the triggers, as well as the consequences. They can see, I got 4 hours of sleep last night. I felt really crummy today. I didn't make these good choices that led to these negative outcomes. And they're able to track that all the way back. Now, it's hard to look at that sometimes and track it all the way back. But that's where, as a health coach, you come in so handy, because they keep track of this, and then you can look at it together and you can say, I see we didn't do what maybe you wanted to do on this day. And these are the things that I see leading up to it. And we can help them in the process of self-discovery of what things are triggering them to go and do the things that maybe they want to modify. Or they can just say, hey, I noticed that this thing is a recurrent thing in my day, and it's not negative, it's not making me a bad person. It's not something that's ruining my life, but it's not making it better. And they can notice and say, hey, maybe I want to modify that. Maybe I think everything's going okay, but I want to modify this so that things can go even better. And then there's the opportunity to seek external feedback. That takes a decent bit of humility from a health coach, from a client, because again, when we hear that external feedback, often as humans, we kind of dig in. The more someone pushes us, the more we tend to dig in. And so, if we're dealing with a client or we're looking for feedback for ourselves, we need to be ready. Our clients need to be ready, because feedback is not always the most pleasant thing to hear. So it's important that we get it from trusted friends, trusted family members and colleagues. These are people that we respect and know that respect us, so that we can take those things in a good, solid way. Now, once we've increased our knowledge, then we move on to the process of evaluation. I have this baseline. I know what my patterns are. I might know what kind of triggers them. I know some of my outcomes. And I'm now getting the opportunity to evaluate, are those things that serve me? Are those things that I want to keep? Are they things I want to modify? Are they things I just want to totally get rid of? Evaluation is very, very important. It takes honest self-reflection, and that is going to lead to remarkable amounts of growth. The evaluation process, it's crucial for self-discovery and understanding. to understand our habits, our actions, our motivations for ourselves, for our relationships. In the evaluation process, we go over the pros and the cons of the things that we're doing. And we think about, are these things that lead us to where we want to be? Now, the evaluation process is very, very important for clients to go through. So, because when they start to evaluate and say, you know what, I don't like this habit, I don't like this thing I'm doing, it can lead them along those stages of change to be much more ready and much more energized to change, because we've now broken down what is usually, it feels like just a massive problem. We're breaking it down to much smaller processes that most people say, you know, I mean, I could modify that. I could change that thing. I don't know if I can change the whole picture, but I can do that one thing right there. And so evaluation, very important process, but it is based on a solid foundation of knowledge. They have to know what's going on. And so they have to be willing to take that step to just really evaluate what's going on in my life based on the information and knowledge that I have. And maybe they need more knowledge. Maybe they need some more time for evaluation. And then we talk about taking our habits and exchanging them, changing them, replacing them, modifying them. If we upgrade our habits, we really elevate our life. Old habits, old processes, if maybe they served us at one point, but they're not serving us at this point, they can actually become barriers to further progress. Maybe we have certain tendencies, maybe our client has certain processes and tendencies that at one point were protected, but at this point, they're hampering our ability to succeed, to find greater success. And so that knowledge and evaluation portion really leads them to want to exchange and modify those habits, because we realize that's something that's no longer serving me. But again, it takes that initial, we got to start with knowledge, we could then move to evaluation, and then we are just ready to change. No one has to scoot us in the direction of exchanging our habits, changing them, modifying them. We want to, because we can see, hey, I think I can maybe modify that one thing. So when we talk about exchanging habits, there's triggers and cues that lead to habits. And that's knowing those, understanding those is very important as we're modifying them. And again, that's why I keep going back. You got to have that knowledge. You've got to have the understanding of what leads us to do the things we do so that we can change them. As the health coach, you can go through their schedule, you can go through how they're feeling, and we can help them and we can help ourselves uncover what those triggers and cues are. When we're looking to exchange habits, we can think of sometimes really easy and sometimes a little more detailed plans on how do we change, modify our habits. We may say, hey, there's a cue there that's there, and I do it every time before this habit that I want to change. So maybe I can modify the cue. Maybe the cue is I sit down when I'm watching TV. I sit down on my couch and I have a desk or table next to me, and there's a little bowl of candy, and it's just right there. And the habit is I sit there and I just reach over and I'm eating candy while I'm watching TV, and maybe that's something I want to change. So I could change the cue. I could not sit down and watch. Maybe I just stand and watch TV. Wouldn't be really comfortable. I probably watch a lot less TV. You could change the cue that way. Maybe you add some more friction into your plan. So when we're looking at removing a negative habit, the more friction we can put into that habit, the less likely we are to continue it, the easier it is to break it. So friction can be as simple. Maybe I'm sitting on that couch, I'm eating out of that bowl that's next to me on that table. Maybe I move the bowl. The bowl's over on the counter now. It's still there, but now in order for me to do it, I got to get up, I got to walk over there, and I got to totally put some more friction. Just a small amount of friction will modify the habit. There was a good study where they looked at how often people were willing and then they were going to a gym. And they found that if a gym was 3.5 miles away versus 5 miles away, there was a dramatic difference in the amount of times a month that the person visited the gym. And when you think about it, 1.5 miles is not that far. Most likely they're driving. That would take you an extra 2 minutes, not a humongous amount of time, but that small amount of friction, the extra 1.5 miles did make a difference. So we can look at, if I have negative habits, what amount of friction can I put in so that it will help me stop? We can modify cues. We can also modify by adding friction into bad habits. Now, if there are good habits, how can we remove the friction from the bad habit? And again, friction, it's really small. These aren't big things that we're modifying with friction. They're little things. So there's the classic story of people that want to pick up running and they don't enjoy running, but that's what they want. They want the outcomes of running and they want to like running, or they want to run a race. They have a goal to run a marathon or finish a marathon. And so that's their goal. But friction, you wake up in the morning, it might be difficult to get up anyways, but now you got to get up and then you got to find your clothes. You got to find your shoes, and you're just adding more and more friction. So if it's a positive habit, how can we remove that friction? Hey, my shoes are right there, right by my bed. Maybe I sleep in the clothes I'm going to run in. So when I get up, I don't have to change. I don't have to look for clothes. I don't have to worry I'm going to wake up my partner or my family. I'm already ready. I just got to slip those shoes on and then I can go and get going. So we remove some friction in those positive habits. Now, another way to modify habits that's really efficient is called piggybacking. So that's where you take a habit that you have that isn't a bad one. You don't necessarily need to totally change it, but you can piggyback a new habit onto it. So a great example from this is when I was early in my medical training, it was nighttime and I had an 8-year-old boy that was brought into the ER by his mom. He had a history of asthma and he was supposed to be taking a daily inhaler that would prevent serious exacerbations of his asthma. So he got brought in by his mom and he was not in good shape. He was not the kid that we let sit out in the lobby, you know, the classic ER story. I sat and waited for a couple hours. No, he got rushed right to the back. We started breathing treatments on him. We started medicines on him. Everything got going really, really quick. So once we got everything going, he was still in pretty rough shape and he was going to go to the intensive care unit. He was that bad. It wasn't a real mild exacerbation. He was pretty rough. So I sat down and I started talking with the mom. And it was clear to me that on the KEEP system, her knowledge was not where it needed to be. She saw asthma as a really common condition. Lots of people have it, kind of like allergies. It's fine. When in reality, asthma can kill people. And when I indicated that this could be life-threatening, she was kind of surprised. She didn't think asthma could be that serious. Now, with a proper treatment, asthma is fine. It's usually okay. But she didn't understand that if the reason we prescribe these things because it can be a really big deal. So she didn't have that knowledge. And then she was able to evaluate kind of where she was. So then I got to work on, hey, how can we exchange? How can we get you to where you can keep your son safe? Because she had that goal. She wanted him to be healthy and well, and I wanted him there too. My goal is not that a kid is limited by their asthma. It's that they are free to do what they want to do and that they don't have to worry about being healthy. So I sat and talked to her. This medicine that he's supposed to take, it's twice a day. And if you take it, you have to rinse your mouth out afterwards. Otherwise, you'll get a fungus in your mouth. No one wants a fungus in their mouth. But I saw before me a mom who probably worked 1 or 2 jobs. She had a couple other kids, so she was busy. Me adding something totally new in her day was going to be really tough. And I can't necessarily trust an 8-year-old. Some 8-year-olds maybe, but most 8-year-olds, you can't really trust them to be real religious about doing some of their medical care. And so I talked to her about, hey, what's something that he does twice a day? And so I just brought up does he brush his teeth? He had pretty good teeth when I looked at him, when I examined him. And she said, yeah, he brushes his teeth twice a day. Of course he does that. That's just, we do that. Well, who doesn't brush their teeth? And so I was like, okay, great. He brushes his teeth twice a day and he's supposed to take his medicine twice a day. What if we just stored his medicine rather than storing it in a medicine cabinet somewhere far away? What if we just put it next to his toothbrush? So that when he walks into the bathroom and you tell him to go brush his teeth, you can just say, hey, go do your medicine, brush your teeth. It's one thing now. We're going to do it one. So he's going to go in there. He's going to see his medicine. You're going to see his medicine next to his toothbrush. And you're like, all right, let's do your medicine. So he does his medicine. And then he's got to swish his mouth out, but he's going to brush his teeth anyways. And so his mouth is clean. And so now we're not adding something new onto this busy parent's life, because we all have busy lives. It's hard to just start piling in all the different things that we should be doing. So I said, hey, let's just take the current habit he has and let's add something that takes 45 seconds to it so that they become one habit. And that way, as this kid gets older, he can take over it really easily because it will now be just something that he does. You know, when they ask him, what do you do at night? He's like, well, I take my medicine, I brush my teeth. It's one thing. And so piggybacking onto current habits. Maybe we have a current habit of doing something and we say, hey, you know what? I do that all the time and I'm okay with that. I'm going to add this other habit onto there so that my habit kind of becomes my cue for my positive new habit that I'm trying to add on. And then it's important that we keep circling back around on the system, that we keep paying attention, we continue to be mindful and see where we are and where we need to be. And is what we're doing serving us? And then the P on keeping a positive mindset. It's really easy to get discouraged. The world, life can be discouraging. So for ourselves, you know, a positive mind, it'll take us places where we've never been. To create positive change and become the best version of ourselves, it's crucial that we focus on what we want rather than what isn't working. And it's a very common tendency to focus on, you know, I didn't do this. I wasn't able to do this. It didn't work out the way I wanted. But we often miss the good things that were part of it. My wife, she won't love that I told you this. She's a great crafter. She crafts. She also builds. I mean, she'll construct stuff out of wood. She does all sorts of great stuff. But she frequently will point out, I'll say this thing she made, she'll show me, and it'll be amazing. I'm like, wow, I didn't know you could do that. That's amazing. And she'll say, yeah, but you know, that spot right there, it didn't turn out the way I wanted it to. And that's so human nature for us to point out what it is that we failed on. And so as individuals, we need to focus more on, hey, you know what? Maybe I didn't get what I wanted there, but yeah, I did these other things really, really well. And when we're coaching, it's our job to point out, hey, maybe you didn't get your goal. Maybe we need to set up a different process. We need to have some different inputs and different processes set up so we can get you there. But you know what you did do well? You did these things well. And in the early coaching process, one of the classic things that you can just point out to them is, you have come to me because you know you want to change. You have already done this massive action on saying, hey, I need to change, and doing this will help me to change. So pointing out those things that can be viewed that are positive actions will provide a better situation, a better feeling. When I was talking to that mom in the ER, my goal was not to make her feel bad. I didn't want to berate her. What I wanted was for her to understand that her son needed this, and how could we get there? And pointing out and reflecting back that I know you love your son. You want what's best for him. And so I know that now that you understand this, like, we're going to make this happen and we can do this. Framing things in that positive way. Our minds don't always do it. It's one of the sad habits that we have is often we will look at the negative, but that's an autopilot tendency that we can change over time. We may not know we do it, but that's where in the knowledge section, we may notice, hey, you know what I do? I kind of look at things more negatively than maybe I should, because when I write it down, it's not as bad as my brain said it was. So ways to improve positive mindset, mindfulness. So that's, going back, we're always being mindful of what it is we're doing, what the outputs and results that we're getting. It's important to show some self-love and aligning what we want with who we want to be and the actions that we get from there. And then the final letter in keeps is feeling it with consistency. Consistency is the thing that will ingrain a habit. When we talk about autopilot tendencies, so our brain will create neural pathways, and the more we do them, the more ingrained they get. So I grew up near mountains, and when you go up in the mountains, you see a lot of areas that are just dense brush. There's bushes, there's trees, there's grass, and there's no real path through there. That's oftentimes what our brain kind of looks like when we're born. It's a bunch of brush there. There's not really any pathways there. And as we get older, we start to develop pathways. And in the mountains, that would be like the pathways that I've seen where deer travel. Those are real thin pathways. But when you look at them, when you get there, you can see, I can see that the deer, they pass through this area. Not a herd of deer. It's, single file. They pass through here. The same thing in our brain as we start to develop new habits habits, we're going to maybe for some of it, we're going to be trudging through some new territory. And so it's a little bit hard. It's a little bit slow going. If we're piggybacking, that's one of the reasons why piggybacking is nice, is because we're not just on totally new territory. We have some solid pathways there, and maybe we're trudging some new territory at part of it, but it's not overall a totally new trail. And as we do it longer and longer, we get to those paths that I've seen in the mountains that head to the peak, or they head to the waterfall. And we see that, hey, then this is a big path. It's well trodden. I know where it is. No one's going to miss it. It's a big old path. The same thing will happen in our brains. We need to seal it with consistency. So one of the examples I have as far as from medical practice with consistency is going back to babies. When babies are born, they have no idea what to do with most of their body parts. They can go to the bathroom, they can eat, and they can sleep, and they can cry. And that's pretty much it. That's like all they do. They don't know what their hands are. They don't know what their legs do. They kind of flail them around, but they'll scratch themselves, really not purposeful. So we take a baby who doesn't really know how to do hardly anything, and by a year, most of them are walking. That's a massive amount of change. That is a huge process that we go through, but it starts with such small steps. And that's where if the client, if they're worried about how small of a step they're completing, or the tiny thing they're changing, that's why reinforcing to them, hey, it's these little degrees that led to this plane crash. And it's these little degrees that are going to keep you safe and lead you to where you need to go. So for babies, I talk to parents, hey, when your baby's belly button heals up, I want your baby to spend some time on their tummy. We call it tummy time. They need to be on their tummy so that they can figure out how to use their muscles, how to use their arms, how to use their legs. They need time to strengthen their core. So as the baby is on their tummy, a lot of babies really don't like it. They kind of hate it, because when a baby's held up, they're held, they're snuggled. They like that feeling, but they can also see. Now, babies don't see real great in general, but they do like to be able to see. When they're on the floor, all they can see is the carpet. It's right there in front of them, and that's kind of it. They can kind of pick their head up a little bit and look around, but it's tiring. They've never had to do that before, and so they'll flop their head back down on the floor. And a lot of parents will come and say, hey, little Billy doesn't like tummy time. And I'll say, that's, it's kind of tough beans for him, because he's got to do tummy time, but we don't have to torture him with tummy time. What I need is him to do consistent work on his tummy every day. And over time, he's going to get better at it, and he's going to hate it less. And often babies will start out and parents will be like, hey, he really doesn't like it. And all right, then we're going to do short bursts a couple times a day. And they come back and their kid's 2 months old, and they're like, he doesn't really like it, but he doesn't hate it as much as he did. Because at this point, he can kind of pick his head up a little bit more. He can look a little bit more around the room, and he tolerates it a little bit longer. And then they get a little bit older, and then the parents are like, he's kind of okay with it now, because he can push up with his arms, kind of figured his arms out just a little bit, and he can arch his back. He's getting stronger, and he can look around the room more. And then they start to roll over, and parents are like, they like being on the floor at this point. They like being down there because they can move, they can see things, they can get there. And we see this slow progression from, I don't know how to do anything, so this isn't so bad. Hey, this is actually pretty great. And then, wow, I'm where I wanted to be. But it is that slow process that really requires consistency to ingrain those habits into our lives. That mom from the ER, it's still a new habit to do the medicine before brushing the teeth. But if they were to do that, because that's a small change and it's a piggyback habit, if they were to do that for a month or two, man, it's going to be an ingrained habit. It's not going to be something that they have to think about. It's going to be an autopilot type thing where it just happens. And if it doesn't happen, it feels wrong. So sealing our habits with consistency, very important. It does take time for our brain to reroute things, to change them. And that's why change, really, it's a journey, it's a process. And maybe we're making some progress there, but that's when we go back to the knowledge and we say, hey, I'm gonna look at what I'm doing. I'm going to evaluate what I'm doing. Maybe I have made progress and I've gotten to where I want to be, but now I want to be further because I really like it. Just like a baby. Hey, I can crawl, but man, that kid can walk. I really want to try walking. It's going to be hard to get there. I'm going to fall over a bunch of times, but I'm going to consistently put forth effort so that I can get there. Because I know if I don't, I'm just not going to get there. So as we follow through with consistency, we are able to bridge our dreams to reality. So that's where we follow the KEEP system. We seal it with consistency. We're going to progressively get to where we want to be. So we seal it, we make it non-negotiable. This is part of who I am now. This is something that I'm doing. We embed it into our routine. So that's where we evaluate and we exchange. We have a solid plan on how we're going to include these things to get us from where we are now to where we want to be. And so I know that, you know, the KEEP system, it's a fantastic way to help modify what we are, who we are. And as we follow those processes, we'll find greater success, because, you know, we all want to find greater success, but it also will help our clients to find better success. And it's such a great feeling. I love watching families learn and grow as patients, as their doctor. I love to see that change, that positive change. And as a health coach, it's certainly something that's so valuable as well. And I know that it can be beneficial for you guys. So that's what I have. I think we have some time for questions. Hopefully I didn't go too much over. Any questions that we have, Johannes?
Yes, absolutely. One question from Anna. I've heard you can't really break old habits, only lay down new ones. Is that something you agree with?
So one of the difficulties is when something, depending on how hardwired it is in our brain, it's not that you can't break it, but that pathway can still kind of linger. As far as how long pathways, we call it pruning in the brain, where neural pathways are removed. And that's a heavy process in kids based on what they're doing. In adults, it's not nearly as heavy a process, which is good. You know, I don't want to forget how to ride a bike because I haven't done it for 4 years. So some of it is good. So it's not so much that you can't break them, because you absolutely can. There are people who have smoked who don't smoke anymore, and they're not going to smoke ever again. But certainly there's still kind of that pull. You know, when you talk about Alcoholics Anonymous, they may not drink ever again, but they know that, hey, I can't put myself in dangerous situations. I can't put myself in situations that are going to compromise the success that I've got. And so it's not so much that you can't break them. It's just that, you know, that tendency might still be there. But you can absolutely modify what you're doing and what your automatic tendencies are. So hopefully that kind of answered that. It's sort of a yes and a no.
Yeah, another question from Rochelle. Any tools you use to keep clients motivated as they create new habits, which is probably one of the big issues, right?
Yes, motivation is hard. And that's where in the KEEP system, it's really important that we really start with the knowledge and the evaluation portion, because they may have the things that they know they want to change. But if as a person, I just say, hey, I want to be more efficient. That's such an amorphous goal. It's so hard to stay motivated on that one thing. But if we have the knowledge of, hey, these are my daily actions. This is what I do. These are the feelings and the situations that cue me to my habits. And we evaluate those. It's much easier to stay motivated on those small details, to say, you know what, if I modify this thing, like, hey, I want to read. All right, I'm going to include that because I have time in my schedule here. I'm going to make it part of my schedule. I am going to be much more motivated on those small things than on, you know, it's really hard on those big goals. I agree. It's hard to keep them motivated on those big goals. But if we get those goals more focused, we can help them stay more motivated. And then it's also great to be able to point out the progress that they've made. And, you know, if you're a new health coach, or you're with a new client, that is, I like to be pointing out, hey, you're here. You being here is amazing. And when you point out the progress that they are making just on being there, that is motivating. And when you've coached them through a period of time, you can say, you know, you started here and now we're here. You should feel really good about that. And so helping them to realize the success they made is in itself motivating. But motivation is hard. And that's where, as we design our habit, the positive things that we do become more automatic, because motivation, it will come and go. But, you know, and that's one of the benefits of having a health coach is you have someone in your corner who can kind of help walk you through those difficult times.
Wonderful. How long does it take to make a new habit? Sheila asking.
Sheila, that's a great question. It sort of depends on what type of habit you're looking at doing. So if you are piggybacking a habit, so where I talked about the mom in the ER with the kid, that's going to be a habit that's going to be ingrained a lot faster than a more complex habit. So a more complex habit would be like going to the gym. Going to the gym has a lot more moving parts. It's also sort of non-specific, so it's not maybe the best focused goal, but going to the gym as a poor example would be there's a lot more moving parts because you got to schedule the time in, you got to get there, you got to have all your stuff ready. And so those more complex habits take a lot longer to develop. And that's when we start talking about more towards the 90 days. You can get some more simplified habits to be much more habitual than they were within the 30 days. But as you get more complex, it'll take a little bit longer. And we're thinking more 3-ish months before those are more ingrained. Now, they're not necessarily automatic at that point, but within that 3 months, you can usually solidify a pretty solid change to where it feels weird when you're not doing it.
Excellent. Let me see. There's a longer question. Yeah, I think we covered that already. So, that's a good one, because in health coaching, there's a lot of talk and a lot of awareness, directive type of work with a client, a directive process, like we tell them what to do, so to speak, which is much a traditional way of doing it versus more questions, guiding, coaching, which is supposed to be non-directive. How would you say, how do you work as a coach? Because you're both.
Well, so yeah, I try, even in medical practice. I mean, I do a little bit of directive stuff, but when you're telling someone what to do, it just doesn't usually find as much traction with the person. Even for me as a doctor, I can tell you, hey, you need to take this medication. But if I can help them discover why they want to do those things, and that's through that non-direct approach, I find that to really be more efficient at affecting change in them. And that's where, talking to that mom, helping her understand how significant the problem was. I didn't have to convince her to give the medicine on a daily basis. I had to help her figure out, how can we do this on a daily basis? And so I like that more open-ended approach, because again, if you're telling them, you're going to find a lot more friction. When my buddy told me that I didn't have great posture, I butted back. I dug my heels in. I got great posture. I'm fine. Don't talk to me about what I need to fix. Even if they're coming to you as a coach for help, people don't like to be told what to do. Kids don't like to be told. Adults don't like to be told. Now, if they're coming to you for like personal training, they're saying, yeah, tell me what to do. And then, yes, it works, but it's good to have their input of like, what do you want from this personal training? And then it's not just you telling them what to do, it's you telling them how to do what they want to do. And you're going to find much more motivation from that.
Wonderful. Thank you so much. This was amazing.
Perfect. Thanks for having me. It was wonderful.
A doctor that does health coaching, because you kind of have both worlds in a way. And I guess that's part of what we're trying to do, right? Merge them so health coaches play a big role in healthcare. So thanks again so much, Derrick. Really appreciate that.
You're welcome. Everyone have a great day.
Thank you so much. We're gonna be back in about, 3-4 minutes. Take a little break, everybody. We come back with a great topic. Thanks again, Dr. Derrick. Really appreciate it. Thank you.
You're welcome. Have a good day.
Thank you. I think we're live. Hello, hello. Welcome back. Now, we have 3 more talks today, day number 4. And again, thanks everybody for watching live. I know a lot of you watch the recordings, which is great because there's so much content that you're going to learn about or that you heard about already. And lots more to come. And I'm so proud that our next speaker is here because she's amazing. As a health coach, the health outcomes she gets with clients are just mind-blowing. She's fun. She's a fireball. So hold on to your seat because you get a lot very fast in these 60 minutes that we have. And Sharon, good to have you here. So much fun. Thank you so much.
Oh, I'm excited. I'm excited about Spain next week.
Yes, I know.
Mm-hmm.
Now, let me introduce you quickly. So Sharon Ellert, certified health coach, NBH-HWC, lifestyle prescription university, trained faculty member, teaching at a root cause analysis, organ, mind, brain anatomy, training programs and degree programs. Your degree, the Ph.D. that you're going to do right now, soon done, right? You're kind of at the last 5-10%. It's going to be super exciting, very helpful, I think, specifically for health coaches. And so you're going to talk about how to reverse some tips, tricks, strategies, how to reverse chronic symptoms. And I guess you go into that at the beginning, the difference to the traditional health coaching model versus we look at more the specific root cause health coaching model that we use, which we obviously believe is super good because we have so many incredible health outcomes that people change a lot faster and more sustainable. So thank you. Sharon, we have, I think, enough time for a lot of questions at the end. So everybody start typing in during the chat, during the presentation into the chat box. So Sharon, we can get all the good skills and wisdom from Sharon. Thanks again, Sharon. Stage is yours.
Thanks for having me. And yeah, chronic symptoms, of course, is something that we as health coaches deal with every single day and witness every single day. And as we go through our training, we notice more and more people have chronic symptoms. We just kind of learn to live with them for the most part. But as we look into the statistics of it, chronic disease is at epidemic levels. It exists in every demographic of the population and has now become a great global concern. So in most cases, we've been told that chronic disease is not reversible, and we just have to live with those symptoms. And many times those are debilitating. And so as time goes on and we march through life, those symptoms seem to take more and more precedence and control over what we can do. But when we look at the treatment of chronic disease and symptoms through the lens of root cause analysis, then we're going to see that the trauma experiences, stress, and lifestyle are all major contributors. And over time, those experiences in the way of life influence our biological health. Now, according to the National Council on Aging, about 80% of adults 65 years or older have at least one chronic disease. This is worldwide. So that's not very good news. We know as situations continue to prevail, they tend to get greater and bigger. And so we've got to do something now to curb that. And so Patricia Stevens has a book, and she wrote a book called Reversing Chronic Disease. So she says chronic disease can lead to the death of our goals, dreams, and ambitions. So we worry about keeping our jobs, meeting the needs of our families, paying medical bills, and maybe most people actually lose hope over ever having a productive life again. That's how serious this is. We don't want to just learn to live with these symptoms. We want to do something about them. So what are the 3 chronic symptoms and diseases that we usually have a look at? Well, one is heart disease, of course, cancer and diabetes. These are the leading causes of death and disability, at least in the Western world, in the United States and Canada. But to add to these, and if you've been in the health coach industry, or you're a doctor or some kind of health coach professional, you will see things popping up more, like Alzheimer's, dementias, arthritis, asthmas, cancer, COPD, that chronic obstructive pulmonary disease in the lungs, Crohn's disease, all kinds of GI issues, gut problems, cystic fibrosis even is on that list. So Can chronic disease or symptoms be reversed? Well, to answer that, we have to know how we can use those reversal therapies. How do they work? And we've got, different avenues that many people go. Medical doctors, of course, we could all go to people like Dr. Derrick would be fine, but medical doctors have only a few minutes for each patient now. So they're usually just able to treat the symptoms of chronic symptoms disease rather than using something that's more natural or more rehabilitation. They typically will treat with medication to mitigate those symptoms. But, there's additional also specialty treatments that some people are now starting to take advantage of. So as an example, young blood repairs memory. So when they put young blood of young people into people with Alzheimer's, we see that may start to reverse somewhat. Diabetes, of course, there's new techniques. We can use some of those to lose weight and then lower our blood sugar. Stem cell therapy, as an example, is now being used to treat blindness and restore sight even. I was reading not too long ago about gene therapy helping heart failure, keeps the heart pumping. And of course, PTSD, we can use different brain stimulation, and some of that even counteracts depression. So there's other avenues out there, but the big question we often get as health coaches is, how can I reverse either my situation, condition, or alleviate my symptoms naturally? And so that's what we are trained at doing. And for most people with these chronic issues, like the diabetes or blood sugar, blood pressure, obesity is now becoming a world problem. We can reverse these conditions and alleviate the symptoms by making appropriate lifestyle changes. But undertaking these changes alone can take a lot of individual power. It takes a lot longer, and it's kind of hard to stay sustainable with it. And one of the first things that we look at, of course, when we're working with people as health coaches is to boost your immune system. And we know the basics of good health are eating a good diet, getting enough exercise, and plenty of rest. We've heard that over and over. But additionally now, of course, we can take supplements that improve your immune system. Some of those great options are vitamin C or garlic or different things that a nutritional consultant, a dietitian could help you with. But we as life coaches and health coaches as well know some of that background and know enough when to refer. Now, Michelle McMacken, she's a medical doctor. She's an assistant professor at the Medical University of New York Medical School. And she looks at this type of chronic disease all the time. And she says, we see patients reverse chronic diseases such as diabetes with a healthy lifestyle. So they're seeing that even in the medical world, okay? We can lower blood pressure and cholesterol as well. Now, sleep is perhaps the most important pillar of health, of a healthy lifestyle, because if you have poor sleep, all kinds of conditions will start to show up and symptoms, even Alzheimer's. So she recommends setting an alarm for bedtime, so it reminds you to go to sleep, not to wake up. And if you have insomnia, there's different things like cognitive behavioral therapy that can help. But exercise, physical activity, aerobic, of course, we know that 150 to 300 or so minutes of aerobic exercise a week is very, very good. And it's as simple as a brisk walk. But strength training is very important as we age because we begin to lose our muscle mass. So maintaining that muscle mass and the flexibility in our bodies is really crucial. And of course, avoiding being sedentary is really, really crucial as well. Now, stress, as we know, is a major factor in our health. And though good stress can be motivating at times and energizing, chronic low levels of stress, you don't even realize that, we're just getting used to living in a life of stress, can cause inflammation and disease. Now, we know that, but it's really hard to move around all that stress because we just get so used to coping. One way to counter this is to strengthen the parasympathetic nervous system. So examples would be practicing meditation, going for walks, taking breaks every 20 minutes. Sometimes just using a little system, like every 20 minutes, stop, just look around and relax for 20 minutes, breathe 20 breaths, and just take a break. So those sorts of things can really help us to take that pressure off, get centered, get a little bit more mindful. And it's amazing how much better even our cognitive self, never mind our bodies, start to feel. But there is an evidence-based correlation between social connection and longevity. We're seeing this in the geriatric types of medicine and research. So even talking to strangers can be beneficial. But when we look at the whole picture, we know, and much of this is not, new news to people, but it can be overwhelming to make so many lifestyle changes all at once. That's where working with a life coach is critical, really supporting you. So you can start small at first, focus on the main priorities, and slowly build up over time. That's what's recommended. Now, we know that diet really impacts our health. So looking at that aspect of the research and how it affects chronic symptoms, we know that the effects of diet has shown up as a leading cause of death worldwide. It's really something we need to focus on today. It is that critical. And of the 10 leading causes of death in the United States, at least 7, including the top 4, are now directly related to diet choices. So those conditions, of course, we hear about heart disease, cancer, lung disease, cerebral vascular disease, Alzheimer's, diabetes, kidneys disease. We hear about all these things all the time. But did you know that poor diet is responsible for more deaths from chronic disease as the population as a whole, even more than smoking? So these are the statistical analysis that we're looking at now to see the impact of how critical it is, not just to eat a diet of, just all vegetables or all whatever, but to do it according to your metabolic type, get good sources as best that you can. And people know that, it's probably not a good idea to smoke, excuse me, but they don't have a sense of the magnitude of the importance of the food choices that they're making every single day. So when we look at all the things that we've been taught, about food, we still see that there's a high level of processed foods that are being ingested by people every single day. So when we look at those statistics, if we eat a highly processed diet, 50% to 100% increase of risk of depression is what we see. And we don't make those correlations. When we're looking at symptoms, we look at root cause. That's what we do when we're trained at root cause analysis lifestyle medicine. Now, on the other hand, the good side would be if you have colon cancer and ate 2 handfuls of nuts a week, we have a 50% lower risk of death. So we see what happens when we don't eat properly, or we eat a lot of processed foods, or we see on the other side, if we make good health choices, not even does it do prevention, which is amazing, but it mitigates symptoms and even can start recovery. So we need to look at reversing chronic health issues through diet. And in fact, including more whole foods, as we know, as greens can help reverse chronic disease and symptoms, and plays a really critical, important role in prevention. So now this sort of means, well, what am I going to be eating? Well, vegetables, fruits, we know, whole grains, nuts, seeds, as well as some good sources of meat and fish for some people are really going to support our health. But it's important, once again, for us to look at the source of these foods. And so I just want to review again the elements of a healthy lifestyle. I think most people understand what that is, but just to see what critical roles some of this plays in what we are making daily choices of. So nutrition, of course, is, as I'm talking about, the most important. And it's estimated as about 80% factor, 80% in causing most chronic illnesses. So we have a choice here of, if we choose different nutrition, become more aware of nutrition, what is best for our bodies, and your body will tell you. We have a huge 80% factor in dealing with those chronic disease symptoms. Now, physical activity, we know both movement and strength are critical. Stress management, that is one of the big things we look at lifestyle medicine. What's our environment like? Healthy restorative sleep, social connections, the importance of that. And the meaning and purpose of life. So for some people, that's a spiritual type of thing. But even in my own practice, I get a lot about what's my purpose here? Because our purpose has moved more into survival over the last decade or so than it ever has. But if you want to really know some of the ins and outs and the real value of lifestyle medicine, Dr. Dean Ornish has written a book called Undo It, and it's a great. I kind of use it as part of my library for great resources on lifestyle changes that will help symptoms. Now, lifestyle medicine itself has become one of the leading therapeutic interventions for treating chronic disease conditions and symptoms. And it's an approach for caring for patients that focuses on lifestyle habits that can prevent or treat and reverse disease. So even as the symptoms begin to be alleviated, we want to continue to look at the root cause. Are we getting where we want to go? And replacing those unhealthy behaviors and habits with more beneficial ones that can help you live a healthier life. So the environment we live in, of course, is also a huge contributor to chronic symptoms and disease. How tired do you get? You get home, your feet are tired, your back aches, you might have a headache, you're exhausted. Well, there's a lot going in the world right now that's causing anxiety, fear, stress, what's going to happen tomorrow. We're not sure that, the stability of our world is shifting greatly. And when we feel we don't have control over our lives, we begin to close down. And these things can cause psychological issues as well, which is another component, a large component of what we deal with root cause analysis, lifestyle medicine, health coaching. So it's estimated that about 15% of the population will experience depression at some time in their point. This is worldwide. So that's approximately 280 million people in the world at some time. So depression is 50% more common as well among women. So looking at the practice, at the demographics of your practice, don't be surprised if you start to see that statistic pretty much be evidential in what we're doing when we're dealing with people. But, stress is, as we know, as we practice lifestyle medicine, stress is about 10% of what's happening and 90% of how we react to it. And this is where lifestyle habit changes can get us right back on track, feel more stable, and begin to alleviate some of those symptoms. Now, we've always had more focus on the physical changes that need to happen with chronic illness, but as we can see, we also need an intervention for stress, anxiety, trauma issues that can be incorporated into lifestyle medicine. Now, one of the most popular interventions that we use and I love is emotional freedom technique. And some of you might be very familiar with it. And for those of you who are not, it's a very easy technique to learn. The key, though, is the root cause analysis, because that gets you into what are we going to target. So we're dealing with the psychological side of things. EFT is a primary modality that's used under the energy psychology umbrella. Tremendous amount of research. It combines elements of the cognitive and exposure therapy with acupressure. Okay, so we use acupuncture points. Now, EFT International has done a lot of research on EFT, as we refer to it, and it can help people we statistically see now with anxiety, depression, chronic pain, stress, weight loss issues, and a myriad of other problems, all symptomatic. These are all symptoms of something underlying going on in your world, in your life. So there is extensive research on the protocols that we use in the training with Lifestyle Prescriptions University. And we do put a particular focus on EFT married with quantum neurobiology. And the results are, if we get a better understanding of how this works, then we can get way more track into where are we going. And when we can do that, we can get to the root cause more quickly and people feel more safe and comfortable. Each little incremental baby step can have tremendous outcomes in your quality of life and symptom management. So what is EFT? Well, it's basically just using a mechanical pressure, tapping on certain points that we have specifically have been identified as kind of endpoints. We know what those meridian points are about, and we use these mechanical pressure points on these certain acupressure areas so that we cause an energetic stimulation that changes the signal that affects the brain and the autonomic nervous system. So it's a whole body approach. That's what lifestyle medicine is about. That's what root cause analysis is about. We want to take a whole body, mind, and even spirit approach. So when we tune into our thoughts and feelings, and we get that kind of felt sense experience of a topic, and then we tap into certain acupuncture points, we see the physiological changes that happen in the body's resilience. It's amazing. It's astounding. So the research on EFT also shows a reduction in cortisol levels, brainwave changes, a decrease in the stress response, that's tied to that particular stress target. And we start to shift and rewire our relationship to that incident or situation. And whammo, now we're dealing with symptom management. It works quickly. Sometimes it may take more than one session, but we see miracles that would appear to be miracles happening even in a 1-hour session. So this is because it reduces the fight or flight symptomatic response, sympathetic response. So when we think of the incident that caused us angst, even if we think we dealt with it, we could have dealt with it on a cognitive level, on a mental plane, and we get into the body. It's a whole body, mind, spirit connection. And then when we go back and we look at that incident, we feel detached or neutral. So we no longer feel it in our body, and our system begins to normalize. And this is what happens. It allows the innate healing of the body and the mind to take over. What's going to happen to the symptoms? They're going to be alleviated. They're going to get better. You're going to feel better. Your energy is going to start to go up. So statistical results show that these interventions are even more effective than antidepressants or medications. Something good to know. We're not, advising anybody to change whatever has been diagnosed by another healthcare practitioner or your doctor, but we work in tandem with them. We want to be collaborative, and that's what I love about health coaching. Is we get to work with those other experts on a collaborative way. So in the health coaching world, you're not just really working often with just one practitioner. Now you're the expert of your body. You're the one that lives in it. So we suggest that you look at the events in your life that's caused you distress or pain, what's impacted the balance in your life, because these are the situations you want to target that can initiate recovery from chronic disease symptoms. So health coaching, of course, is what we are all about at Lifestyle Prescriptions University. And how can we bring all this together to look at the reversing of chronic disease symptoms? Well, we need to find balance. So our goal for you, with you, working along the path as you guide us, is to find the balance so that you are emotionally stable, physically fit, and spiritually sound. So health coaching is a practice. With health practitioners that apply, is really important, evidence-based health behavior change principles. And the techniques that we use to assist our clients and our patients is to adhere to the treatment and lifestyle recommendations so that the clients can achieve better health outcomes. And this is where it's so important to be collaborative. So we can support medical doctors, we can support dietitians, we can support other people that where it's chiropractic or other people that they go to for whatever reasons. We can work with them. I always make a point of finding out who my clients are working with so I can be supportive and we can make it more collaborative. As we bring this together, it creates a more synergistic approach and the people feel more comfortable and they can start to share information back and forth. So with all of their health providers. So health coaching, of course, as we teach it and we live it and we experience it and we offer it at Lifestyle Prescriptions University, is an evidence-based model for health behavior change. Now, it provides structured guidance to help patients to adhere to medical and health recommendations that they get maybe from their medical doctors and to make enhancing lifestyle changes. We want to enhance your life, not detract from it, not to make it more difficult. So all in all, health coaching is typically conducted in the context of health behavior of change for either the prevention of the chronic illness or situation or the symptom management, which is becoming self-management. So we help you and show you how you can self-manage. And this is where we really get to find an interesting phenomenon that happens, because the more information you have that can better your outcomes, the more committed you're going to be, because you're going to see the changes and you're in control of it all. You don't need to depend on us, right? So health coaching interventions help motivate people towards a readiness to change. We assist you to change unhelpful thinking patterns, as an example, promote change and empower you to achieve a self-regulatory and self-management lifestyle. So all of these risks that we have or the experiences we have of chronic disease symptoms will start to be mitigated. That's what our goal is, to work with you to help you get to where you want to go. So this is a physical, emotional, mental, spiritual journey. And my suggestion is we don't want to do it alone. If you undertake to do it on your own, it can be a long journey, but health coaching based on lifestyle medicine, root cause analysis, can quickly bring your balance back into your life. It reverses those symptoms. And I can tell you, I can promise you, if you work with a certified, qualified health coach, there can be a happy ending. Now, Lifestyle Prescriptions University is the forerunner in training certified health coaches in the practice of root cause analysis and lifestyle medicine. So whether you're looking to become a trained and certified health coach, being a health coach professional already and integrating this into your practice, or you're looking for support to recover from chronic illness or symptoms, or you just want information to prevent illness, then I really encourage you to look into the possibilities available at Lifestyle Prescriptions University. I just love what we do. I love the experiences that we have with people. I love making a change in the world. And this is one collaborative group of people that we have here in the faculty, on the board, in the life coaching world that can really bring to you the information that you need, and we can show you how to easily and readily integrate it for the betterment of and the quality of your life. So back to you, Johannes.
Yeah, let's see if there are questions. Actually, while I check the questions, Sharon, can you share some examples in your practice? You have so many clients, such a busy practice. What did you find is in so many, everybody's different, but as you said, it's the lifestyle part, as we know, but also the focus more on the specific emotions, specific stresses that people have. You work a lot with trauma, and also how that relates to the health coaching side, because often there is like, oh, this is therapy, right? Can you talk about that and maybe give a couple examples?
Sure. So
client,
we are not therapists. We don't operate as a therapist. Typically in that world, the traditional therapy works with telling you what to do, identifying, kind of putting a label on what may be going on. What we do is we go on a journey of discovery. Okay, so with the health coaching that we practice, it is has a different slant to it, and we know there's a lot of, health coaching, life coaching has taken off over the last 10 to 15 years, and there's many training modalities. But what we look for is continually to dive deeper. So somebody comes to you with a symptom. Okay, we want to make sure that we're dealing with what is actually going on here. When we come with stress, trauma, depression, a pain in the back, these are just symptoms. They are not the issue. So they're presenting as the issue to get our attention. So as an example, I had just recently, someone had hit somebody on a child, okay, was on a scooter, hit them. And when that happened, of course, they went into a complete, almost irreversible state of trauma. Now, the child ended up being okay, but that person that had the accident wasn't recovering from that. So we had to get into what was the situation. And there was a time earlier, okay, so we know, we can tell when we've got more experience that if there's a situation somebody has really gone into a state of trauma for, it often is an accumulation of more than one trauma. So when we go through life and things haven't been resolved in the physical body, that's where trauma is held. And then the cognitive mind has a story about it. We listen, but we look for what's the underlying message that's there. And that's what we become very, very good at, is identifying this isn't just about this one situation. And, it doesn't matter whether it's a trauma situation where you think you've hurt somebody and you go back and you find out, oh my goodness, there was an issue where they saw their dog run over and killed. So now we get back, so they're 8 years old now. And the reason they can't recover today when they have this accident, even though the child's okay, is because the 8-year-old is now presenting. So this is the beauty of lifestyle medicine done as a health coaching, connection with people, where we can get to root cause. We always dive deeper until we get to the situation that is really at the core of what is going on. And if somebody comes with back pain, we've got some amazing charts that have been put together. We've got health directories that we can refer to, that have been created by Lifestyle and Prescriptions University. And we can get really quickly to what is going on with this person. Why is that pain there? What side is it on? What's the meaning of all of that? And what possibly could have happened before this accident or this pain started to show up? We go back in timelines and we can see, are they in a regeneration mode? Are they in a stress mode? So we see many different avenues that we can get really closely predicted to what is the root cause of what is happening here. And that's what the key is. That's where the magic is, because we can look at a situation, physical, mental, emotional, and see that we have got an avenue, a pathway to go back, whether it's timelines, whether it's where the situation is situated in their emotional state or their feelings in their body. What is the felt sense that's in here? What does it remind them of? Anything else earlier in their life? And as we become more feeling safe working with somebody, and that's one of the primary things we work with, is helping people feel safe, then the subconscious will start to bring up more information. And now we're starting to get to the real roadmap of root cause analysis. When we get to that, we will see the symptoms of today will begin to reverse on their own.
I need to turn on my video and audio. Here you go. You type in some questions. We still have some time about with Sharon and questions that you have. It could be very specific, organ tissue related, specific symptoms that you'd like to know, right? Or just the techniques that Sharon is using in her practice that are very specific, right? Mm-hmm. So Sharon, talk about, let's say, one specific client, maybe a certain health issue, and what made the difference in your perspective, right? I mean, there's always what we call the standard health coaching, right? We help our clients. It's a process over time, and the client starts to release and understand, be aware, and shifts habits, which is perfectly great. But your approach is a lot more specific, right? So give one specific example, please. Okay,
sure. Well, I had a young woman, she was about 30, that presented with breast cancer. And so it's not typical for people at a young age like that to get breast cancer. So I looked at, well, what is it, duct or is it gland? And so we got that definition from her medical doctor, and she was in the US. So we were working with the practices that they have there. And of course, immediately they wanted to either do surgery and do aggressive chemotherapy and different things like that, because that's what the practice would indicate. She was at stage 3, potentially stage 4 already. And this had shown up really quickly. So these are all clues. It hadn't been a slow growing tumor. It presented quite quickly. So what had happened, in her world recently? Well, she had met a man, and it was at a type of a conference, that was a mind-body connection sort of conference. So she was very open and in receiving and wanting to change some things in her life. And she'd come through another relationship some months earlier that hadn't been all that great. So as we mapped all of this out, I could see very clearly there was an issue of loss of touch. So we got into the charts and I explained to her about the trajectory of going through the stress phase, coming into regeneration. And this is where we're seeing now what the situation we're dealing with, so what's going on. And as this situation became more clear, what we discovered is that this loss of touch had nothing. It was a trigger with the last relationship. It wasn't there. And with this one, there was a connection of touch. So sometimes when we're dealing with things, it appears like loss of touch is the issue, and it is, but it's not in the presenting situation. So what had happened when she got involved with the situation, felt more comfortable, really felt she could connect. She'd met this person at the event, which is another clear point of where her vulnerability was. All of a sudden, and she was very healthy. She had always was concerned about her food and whatever. Well, as it goes back, father abandonment, mother not connected. There was attachment issues there, and so this had prevailed throughout her life. When she met somebody at this event, she began to trust, and she wasn't used to trusting. And so when we weave all of these things together, it can sometimes seem a little bit insidious, because it's sort of this loss of touch. Why would the good relationship be an issue? It's because we aren't brain mapped for it. We don't know what good touch is. So here we need to understand too, with our training, Lifestyle Prescriptions University on what all of these things might incorporate, is that even when we're presented with something good, it might have a negative effect because we're not used to it. It's not familiar to us. Well, in any event, we did some more strategic work with diet, and we had different support with that, specific to oncology. And then we talked to her medical doctor, her oncologist actually in the US, and her own sister, the doctor's sister, was going through the same thing. So whatever her sister's regime was, she was going to put onto my client. Anyways, as we talked about it, she decided, I suggested that she may want to consider the surgery if it was not metastasized. The MRI showed it probably wasn't. Anyway, she did end up having the surgery. They said that they thought that it had metastasized into some other cells. We did some really in-depth work about all of those issues that she'd experienced as a child growing up, resolved those things, past relationships. She began to feel safe in this relationship to the point where even as she was sort of going through treatment and the surgery, they decided to get married. That was a level of trust she was able to bring to the table. And today, she's not had any interventions, any chemical interventions at all. And she's completely free. And she's just had her 6-month checkup and she's completely clear. And I want to point out, this is really important, really exciting, that when they looked at her lymph nodes, because when she went back 3 months later, they took more lymph nodes out because they wanted to see where it had metastasized. And they came back and they said, your lymph nodes are healthier than people that have never had cancer.
Now, I'm sure a lot of coaches that are not experienced working with more serious type of health issues like cancer, do you have some suggestions? Because I know you work a lot with clients that have long ongoing chronic processes, and
Sure.
that it needs a lot of confidence, right? What would you suggest to them in terms of building that confidence? What are some of the strategies you feel are really important?
Yeah, well, I think we need to take the confidence not from me, not my ability to heal you, because we don't have that. Okay, we're not therapists, we're not healers, but we are here. And when we use this process that we are taught in lifestyle medicine and health coaching, when we follow that, it becomes more familiar, like driving a car. And then you don't have to think so much about each step. It just becomes something that you can easily access. And now you become more present to the person. And we do things, like the learning state, so that we stay more present to what's going on in this field that we are involved with this person. And we know through quantum physics, we're all connected. So what we do is we want to see, looking at sensory responses, systems, that how people are responding in all different avenues. Be very attentive to all of that. When we are, then we can be more, and we don't use our intuition, but we can get a more sense of where and which direction they want to go. So if somebody has a chronic, thing that's been going on for a while, like I had somebody who had diabetes for 25 years, okay, insulin dependent diabetes, and I don't have the confidence in my skills, but I have the confidence, and I know how the body works. I see it. I know the body has an innate healing capacity, and I know that we got these issues because of some trauma we've had in the past. So when you educate yourself and are familiar with those things, you don't have to worry about so much, oh my gosh, am I doing the right thing? Am I taking them down the right path? We just take them on a journey, and we're on the journey with them. And in this case of this fellow, he was from the UK, and he said to me, well, don't even go with the diabetes, because he said, there's just no way that can ever be reversed. I know that for a fact. And I said, oh, okay. So where did that fact come from? Well, it came from his doctors in the UK. So I live in Canada, and I said, okay, well, you're in Canada now. Have you talked to anybody here? Well, yes, they just give me the insulin, blah, blah, blah. And I said, okay, are you willing? This is an exploratory thing. What the heck? Would you just be willing to see what could possibly happen? The very worst that can happen is you're going to feel better just because you're eating differently or whatever. So in any event, his wife was on board, and she agreed to help him. And we put him on a diet that has been known, not strictly ketogenic, but it was, a diet that's known. And we use some of Dr. Dean Ornish's guidance and different people's guidance on how to do this. And lo and behold, 3 months later, this man no longer is insulin dependent. And his doctor said, I don't know what you did, but whatever you're doing, just keep doing it. and that's food. But there was hope behind there, and the commitment of his wife to partner with us. So there's lots of different components. But you know, I always look at people because I also train some health coaches as well, and work with different people going through, you know, degree programs of all different sorts. And what I find is we put so much pressure on ourselves to have to know so much. We really don't. Especially here at Lifestyle Prescription University, we are a very collaborative group. You can post in the portal, you can ask questions. There's always avenues, even Googling, you know, Wikipedia things sometimes. You know, I'm not a proponent of all of what's on Google for sure, but you can find information. Don't ever work alone. And we're working in partnership with everybody. And it's not just on your shoulders. This is a collaborative experience, and we can help people in whatever level they're ready to go and move into. We can be there to support them to achieve that.
Yeah, I totally agree that the social aspect, the support, I think even as health professionals, right, it's so important, because if we know somebody's there, I can ask a question like, you know, I have a new client coming in that has this and that, you know, I've never worked with a client. What do I do, right? And having experienced health coaches and doctors and all kind of fields of practice is just super important. Now, one question that I really want to ask you to talk about is, okay, I don't know how often the scope of practice question came up over the last 4 days. And I think in part is because most of the health coaching schools, they pay a lot of attention that health coaches stay within their scope of practice. Now, my personal opinion is, and the way we teach is, it's a fine line, right? And we all know it's a fine line. So the question is, when you work, and by the way, Dr. Oelke, right, he talked a lot about emotions, that, you know, we need to be able to walk the talk and clear ourselves, work on ourselves. And emotions, for example, are such an important part, right? So the question is, how do we do that? And from my perspective, you know, using tools within the health coaching scope of practice, tools that are not therapy, right? Though that line is somewhat fine. But if we use these tools to help our clients de-stress, lower the intensity of emotions, why wouldn't we do that if they feel so much better? Now, I think, and I want you to answer your version, what you think your perspective on this is. And guys, type in the chat box, because it seems like that comes up again and again, right? And for us, we just noticed, right? And talk about that too, Sharon, that emotions, the stress triggers that we experience in life, right? The thoughts and beliefs that we have around something, the mindset, they're so important. I mean, I would say equally or more than even nutrition, right? So talk about that. And guys, type in the chat box, because I think we need to dive into this, and we have still some time, and have a really serious conversation. And by the way, before you go, I had this conversation with the NBH-HWC and a lot of organizations, and I think my perspective is that health coaching needs to move to the next level. For the next 5-10 years, it was core competencies, right? But I think we have to up our game. We have to up our skills, still within the health coaching scope of practice, which we all pretty know what that is. What do you think? What do you say?
Well, yes, that is a really important and critical aspect of even us as health coaches of our own well-being. Like, where do we sit in all of this? Because we have to feel comfortable and safe where we're going as well. So I look at this, and I know I might be a little bit biased, but I've been trained by some of the top people in the US and Canada in health coaching, in life coaching. And I'm finding what I found with Lifestyle Prescription University, and I was involved taking courses years ago, and it was still in mental health. This is a different approach. And so if you are just going to take, you know, a little 6-week course or a 6-month course and go out there and think you're going to start to deal with people who have, you know, chronic symptoms or long time, you know, issues, well, you want to take a step back, because we all have to be trained, you know, and that's why we have residencies in the medical world, and with our own self, we practices. And so that's why we practice with LPU, is because that's where the information and the safety and the understanding of where I can go comes from. So I I look at this as education, not knowledge. Knowledge can stay in an intellectual library. We can learn a lot of things, but when we educate ourselves, we also learn how to integrate that and use that in the real world. So as an example, working with a fellow with diabetes or cancer, I'm not the expert in those things. As a disease or as a chronic illness, I wouldn't put myself out there as an expert, but I can tell you what I do know and what is validated, not just evidence based, but what is validated by clear science statistically is we now know, even the Journal of American Medicine Association a few years ago said 80% of all illness they recognize comes from emotional trauma. So the whole world has exploded into understanding more about attachment therapy, polyvagal therapy, all the different ways that emotions and trauma can impact us. And it is the bottom line of what we are dealing with today. That is the cause. It affects our biology completely and understandably. We now know that the trauma is held in the body. You got 70 to 100 trillion cells. You got 100 billion neurons in your brain. Where is this energy going? It's energy, and it has to be dispersed. It has to be recognized. It has to be dealt with. It's not what happened to you, right? What happened to you was the 10%. The 80% is the meaning you put behind that. And we go back into lifestyle of children, and we see, my goodness, what's happening with children, and they expect in the world. What are they seeing in the world? What are they expecting of the world? All of this plays a role through the lens that we see life, and all of that gets integrated. So when we look at someone who's in trauma, look at them, whether it's a diabetic issue or whatever, there's trauma there and something's happened. So we don't necessarily have to dig all deep and get all the stories. That's not what this is about, but we need connection with the person, deeper understanding. Can you tell me of when this could have happened before? Where have you felt this? How often does this happen? Does it happen a certain time of the day? You know, has your diabetes gotten worse at different times? When did you ever feel maybe it was getting any better? Did that ever happen? And we can start to see the flow and ebb of their life. This is what this is about. It is not in a diagnosis. It is not in pigeonholing. It is not in putting one specific application to things. That's where the science has taken us. In health coaching, I think we have to be more present. I will never not take somebody and give them some advice as to what they might want to consider as a choice. So, and that's why I work with the other health providers all the time, so I can collaborate with them. But, we're never here to debate who's right or who's wrong. We're here to see what is the effect and the outcome of this person's health and their symptoms. So definitely we look at health, emotions as the root cause, not the physical or even mental depression or whatever symptoms. Those are symptoms. So to get into that sometimes, because, oh my gosh, I'm not a psychologist, I'm not a psychiatrist, I'm overstepping my authority. Your authority is here in the life exchange with this individual. If they've come to you, you have the authority to befriend them, to make them feel safe, to bring them some comfort, to bring them some ideas on ways they can integrate different things to help them in their own recovery. We're here to help them, as Dr. Derrick was saying earlier. We're here to help guide them into what they choose, what they're willing to take, and how can we help them get there? Not telling them what to do, but how can we help them get to where they want? So I don't hold back. I'm not a meditation specialist. I've been trained in meditations over the years, and many of them, I practice it all the time. But what you were saying earlier, Johannes, I think is critical. I work on myself every single day. There isn't a day I don't do something for myself on the energy level, on the balancing level. And so when I look at someone, regardless of what they're presenting, whatever the trauma is, even if it's recent, that they're responding to, I don't get engaged and involved in their trauma. I don't go down that rabbit hole with them. I observe them, I have compassion, I have kindness, but I know I can make a difference in their lives. And that's all your confidence needs to tell you.
And I think you framed it very well in terms of what health coaching is and what it is not, and thank you guys. I mean, I can see it hits a lot of points here, a lot of questions about this, right? And so let me, can you do a kind of quick response questions? Let me see. Okay, gosh, there's so many questions. So have you seen physical symptoms that are related to previous generations' experiences? Or that goes into something even further, right? But I think it's good to talk about it. And I think as health coaches, we shouldn't be afraid of these questions. We have these discussions, right? I mean, I think it's very clear. As a health coach, we do not tell our clients what to do. We ask smart questions. We listen. We are aware, right? We help them based on the 4 pillars of lifestyle medicine. And if we talk about stress triggers and stress situations, maybe the language we use is a bit more specific, and that's on purpose because that's what we found makes the difference, right? But you're going to be confronted. I think every health coach is going to be confronted with stressful life situations that clients have, emotions they experience right now. I mean, and thoughts they have. They share this all the time. So I think we can't escape that. And I think one thing I want to say, all of us have. There are so many ways how we can help coach. And that's the purpose of this health coach summit. You saw probably 10 different, somewhat the same, but quite different ways of health coaching, right? And that's great. So everybody that listens, find your path. And like Sharon, thank you for saying this, is work on yourself, build up your confidence. And once you have this confidence, if you just work with nutrition, great, do that, right? If you feel, well, I get better results with clients if I address the emotional component, do that, but within the health coaching scope of practice, right? We never question that. We know it's the way we ask questions, the way we communicate. It's not telling them what to do, right? We all know what that means. But still, I think it's time for us, and it's good for us to expand and use what we call the biopsychosocial model, what we call organ, mind, brain anatomy. So that physical symptoms and previous generations, which basically means parents, grandparents, and even going back further, that there is a epigenetic, we're calling that, right, coding. You want a quick answer?
Sure. Well, epigenetics, of course, as we know now, and we know now through gene therapy, and we know now even through EFT, using those types of different protocols and into psychology, affects our gene expression. So when we look out into the world, what our environment is comes back as an impact. It gets decoded in our brain as to what to expect. We Google the past, come up with a solution, and that's why we keep thinking the same things and making the same choices. We're not looking at life as a new event. So partly what we want to look at is that each event, each moment is something new. It's not the old. It's not just one more breath. It's a new breath. So when we look at life through that lens, then a potential possibility then, of course, comes into the table. It's not looking for what is the past solution. That's not science. That's not health coaching. It's what's possible here today, now, and what is available so we can go on a journey of discovery. So is past generations implicated? Absolutely. Because we now know as well through birth trauma training, I got that through Dr. Stan Groff, is an amazing doctor. He was at UCLA. I think he's now back in Portugal. But these types of things we can see even at birth. Look at the brain scans. Dr. Anton, as you see in Germany, look at what he does with the brains, and he can tell where the trauma is and these different things. So we know now that trauma is biological, okay? It's not just psychological. It's not just thinking patterns. It becomes biological. So is it something that comes down through birth? Well, statistics say 5 to 15% of generational trauma does come down through our DNA. So how is that going to be expressed? We don't always know, but we'll ask for patterns. Has this ever happened to a mother or father? Has it ever happened in your grandparents? Has there, if there's issues with money, has there been, generational trauma with money? Has there been wars, people in wars, those sorts of things? Well, those things can be somewhat helpful. And even addressing them in EFT, using as an example, you don't have to be specific, but we can hit the chord. If there's a story that the grandparents used to tell all the time or the parents experienced, you can incorporate that and say, even though they went through this, I realize now it doesn't have to be my story. Incorporate, be developing things that work for you. Don't hold back to just a specific protocol. Protocols aren't the answer. It's how you utilize them. So put yourself into the situation and you're going to get great results.
Yeah, another question here was, Tracy, we are not prescribing any diet. Exactly. As health coaches, we never prescribe any diet. Absolutely not. Absolutely not. And we're not doing deep therapy. No, at all. Not at all. Not at all. And again, I think the fine line is if somebody presents a strong emotional charge or a strong emotional situation that you're in right now, then I think it's based on our skills, right? And based on our presence, as we're calling that as health coaches, that we in the here now. I think if that comes up, we can't escape it, I think, almost, right? And so we're using listening, active listening, and the skills we've all learned in our health coaching trainings to address that. And basically, let's be honest, it's exactly within the 4 pillars of lifestyle medicine. I think that's what we all need to focus on, this evidence-based lifestyle medicine. And stress management can take many different ways, right? Stress can be just the work stress we have in life, and we find new habits, new solutions for our clients. Not we do that, but we ask the questions, right, for clients to find that, to explore it, new habits. Could be emotional and so on. So it's, I think, it's and thank you guys for having this discussion, right? We didn't have it much over the last few weeks. I'm at 4 days. I thank Dr. Oelke and some other speakers to readdress that. And again, I think I think if this is something you're interested in to go beyond the nutritional side, then please do. If not, that's totally perfectly fine. We just want to talk about it so we expand our skill set in terms of health coaches. Okay, I think one last question. We go a little bit over time, which I think is fine. Here, Jane, you're so right. This is why it seems AI cannot take over our jobs. Yes, absolutely. I don't know. Can AI be present in the here and now?
Well, let me tell you some research I was reading this morning is they've already proven it with mice. They can take any cell out of your body, create an ovum and a sperm, and create a baby just from that one individual. So this is where AI is getting a little bit out of control. We don't know where all of it is. But what I find with lifestyle medicine and working with people like Dr. Jane, watching her, she's on the committee supporting us through our degree programs and things. And, Dr. Catherine Alter, and of course, we work with these people and Hazel and Johannes and all the other people as well. We've got so many people that have such great backgrounds. But what I love about it all is they come from the heart. You cannot create AI heart. And when we are there in the presence of our heart, that's our primary brain. And that's where the wisdom lies. We don't need just knowledge and education, academics. We need heart, because that's the interpretation that brings the wisdom to the table. And that's really where we need to go, I feel, anyways, on the planet with people. When we've got chronic disease out of control, we've got other situations that are continuing, even on the obesity scale, just almost in a sense of people have lost control of themselves. There is a lot of influence of AI through the EMFs and all those sorts of things. We've got to start preserving yourself, not just taking convenience as the way out. Watch what things are doing to impact you. Always try to stay in the heart and work with people that are in the heart. And you will find recovery, you will find help, you will find health, you will find happiness. And you can live a life that you may not even have thought was possible.
Thank you so much, Sharon. And I think last question, Tim and Katja was saying that, we need to protect our clients at all costs, which means safe environment, help our clients to feel that safety, because that is probably the biggest starting point for clients to change. If they feel safe with us and find a way to change and provide options. And that is through listening, active listening, positive psychology, on all the wonderful health coaching techniques that we know and use. We are helping them to open their minds for new possibilities.
Yeah.
Should we close with that? I think that's a great ending, right?
And I'll just add one more thing on that note, that I think it's important and valuable when we ask the questions as we're doing our initial interviews or even further sessions, that we go back and ask the same question again, because it's another level that's going to be speaking to you. So we never look at anything as an absolute. We keep exploring, and you're going to be surprised at what emerges, because that's an indication of the amazing work that you're doing.
Wonderful. And some funny thing here, Marna, AI will blow itself up trying to figure out consciousness. I love that one. Guys, you're so amazing. Thank you, everybody. And as you can see, we're not afraid here at the summit and what our whole community to have intense discussions, right? I think that's how we learn, right? Some of us think, oh, that's too far over left or right, right? Or it's like, oh, that goes in the wrong direction or whatever. That's okay. We want to talk and communicate. I think that's a skill that has been lost quite heavily. And I think that's good. And by the way, again, below the chat, there's a Twitter, follow Twitter. We're going to move a lot of these discussions on Twitter. We're going to have Twitter Spaces also over the next. Our podcast goes there because I'd like to stimulate all of us to discuss, to talk, to share. You guys are so amazing, everybody listening and watching the replays, right? You have so much wisdom, so much knowledge. So let's share, learn from each other, right? And doesn't mean we agree with everything. No, we don't, right? But that's okay. That's what it needs to be a human being and work in a community, right? And to me, and again, I have this conversation with Leanne and Orlowski and many in our community many times. I think we need to create more power within our community. I think we're too nice. Right? We need more juice, more energy, because otherwise nothing's gonna change. Like, right? I've been in this for 30 years now, 35. And I'm kind of shocked. It seems like it goes backwards in so many ways, right? And so I think we all have to step up our game and get out there. And as a community, right? Work together, not to be like a little community here and there, right? And we need to have a big community that kind of lobbies, that gets the word out and shows millions of people that there are options and possibilities, right? That's how we get health coaching to be part of healthcare, that everybody knows about it. So if this rings a bell, please. Thanks, Sharon. First of all, Sharon, I know you have such a power, and you have so much confidence in your skills, and I think that we can learn a lot from that. Doesn't mean we just do whatever we want, right? It's like just internal confidence, stay within the scope of practice, obviously, as health coaching, and help our clients however we can in terms of showing them options and possibilities. Thank you, Sharon.
You're so welcome. Thanks for inviting me.
So much. Everybody, warm digital chat applause for Sharon. And we're going to be back in a few minutes with the Fiona, Australia Health Coaching Association. And then the last talk I have about, how can we make health coaching available, accessible to everyone? Here we go. Thanks again.
Thank you.
Thanks, Sharon. Hi guys, back here at the Health Coach Summit. I loved that discussion before. Thank you so much. And again, like I said a minute ago, that's part of the reason why we decided to actually move our podcast to Twitter, because we feel it's a platform where we can reach a lot more people, where the engagement is included, right? So I hope you join, and you obviously get an email. We're going to have a really, really amazing first Twitter Spaces. We're going to, I think it's July. I forgot the date, but I will let you know, obviously, one of the top lifestyle medicine experts in the world, very influential, and she's going to be part of that first Twitter Space. So please join, right? It's a way to communicate, to share, and grow our field, which I think is so important. I talked about in the last talk about that. Now, we're going to continue with, actually, it's a recording because Australia is so far away in terms of time zone, right? Fiona Cosgrove, which she's a founder of or director of the Wellness Coaching Association in Australia, National Board Certified PCC, and does an amazing job in Australia. And Magdalena, which you saw yesterday, she interviewed her. She's also in Australia, Sydney. She interviewed her, and you're gonna see the presentation and the recording. It's about 35 minutes or so. Excellent presentation and talk from Fiona. So, Sandra, you want to start a video, and I see you back in about 35 minutes.
So hi, Fiona. Thank you so much for being one of the amazing speakers here on the Health Coach Summit. And, you know, I know, and I've seen you on so many platforms, seen you on so many boards, and the industry has been very blessed to have you in so many years of your passion in this industry for wellness and coaching. So I would like to introduce everyone to Fiona Cosgrove. She's the CEO of the Wellness Coaching of Australia, which I know has just made such a big difference in Australia and internationally. And I know that you've been a pioneer in the industry, not just in the health coaching for over 13 years, but also in the fitness industry, where it really all began with you. Is that right? So
that's correct, Magdalena, and thank you for that very kind introduction.
Welcome. You deserve every bit of that and more. So I would love to know more about, so the coaches here that we have through Lifestyle Prescription, you know, the coaching has changed in Australia, hasn't it? So, you know, the direction of where coaching was and coaching is in Australia and internationally, you know, where has it come from and where is it going?
That's a really big question, and probably needs me to go back in history a little bit to answer it more accurately. In terms of where it's come from, I can really only speak from my experience, probably being one of the first people in Australia to have heard of wellness coaching. As you said, Magdalena, I came through fitness and was very involved in helping people get physically fit, but at the same time realizing that there was a mental component that we weren't addressing. Hence my interest first in studying counseling. Then I discovered wellness coaching, and I said, look, that's the missing piece. So after training, I then started, I guess, spreading the word in Australia that we could be helping people with lifestyle change in a more effective way. And I was speaking mainly to the fitness industry. In the early days, I used the term wellness coaching, and we could have a good debate over what's the correct term. I prefer to call it health and wellness coaching because I think there are connotations around the two words. But wellness coaching initially was what really spoke to me, coming from fitness. And in the early days, we were really speaking to people who were working in the area of lifestyle change. And a lot of the things were around movement and nutrition. And it has changed very slowly. And this has been sort of between 5 to 10 years in the making. And now we're finding that the term health coaching is more prevalent than wellness coaching. So I know we're not here just to talk about which term is the correct one, but I think that speaks for itself. Health coaching is a suggestion that it is used in other ways besides just being well or improving, getting
Sure.
optimal wellness.
Sure. Yeah. And I listened to a video that on your website saying that, we as coaches or back in the day was the pressure on us to really have that pressure to help our clients, whereas now it's really the clients, which coaches really need to know, the clients, it's on them, it's their responsibility, right? How to direct the advice that we give them as coaches.
Yeah, that's a really key point. And I think we don't need to sort of teach people how to coach here. But of course, for me, when I discovered the principles behind the coaching approach, I almost breathed a sigh of relief and went, as many people do who train to be coaches in health and wellness, they go, oh my goodness me, I don't have to carry the responsibility all on my own. It's not that I've been doing it wrong. There is a different way of working with people. And as you say, it's based very much soundly on handing responsibility and empowerment to the client.
Right. And how was that, the benefits of that with the client, so that the coaches here know, I'm sure that they've gone through their own coaching regime and programs, but, there are such big standards to fill globally, from Australia to internationally. The last few years have been so different with COVID and everything. So what is really at stake, and how can coaching, health coaching or health wellness, as you'd like to say, play a vital part in people's lives?
Yeah, I think it's never been a better time. I think we really are sitting at that point where this is where we will gain traction, and this is where we're most needed. And without repeating history to everyone, we know what's happened in recent years. We know that people's needs have changed. There's been many more challenges that came about with COVID, admittedly, but also they were starting before that. I was reading something recently and it was saying, it's been a gradual build-up of anxiety out there in the world. We have climate change now, we have wars, we have the gun debate, we have so many things other than the pandemic. But the pandemic was, I think, where the shift moved from physical health, which is still incredibly important, and that was probably made worse by inactivity and being locked in, but also mental health. So, isolation, family separation, missing significant milestones, all those funerals, weddings, kids at school in their final years. And then again, of course, long COVID, the physical side of it. All these things have now resulted in people needing support and looking for it in a different way. Yeah,
exactly. And really, it still lingers on with a lot of, as you say, the mental health. So, Fiona, your involvement in the global wellness, the initiative on wellness coaching has been so passionate and so successful, and really, hence, it's shown in your business. The presence of the health wellness in Australia is so strong. So, can you talk about a bit more about how has that international collaboration around standards and coming together? How are the things different?
There are lots of, again, pieces of that. I think you mentioned the Global Wellness Initiative. So the Global Wellness Institute has got, as you know, wide feelers over multiple aspects of wellness. And it was almost sort of recently, maybe 4 years ago, when they set up the initiative. So that the group that said, okay, let's have a look at wellness coaching and get some information out there. And that has been fantastic working. That was my first probably close collaboration with international people. So from the US and then from the UK and Singapore, where we put our thoughts together and researched pretty much everything there was on wellness coaching and wrote a white paper. At the beginning, very general. The second one has been on the corporate space or health and wellness coaching in the workplace. And they're now working on a third paper with diversity, equity, inclusion. So that in a way is a very broad awareness thing based off the back of a very, an organization that has a lot of attention. In terms of your question, I think, Magdalena, the international coming together, I am very affected obviously by the NBH-HWC, because in Australia and New Zealand, we were on our own. and we did not have the resources to create standards. So I watched 10 years ago when the NBH-HWC started to be formed, and I went over for a few meetings, and then I watched them create what is now, as you know, turned into board certification, which is really today the highest ranking credential you can get as a health and wellness coach. So the NBH-HWC has led the way. We followed with them, getting our courses approved in Australia. Whether people sit that or not is up to them, because what's happened in Australia closer to home is that we've formed our own association, HCS, and that has been an absolutely wonderful start to, I guess, the medical world sitting up and paying attention to what had hitherto been really just a term. You know, health coaching, wellness coaching, there's a lot of influencers out there calling themselves that.
Yes.
Whereas with an association, you can then start gaining more traction.
Right. So, you know, just along those lines of health coaching and wellness coaching, you know, you said that there's a big difference. So what does the wellness, you know, mean for you?
I think that the big difference with health and wellness coaching is purely in its marketing appeal, which is why some years ago, again with the NBH-HWC, decided at their initial meeting that the term health and wellness coaching was a clearer delineation of what we do. And if people want to use health coaching because it's easier to say, admittedly, and of course there's a bigger need for it. You know, governments want to know about health. They want to know where they can save the most money. So coaching around chronic conditions is a logical place to use health coaching. Wellness coaching may have the sound that it's something a little bit softer, but the reality is now, of course, it's changing because mental well-being is getting as much attention, mental wellness as health.
Yeah. So with the wellness, what's your programs do as regards to, you know, because there are so many programs out there in health and wellness coaching, but with your programs, are you really directing it to?
I think it is a good question, because one of the dilemmas has been, as our training has grown, we have made sure that we covered a wide gambit of what we felt was important learning for someone to be able to coach. And if we said very broadly it's around lifestyle change, that can encompass both health and wellness, as you know. And we get asked this a lot. So say, well, what do you mean you're a wellness coach? We say it really doesn't matter what outcome someone wants. If it improves their health and well-being, we are going to use the same model and conversation with them. However, what's happening, I think, Magdalena, at the moment, is that people are looking for it in more specialized fields. So we were asked a few days ago if we could train a team of nurses who were being put together to work with breast cancer survivors. And of course, we're delighted to do that, but they did ask, well, do you include trauma-informed principles? So there is a lot of talk about trauma in coaching, because until now it's all been the world of the therapists. But we're starting to realize that trauma can come in different shapes and sizes.
Yeah.
The point of telling you this is that we are aware that we need to add specializations to our training. So we've partnered and offering a mental fitness coaching component. Right. And again, same thing with working in cancer. There are specific areas, even group coaching, that requires, I think, just a more precise program to be written. And that's what we're spending a lot of our time now, is actually making this be able to appeal to niche groups or particular outcomes.
Yes, yeah. And so with the coaches out there that are here listening, you know, are there any, you know, advice or things that they could take away from, you know, some of your programs, or some things that you're finding, other than, you know, definitely the trauma that now you're initiating, and, you know, the mental, emotional health as well? Is there anything that you can, you know?
I think that, sorry, Magdalene, I think that if I were to say anything, I would say get a very broad base of knowledge. So we know that there are people, particularly when they come from nursing background, that are working with specific populations, and that knowledge is so valuable, really, really important. But then if they want to coach around that, then it's worth stepping back and getting the broad coaching skill, because they'll start to realize that the principles can apply to any change. However, if they want to work with a specific population, they need to narrow their focus. I believe we can't be everything to everyone. And I think that there really is a need for people who put their hands up and says, this is who I coach. And that doesn't mean that I would coach people around a multitude of different required outcomes. But I think it's a really good movement for the industry to start moving in those directions. So we specialize.
Yes, because, you know, even with lifestyle prescription health coaching, there's, you know, an array of type of coaches. They're really doing getting in and helping these coaches understand the mind, body, and brain coaching. You know, that's finding the connection emotionally and physically. And you, in your field, have seen that with the fitness industry as well, and collaborating that wellness. So, you know, that correlation you see as well.
Yeah, I think I'm understanding what you're saying there. One thing that I kind of, two words stuck in my mind, and this is where it becomes not a dilemma, but just interesting how we come together. So we talk about lifestyle medicine and we talk about lifestyle prescription. And just to make it clear, and I know the coaches listening here would agree with me, we don't prescribe medicine as coaches.
Yeah.
And we don't prescribe anything as coaches,
Yeah.
unless we're
no, lifestyle prescription is not prescribing. Yeah.
Exactly. But it's funny, isn't it, how the words, but that doesn't mean
Yes.
that we can't work in tandem with a health professional who is giving a prescriptive model or recommendations for a client, patient to take up. So it's where we join together and how, but I'm really keen on selling that notion that when we don't work in medicine, we work with medical practitioners and lifestyle medical practitioners. And all of those people, even doctors come to our training, find that learning coaching principles just helps them connect with clients better and delivers their, what they might have called advice, I like to call it information.
Yeah.
It delivers that information in a way that's going to land better with the client or patient. I like client because it's much more empowering.
Yeah.
And if they get information, it implies that they have a choice. And even though we know that they will ask the doctor or whoever to say, well, what would you do? What should I do? I think that by giving them that information and saying, how do you want to move forward on this, is such a great way of passing that responsibility back to that person.
Yes, yeah, absolutely, absolutely. And, you know, with the coaching being so much more needed around globally, in Australia in particular, you know, is there something that's lacking perhaps in the industry at the moment that we need to implement?
I think we're about 5 years behind where I'd like us to be.
Really?
But we're a few years behind the recognition, obviously, that the NBH-HWC has brought to the United States. They're a much bigger population. Australia and New Zealand, even though we banded together to create our association, we simply haven't got the population to move as quickly. We don't have the capacity, for example, to write very involved standards of our own. So we have simply sort of built on the work that has been done overseas. The UK have done a huge amount of work in creating their standards. And then we're trying to tailor it so that we take into account a lot of the different cultural differences that we actually have in Australia and New Zealand. So diversity, equity, inclusion, I know is used a lot, but when it comes to Indigenous populations, we have considerations there that we need to include in our training if you're working in Australia. The reality is, to be honest, many coaches are working across the world by using the digital platforms. But to get back to what you were asking about Australia, I don't think we're alone in saying the healthcare system is desperately in need of another group of people working with the people who have such a strong need for support. It simply can't cope. And I don't think that's Australia and New Zealand alone.
I agree. I absolutely agree. Because, you know, if there was more coaches and if it was more of the stands were more available to set, because who is actually benefiting? Like the clients are benefiting, right? There's not enough coaches to help these people that are needing the help, right?
Absolutely. And I think it is important for us to have a strong set of standards so that the public will know what to ask for when they get a coach. But I also think that as time goes on, already I know there's masters of health coaching Now, not everyone will go and do a master's degree, like studying as much as, for example, I know I do. But you know, the fact that there is one is absolutely wonderful, because a lot of research will come out of that. But I'm a great believer, as I always was in fitness, despite the fact that, you know, I had a degree in masters in sports science. Some of the best personal trainers I knew did the base level of training, so they kept people safe, because their personality allowed them to work with people. So I think that it's really important to know that health and wellness coaches can come in, not all shapes and sizes. Their education could come at different levels. I don't think we need to determine, you know, level 1, 2, or 3. I don't think there's a need for that yet. But I would hate to think that people were being excluded from this work because they didn't spend 4 years studying. And that's a personal opinion. But I believe that where we're at now with the standards leaves it open to an awful lot of people to do a lot of really good work in this field.
Yes. And I noticed on your website that you actually say that you doesn't matter, there's no necessary experience that you need. You just need the passion, and, you know, you also need that understanding. So it doesn't matter where your background is, you don't have to have really that experience, because you know, you're offering the program to help with that, educate.
And sometimes it's easier actually to work with people who haven't been spending 10 years telling people what to do. And don't get me wrong, this was really quite new in terms of people knocking on the door saying we'd like to become a health coach. And if they had no background, we would send them away. And then we decided that we needed to write what was missing. So in our program, we keep adding to it. There are not specializations, there are very general healthy lifestyle modules. One thing HCS have done in Australia, have increased the number of hours of learning for someone who has no health background. And it's all about safe principles. So it's safe principles around movement, around nutrition, around stress, understanding stress. So all the common things, and it's not about prescribing, it's about knowing how to keep these people safe with this understanding behind.
Yeah. And I love how you mentioned about, you know, the anxiety and the stress and the nutrition, you know, and it's giving just the knowledge to these coaches about nutrition, because in your programs, you're not nutritionalists really.
No, and I think that's also about being literate. So health literacy is important. It doesn't mean that we have to, for example, know the name of every medication that someone's on, but if they're talking about a particular condition that the doctor has diagnosed or whatever, it helps to have an understanding around that. But I think that an understanding more of mental well-being and the particular types of stress that people are under today is as important as knowing what makes the perfect diet, because they're not being asked, the coaches are not prescribing those diets. So yes, we know that gut health has received a lot of attention and we believe it's incredibly important, but that doesn't mean that we're prescribing anything in that area. Whereas if someone comes in and they start reporting a sense of overwhelm, we can probably do as much good talking to them about their lifestyle habits, as in how do they spend their time? Are they still having the ability to focus? Because people are actually losing that attention. It's not attention deficit disorder, but the ability to pay attention is something now that's getting in the way of people making lifestyle change. And I feel that that's the area that our coaches really need to excel in, to really understand.
And that's perfectly, because that leads me to my next question. You know, the health coaches needing to understand about, you know, lifestyle change for their client, right? And what advice, you know, they can give, because you don't want to obviously be out of their scope of practice about, like what you said, not prescribing medicine. So, you know, that scope of practice of really, you can give advice on definitely asking, you know, helping them with their mental health to a degree, right?
I think it's about knowing what questions to ask, Magdalena, to be honest. I think, again, we still talk about information. If someone is struggling to create change in a certain area, the most important question we can ask is, what's stopping you? And by asking that question, we will then start tapping into what's going on in their lives that's getting in the way. Because if it was easy and there weren't barriers and there weren't challenges, they'd already be doing whatever it is they're trying to do. And I think this is the complexity of today's world, because of the fact that there are so many things causing anxiety. There are so many demands on people. We are being hit left, right, and center by a million different diversions and distractions, thanks to the technological industry that has surveillance over every move that we make. Yeah. And as you can tell personally, I believe that this is one of the biggest problems, and our coaches are better off asking, what's stopping you losing weight, sleeping well, whatever it is, and working on changing those factors as much as eating the right foods or whatever it happens to be, which is also important.
Yeah, I agree. That is a great piece of advice for our coaches, you know, and it is just the simple questioning of, you know, what are they capable of doing? How much will it change their lives, really?
Yeah, that's another one. Yeah. What will happen if you could change? So that's tapping into their intrinsic motivation and their values and helping them move forward. But that question around what's stopping you is one that often makes people stop and say, I haven't really asked about that. And that's where you get the gold. That's where working as a health and wellness coach becomes so interesting, because you have no idea what the answer to that question would be for that person.
Yeah, and we can't assume as coaches, you know, we are definitely not there to judge and assume. It is just questioning them, because ultimately the clients have all the answers and solutions and conclusions. Right. Yeah.
And because our work is becoming more complex, there is a question there, you know, where do we stop? What is our scope of practice? And we need to be really clear around that. But the boundaries are becoming blurred, as we said to start with, that, like, for example, trauma, we just never, everybody would go, no way, we don't do trauma. Yeah. And I listened to a wonderful speaker just recently talking about it, saying you can experience trauma, you know, in the workplace by somebody treating you a certain way. So it's about knowing when professional help is needed and when we can have a deeper conversation around some areas that may not have come into our scope 10 years ago.
Exactly. You're completely right. And I have, you know, known people that as everyone's coming back into traveling and, you know, going out there to the industry of hospitality, there's some aggressiveness coming on. So there's trauma right there. The people in hospitality that's receiving this, you know, so that, like you said, trauma can be from childhood. It can be from any instance that happens in a client's life, and knowing a coach can actually, you know, help them along and just support them and find out what the actual issues are.
And this is interesting because that makes me think of two things. Firstly, have you heard the term FOGO when you were talking about people traveling? You know, it used to be FOMO, fear of missing out. Yeah. What happened with COVID, it's now FOGO, which is fear of going out. So there are some people who actually are struggling with that, with actually, I don't feel safe. And that is a really kind of important thing. But also getting back to the diversity, equity, inclusion, it's not just a sideline that we can cover in an hour's talk. What's happening there is so much more awareness of people choosing to live their life the way they choose to be who they are, that health and wellness coaches are now specializing in those areas. So coaching transgender, for example, you know, coaching gay, coaching whatever it happens to be, those things are coming up as areas of specific challenge and also specific populations. So without wanting to treat people differently, at the same time, we need to understand the challenges that minority groups are facing.
Yes, that actually makes complete sense. And that helps the coaches, you know, once they do the broad understanding, the education, they can sort of niche where they feel drawn to. Is that right?
I think that's a good idea, but it's also that awareness to know, are we behaving a certain way when we don't realize that we may have, if not prejudices, you know, ideas that we don't really, or preconceived ideas about people. So we need to be very careful to do an awful lot of self-reflection as coaches. As I say, it's become more complex and deeper, I think, than it used to be. And that's wonderful. And that was I went without going too much self-indulgent area of research, was about the coach's journey. So the personal development of the coach, I think now is really under the microscope, because there's so much to keep up with that unless we actually look really closely at ourselves and go through personal growth ourselves, we can't coach people in today's world.
Oh, I love that. I absolutely love that. That makes perfect sense. And just to understand about your programs, if people and coaches want to know about more about your program and about your coaching in Australia, is where could they go to if they want to have more of an understanding?
Wellness Coaching Australia, www.wellnesscoachingaustralia.com.au. What has been interesting, just as an aside, having moved from pretty much live learning to remote learning, which was fantastic because it meant we could all keep operating and keep connected during lockdown and COVID, is as an experiment, we decided that we'd try the opposite and do an intensive residential 4 days. And we really didn't know whether anybody would book in. And it was full within 2 weeks.
Oh,
so it may not be for everyone, but they're traveling, and there's 18 people virtually locked in together for 4 days, and it has been the most rewarding, exciting program to run.
Fabulous. That's fabulous. And just the last question, I'd really like to hear about your thoughts on where you see the health and wellness coaching in the future, like in the 5-10 years down the track. Where would you personally like to see the coaching directed to?
Oh, it would be wonderful if everybody just knew what they did and what they were. I would love to see health and wellness coaches working in so many different areas with so many different populations. And I think that's the problem in a way. It's not just this is where you work in a medical clinic supporting doctors. You're going to see them popping up anywhere that there's a need for people who need support without therapy. And that is pretty much all over the show. But at the same time, we need to be able to have standards and credentials that make it quite clear where our scope of practice stops. So where do I see it? I just see it growing exponentially internationally. I don't think there will be international standards in a hurry, because I think there's a lot of difference in the countries. But if we can work together and have one voice and say we're speaking the same language, we are all we're working for the same thing, this movement will grow.
Wonderful. I love it. And I'm so appreciative of your time. And I'm sure all the coaches loved hearing what you had to say today. It's so informative. And I think my takeaway from today was just that question about helping the clients, what's stopping them. So thank you so much, Fiona.
Thank you, Magdalena. I thoroughly enjoyed it.
So did
Thanks
I.
again.
Thank you.
Hello, hello. Welcome back. Now, this is our last, 45 minutes or so that we're going to spend together at the Health Coach Summit. And as you know, this is the summit for and with and about health coaches, health coaching. And I think what I really want to do over the next 30, 40 minutes or so, address the challenges that you have and kind of share how we feel as a nonprofit, right? Like the summits, the Health Coach Summit, the Lifestyle Medicine Summit, and also the Healthy Wealthy Project and movement that we just recently started. Our nonprofit, right? It's a larger group of people that come together and say, hey, how can we make health coaching and lifestyle medicine accessible to everyone, right? That's a clear goal. And you've heard so much information, so much incredible knowledge, skills, tools over the last 4 days, right? Now, what we kind of realized, what's really missing is solving the problems that we have as a community of health coaches, right? Which I think they're somewhat similar. And that's why I ask in the chat box, and please answer this question if you wouldn't mind. What are the challenges that you face as health coaches? And please be honest, right? Because without addressing them, and you've noticed by now, we're not afraid to speak about things that often we don't talk about, right? And I think it's important because if we want every single person at least have access to a health coach based on evidence-based lifestyle medicine and within the scope of practice, right? These are non-negotiables for me, and I think for all of us, really. What needs to happen? What do we need to change? And so we decided, yes, we train and all that. We have our root cause training and all these things, right, with the degree programs. But at the end, that's not what matters. I never forget when I did the Titans of Yoga movie a long time ago, documentary, I interviewed Dean Ornish, and that's how I met him first, actually. And he said, he was always thinking that science and teaching is going to change things. And at the end, he find out it's important, obviously, but at the end, it's the implementation, which is in many ways, it's the reimbursement, it's the finances, it's the medical structure and all the things we really don't want to look at, right? But that's where it really matters. And if you've heard Dr. Yamani's talk, I'm so grateful that he's the kind of doctor and value-based medicine expert that dives into these issues and says, well, how can we change these structures so we can make lifestyle medicine and health coaching accessible to everyone? So let's have a conversation, right, over the next 40 minutes or so. What you feel are the main challenges. So for right now, for a minute or two, please type into the chat box, right? And I might share a screen later on, but first I'd like you to just rethink. So what's holding me back? What's kind of blocking me from working with more clients, right? Because I think some of the issues that we talked in the last summit a year ago stimulated this summit and what we do to solve these problems and issues. Okay, I'm gonna just read some of them. And while I do that, please type more, because it's also a learning process for us, right? How we can help you to resolve these issues. And my gut feeling, my deep belief is you just love health coaching. You know about the benefits, right? From a science perspective, but also personal, and working with your clients, right? And you probably want to work with more people. You want to see this grow, right? That's the discussion I'd like to have with you. Okay, so Katja says, actually finding the exact niche, since the heart wants to help so many people. Great point. And I think that resonates with many of us, right? We have we want to help everyone, but what's our niche, right? Who do we want to work with, right? That what resonates with us. Carl says, I resonate with you on that, exactly. Main challenge, getting paid according to my investment in education and training and the level of responsibility that a coach has in dealing with people. I think pretty much everybody agrees with that, right? So getting paid, what you feel you deserve based on the education, what you put in, right? Finding providers to refer to me, finding clients. Who resonates with that? I'm sure many, right? That we feel like we don't have enough clients. We have time. We would like to go full time instead of having just a couple clients a week or a month, right? Absolutely. Anna, that's a really good one. Yes. There was the payment, getting paid according to the responsibilities we have. Acceptance in the medical community, that we can help primary care practitioners, help their patients, help them achieve care gaps. Thank you, Della. Absolutely. Having worked in healthcare, the patients were often not included in the process, and coaching is all about the client. Absolutely. Value-added marketing tools. Yes, another one. I think many of us, right, we don't like marketing at all. It's like, ugh, I want to help people. I want to work with people. Why do I have to market, right? Hence, how do I get more clients, right? Educating people on what is a health coach and how can we help them and how much their lives can change when they realize they actually can take control of their health. Thank you, guys. Katja, absolutely. So, summarizing that, I think what we've noticed again and again, there is a few big points, right? First of all, acceptance, value, right? We get paid in a way that we feel resonates with what we do. How do we get more clients, right? How are we part of that community that we'd like to be in, if it's healthcare or other community, right? So get the support. One challenge is finding a community of health coaches to learn. Here we go. Absolutely. That is a big one for me, especially. So I've seen it so often. If we like individual fighters out there, we feel like we don't do much, right? It's hard to really get things done and we want to talk to so many people, work with so many people, but it feels like it's just me, right? But once we're part of a bigger community, it's like it's a new entity that, has much more power, influence, and basically reach, right? Reaching so many more people and the support that comes with it, as you say here. The learn, share, get the support, absolutely. Into confident, mindful, and empathic coach. I so agree, Sherry, absolutely. Another challenge is my personal one. I think I have to know more. Oh, Anna, okay, here we go. Yes, so much resonate with that. If I would have time, I would just study all the time, right? But again, that's true. So many of us have that. It's like, oh, I need another technique. I need another whatever, right? I don't know enough yet. I don't know everything, right? I totally agree. I'm studying at the moment. Case studies work phase highlights the need to lose weight as the main focus. So the question here. At the moment, I'm using social attraction marketing and local in-person networking. Guys, if you do mostly social media, I'm very curious. Does that work for you? Meaning that it actually translates into real clients that book with you. Honestly, I'm very curious. So if you use Facebook, social media, Instagram, or whatever, you post a lot and spend a lot of time on that. Does that work for you? Because I hope it does. Please give feedback on that. I would love to hear about that, right? And I'm talking not that maybe you get likes and all that, but actually converts into people booking. Can be overwhelming, the marketing side, or I believe that, yes. So thank you, guys. And please continue posting, right? Because it's good to share, to bring it out, like we do with health coaching, right? Let's bring the things out that we might want to change or improve, right? And then we create options how to do that. Okay. I hate social media and I hate it. It never worked for me. Okay. It's kind of like the same here, if I could just get rid of it. But the one thing I decided to focus on is Twitter, because I feel like that's the channel that probably lots of big discussions, but I think it's a good way to reach a lot more people. But I totally agree. Not necessarily the best way for me either. Okay. So another question, please. And I asked this question before, but please let me ask again, because different audience today than the last few days. Do you have a health coach yourself? Type yes or no, just yes or no. So if you have a health coach that you work ongoing, basically, right? Not just once in a while, but you have your own health coach that is your health coach that you work with, that is there for you whenever needed. Please do type in yes or no. And there's a reason why I ask this, right? And I share with you in a minute. And you could continue, like, if you don't have a health coach, why not? What's holding you back? What's holding you back of having your own health coach? What's holding you back, right? Because, I mean, we all know it works. It's good. It's so good for all our clients. But then the question is, why don't we have one, right? And there are reasons. I hope you don't mind if I ask these questions. There are reasons why I ask, because I think they reflect a lot why clients don't necessarily are ready to book with us, or they're not ready, or there's not enough awareness. And so the reasons can't afford it at this time. Social media hasn't been working. Okay, but for that right now, type into the chat box why you don't have a health coach yet, and what's the reason? Why not? What's holding you back? What are the challenges, right? I hope it's a good question, because I ask myself so many times. I mean, and I think that is part of the growth process that we have to go through right now. If we want to scale this, and this is my 100% mission vision, right? We need to scale this. Lifestyle medicine and health coaching for everyone. And so there are certain things that hold us back, right? We are a young industry, so to speak, but now is the time. We can't wait another 10 years until we wait for health coaching to be reimbursed. I'm sorry. I know some people might say, it's going to come. Yeah, it will, but I think it's going to take time. And so what else can we do? Well, what's holding us back, right? Finances. Oh, Anna, that's interesting. I discovered that I truly dislike being accountable to someone. That's an interesting question, right? And clients might have the same idea. And that's why I asked the question, because we are clients, right? Honestly, before Healthy Wealthy, I didn't have a health coach either. I just went to someone like a friend. My sister's a naturopath, and did the things that we all do. But that is not what health coaching is, or supposed to be. Now I do. And it feels so freaking good. Sorry, my language. It feels really good, because even if I don't talk to the health coach all the time, it just feels like there's someone there that I can talk to. That is kind of like a doctor. If I have an emergency, I go to a doctor or hospital, right? But what do I do with just the regular stuff, the regular health issues? It doesn't make sense to go to a doctor, a physician, because it's just managing, right? I want to reduce and remove or solve these chronic health issues. I don't have a health coach right now. I'm paying for a life coach. Okay. I'm ready to change now. We are afraid to discover. Okay, that's another one, right? We are afraid to discover what is holding us back and how to conquer that challenge. So think about it. That's where clients feel. It's okay, right? But deep down, they might be afraid what they find. And it's not therapy, right? It's someone that talks to us, that listens. And they don't know that probably enough. It's actually releasing, revealing. It's like, wow, we're moving to another level if we have that coaching support. Age? Okay, that's an interesting one. Okay, finances. I haven't found anyone who would be a good fit for me. That's another big one, right? A big one. That would I work with this coach? Because would I be okay with that coach, right? Is it a good fit for me? I haven't made up my mind. I don't have, Sheila, that's funny. I don't have a good reason, right? Exactly. Not covered by insurance. So thank you, guys. I mean, really, really appreciate it. But see, I think it's instructive for all of us, right? If we're honest in that. And I so believe in honesty. And I think that's in health coaching, that's a big quality that once a client feels safe, they are honest to themselves, and that alone is deeply transformational. Forget about all the other techniques, right? Like Dr. Imani said, being there, being present, listening, reflecting back, right? Asking great questions, providing options for our clients. The awareness first. Oh my God, that's where I am. Yeah, you're right. It's true. Okay, what else? What other habit can I install? How else can I act? How else can I feel? How else can I think? How else can I behave, right? Options. The moment people have options, it frees them up to be different. So they take the responsibility for their life, right? Okay, I have, oh, thank you, Julie. This is a good one. I have not made it my priority. Not taking the time to find some. Yes, that's what all your clients, all your potential clients think. Not covered by insurance, right? Thanks, guys. I made so many questions, so many answers. I love that. Thank you, thank you. Or they are unaware. A true coach should be creating the container for you to discover ways to hold yourself accountable. Yes, I know that's all the health coaching stuff, right? That was stuff you learn. But I'm talking very much the real life, right? The real challenges that we have as a coach. And because we are clients, our clients have the same challenges, right? They don't know enough, right? Yes. But I personally think it's not about the knowledge. Right? We can get any information online, right? But it's about more that emotional charge, the passion about actually knowing where we want to go, right? Knowing actually that this is available, for example. So thank you so much for posting this. This is excellent, excellent, excellent. Okay, so let me actually share screen. And I just, honestly, I didn't prepare much because I want you guys to guide me here, okay? And what I do, I just use the website, some of our Healthy Wealthy websites, and some of the slides I had we prepared a while ago. Let me just move this out here. I read your chats here, so just in case, continue to read. So, the problem, everybody is aware. And believe me, I think most people are absolutely aware about the chronic health issues like we are. They just don't know there is an option, right? And like I said in my first talk, we wait, we procrastinate. Well, we don't know what else to do, right? Let's be honest. I mean, if I have a back pain, yes, there's a lot of other things going on that we could do, but it's just not satisfactory to many of us, right? And we don't know there's an option. And that's why we're moving towards this healthcare 3.0. And what I'd like you, and only if this is okay with you, but visualizing ourselves as kind of like, which I said before, right, in my first talk, that we as well-trained, certified health coaches become something similar to what this countryside doctor was in the past. Which basically, to me, there is the secret ingredients, the secret sauce that at least we kind of define in Healthy Wealthy, right? Is to help our clients to see options. We help motivation, and most of all, accountability, to be present. But the accountability part is actually what is very powerful, right? I know some of us don't like that, but mostly because we haven't had a coach that actually is not telling us what to do, but just helping us, providing feedback that helps us to grow. And what I noticed, and that's why we in our trainings, we focus so much on health outcomes, that once clients see in every session, every time we work, if it's a group session, a personal session, even if it's just a chat support, they feel something, right? It's not about the knowledge. They feel either supported, they feel like, oh, that's a good idea, right? Which came from them, we just feed it back to them. they feel like, yeah, I feel emotionally already better. That the confusion I had in my head, oh yeah, now I'm more clear. Great. It could be just one chat, a couple chats that we fire off that help the client to see the situation differently. Most important, obviously, are health outcomes. And I think last year we gave the health outcomes. We have a list of 20 health outcomes that we use, and it's only 20, the most common ones, right? Health outcomes can be, I become aware of which life situation in my life affects me and put a tremendous stress on me. A lot of us don't realize that. For example, that one conversation we had with the boss, and it's just one person, right? That triggers us into like total stress, and we get angry, upset, or whatever, and it affects us really strong. And then physical symptoms start to appear over time, right? Just that realization in a coaching session, right? Which they realize, wow, I didn't know that's actually a connection. That is huge. Obviously, health outcomes, other health outcomes are if my stress level goes down, if my emotion intensity goes down, if I feel better in my body, I become more aware of things in my life, right? There's many different levels, holistically speaking, of what health outcomes are. But anyways, so what we gonna move towards to is this healthcare 3.0, and we play such a huge role in this, right? And maybe it helps some of you to see yourself in a position where you actually take that position of this countryside doctor that is there for clients, families, and communities, right? I think we also have to, I'm sorry if I kind of throw a lot of these things in, and I hope they resonate with you. I think as health coaches, we kind of need to move on from just thinking one-on-one, right? Because the issue of chronic disease, this is so huge that I think it will help us to move more into working with families, right? If you work with a kid in school, which is actually part of the healthy, wealthy communities we work with, is children and kids in school, right? It doesn't make sense to work just with a kid or youth or toddler even, because they're part of a social environment that if that's not being improved as we move along, it's not really makes sense, right? Same in a work environment, corporate, same in healthcare, right? So we need to, I think, start working or looking bigger, like families, communities, right? For example, I think the first step that we need to achieve in terms of health coaching is that at least every city has one really good, and I'm talking smaller cities, right? Not New York, small cities, a couple thousand people, right? One health coach is there to have access, where everybody has access to this health coach, right? So thinking bigger, right? And so maybe that helps you to consider or to think more about that position, right? And I think we have to be innovative, which I said before, right? We have to try different things. You can't wait for healthcare to change in the speed that we need to grow and expand to have access. Everybody has access to a health coach. And I think that is obviously the most important part, because yes, there's still an educational gap. You know, we did a lot of research with Healthy Wealthy to find out what's the easiest way, what's resonating, right? And it's amazing how few people know about the power of lifestyle medicine and health coaching. It's mind-boggling, right? We still have 3% of humanity, 5 maybe, even knows a little bit about it, but that's nothing, right? So education is a big part, but I think it's not the determining factor. Now, implementation. Okay, let me actually switch over here. Let me check actually quickly on the chat here. Anna, churches, yes. One of our health coaches is the pastor, and he's so passionate. He says, every church needs a health coach. And why? Because people are already open. They're like not in their work stress environment and all that. They go there to feel better. What better way to have health coach in every church? Guys, these are ways for you to think about who you can talk to, right? So we have churches Absolutely. Corporate, healthcare, right? There's so many opportunities. And the challenges that we talked about before, that is what we're trying to solve with Healthy Wealthy, right? And that's why it's so important to me, because again, we do this, like, to be honest, we're so busy with our Lifestyle Prescription University, which is the degree programs and all that, that I told myself I don't start something new for 5 years, because I'm always starting new things, because that's why does nobody do that, right? And then it's like, okay, God, I'm gonna do it. And same with Healthy Wealth. No, I'm not gonna do something else. But the problem is so big. It's not in education. I think in the US alone, there are 150,000 trained health coaches. I don't know the stats, but the majority is not working full-time or even part-time. So that's unacceptable, right? So we said, how can we solve this? Now, quickly, let me switch to a few Healthy Wealthy points here. Again, it's a nonprofit movement, right? It's basically a way to us as a community working together, where we as a community also, right, we trying to do a lot of things as much as we can, but now we are a space where Healthy Wealthy has been launched. We have about 100 coaches in Healthy Wealthy. They start to reach out. We started with our pilot projects, which is mostly what we focus on. Just talk to doctors and hospitals and, hey, I'd love to run a pilot project. 100 clients, 50 clients or more, right? Whatever they agree on. And show you that this is working. I think that's the way to go. But I talk a little bit more about that later. So let me see, did I refresh that? So we called it Healthy Wealthy, which is surprised that name was still available, because we believe we have to change people's mindset. Because if something is valuable to us, it's like we see it as wealth, prosperity. It has a lot more juice and attraction, right? So from a health perspective, we need to treat health as well. And please use these terms, right? There's no trademark on any of this except Healthy Wealthy and all that, but like in terms of terminologies, use that if it helps you, right? In terms of the language that you use with your clients, do you treat your health more like wealth, right? And what do we do? If we want to create wealth, what do? We wait until it's too late and then we start thinking about wealth or prosperity or money or whatever? No, if we have this mindset that we want to create wealth, right? We start saving. We start investing a little bit now, right? $10 a month, 50, 100, whatever a month. And then over time it grows. And then suddenly in 10 years, oh, wow, I feel wealthy. The same mentality and mindset needs to happen. Big educational movement that we need to do. And that's why we need you guys to join, and thousands and thousands and thousands of health coaches. So we do this together. Otherwise, it's not going to happen, right? So people think and feel and perceive health as wealth, and they treat it that way. It's like a savings account, right? So invest now, not when it's too late. And then you pay 10,000 in cost, and you go bankrupt in the US, not in the other, a lot of the other countries, right? But you get bad care or whatever, right? The pain you have to wait until it's too late. So that's an argument, a way to talk to people. And I think we found that they resonate so strongly with this. Invest in your future self. Yes. So okay, thank you. What is healthy wealth? So basically, we said, knowing all these challenges that you described, right? Not enough income for health coaches. The challenges of marketing, right? Knowing that the problem of chronic disease, the pandemic, is so huge that we cannot just have a one-on-ones. It's a drop. It's like not enough, right? So we need to scale this so big that millions of people have access to a health coach, right? So we developed a platform and an economy. And let me quickly share why we're calling it an economy, because let me ask you a question. Type in the chat box. If people, other health coaches, see that you do well and you earn well, you walk the talk, right? You basically become better. You look younger in 2 years. right? And in 5 years, you look younger than you used to look. You feel better. You have more energy, right? You walk the talk, and you have a job. You have a business that does actually really well, right? You have, I don't know, 50, 100, even more clients, right, that you work with. And they see that many more want to do this. So we need to create this new healthcare 3.0 economy that is not based on you get sick and you wait until you're sick, and then the more sick you are, the more money you make. That's fee for service. That's old consciousness, old healthcare 2.0. I hope you know what I mean, right? I think we have to think outside the box and try something different and go for it. So economy means that we're building an economy of lots of amazing jobs that I know you guys like to love it, right? But it also has to be the financial side. Unfortunately, we live in the world that we live in. We have to build it up. And that's what Healthy Wealthy is. It's a platform, right? So we're building a platform. Think about, my analogy is this. Think about Spotify, right? You guys are the artists, right? Spotify, hence Healthy Wealthy, right? It's just a platform. It's just to make it easy for many people to listen to great music. It's you as the artists, right? The listeners are the clients. And that's the same model we use for Healthy Wealthy, that all we want to do, create a way for as many people as possible, scale, big, right? Scalable, to work with you as a coach. You are the artist, the client is the listener in a sense, when you are the listening, right? But you know what I mean? It's like this direct relationship between a coach and a client. And actually, let me go down here quickly. And so one of the things that we said, right, which is the biggest problem in healthcare, that healthcare is full of intermediaries, middlemen. If you kind of, I don't want to go there now, but like a drug costs $1 to produce, it's sold for 100 or 1,000, right? And there's tons of people in the middle that make a lot of money out of it. That's why it's hard to change, right? Healthy Wealthy, no intermediary. You work with your clients. They're your clients. It's your business. Nobody between, right? And also, we kind of strict with product sales in a sense that, which we noticed, a lot of complementary practitioners, they try to sell vitamins and all that to supplement their income. And I think that's wrong. Let me know if that's true or not. If you might think differently. But I think if I'm a client and I know I'm being sold something just because I make money out of it, the coach or the doctor, right, even or whoever, I don't know, I wouldn't have a lot of trust. So if we make it very clear, right, I'm here for you. You are number one. I might suggest things, or if you ask me, I might say, yeah, I've used this or that, right? But we discourage and say, no, just create the trust. The more trust you build with your clients, honesty, truth, the more people come to you automatically, right? Oh, yeah. And Carl, maybe you said, I'm passionate about health and personal finance. I see a lot of parallels. Yes, there is so many parallels. And unfortunately, or fortunately, we live in this world, right, where entrepreneurship and, being our own boss, for many of you, that's maybe not the ideal thing, right, which is totally fine. But I think a majority of us, which NBH-HWC, Lee and Webster said, I think 50-60% of health coaches are independent. They want to run their own businesses, right? And even in being employed, there's always opportunities, in terms of Healthy Wealthy too, because of bigger projects, right? What we actually have happening now, that some coaches work in partnership with other coaches and start to, address and invite bigger communities, like with 500 or more clients. So this is really important to us. And the whole point, like we said, that remove as much as possible the burnout that many of us in health coaching feel, right? The marketing frustration or the low pay, right? I mean, like in the UK, I think you heard Isabella talking about that. In the UK, often it's health coaches start to be used more as cheap labor. And I'm so against that, right? We have so much value to provide. And I think health coaches need to pay paid really, really well. So basically going back here, and I just do it on the website because, sorry, it makes more sense. So basically Healthy Wealthy is a way for you and for thousands of coaches to build a practice where they own it, right? And where you're going to be part of a community, right? And our job just on the back end is to build a platform the way our coaches, we get so much feedback from coaches all the time. Do this, do that, right? And add that feature. And I'm going to go into the specifics if you're interested, right? I mean, I don't know if you have the time, but of what that is, and you can just go to the website too. But basically, it's a new membership-based coaching platform. Now, because many of you said before, right, that coaching can be expensive. I don't know. Do you guys do you mind typing into the chat box? What's the average of coaching fees that not you, we don't want to know that, right? But is being charged overall in the industry? Type in the chat box, right? Because I'm curious too, right? And that typically we call a premium type of coaching, right? Where you spend 1 hour, maybe 2 hours, or you have a package where you coach someone for 6-10 sessions, or you have the bigger packages, right? Type into the chat box because I'm curious, right? What the fees are that coaches, typically charge. And again, it goes to the question, right? Can people afford it, considering that it's not reimbursed by health coaching, and even if by insurance companies, and even if it's reimbursed, is there availability? Will doctors actually prescribe it, right? So kind of saying a range goes from 50 to 150, exactly. I think that sounds about right. I've heard a lot higher, right? But then the problem is, most of us need to build a practice and really grow it. And then typically it's a one on and off. So a client could be there for a day, for one session, maybe 2 or 3, and then they might disappear, or we have to get another client, right? So it's this constant stress about getting new clients. I think many of you feel that, right? That's why I hear again and again. Per session, 150 per hour, yes. 150, so that seems to be the average. 125 to 195, depends a lot where you are. Exactly. Exactly. So good. Thank you, guys. Thank you. So think about it this way. What if a client just pays $30 a month? Ongoing basis. Right now, the Healthy Wealthy, we have 49 a month if it's monthly, or 30 a month if it's paid annually. So it's 360 for a year, right? Now, I know already what many of you say, oh, how would that work? Well, it does work. The big difference is that we pay less attention to one-on-ones, but more attention to group coaching, chat support, and being very specific with time management, and moving clients to actually practice habits themselves, which is kind of what we do anyways, right? But our approach has been, we noticed that we can shorten the time, not the quality, right? The time of how we work with clients and move them quicker towards practicing. You've heard so many times, especially a lot of speakers talk about the more micro habit approach. It's a lot better if a client for a few days practices something like the 7 days. Often we do like a 7-day. For this 7-day, practice this little habit. It could be just no sodas for 7 days lifestyle, right? Nutrition. It seems in a way easy. It could be even smaller than that, right? But once clients do that, and that's all they do in our job with chat, maybe group, and maybe personal if needed, is for them to get there. That is such a huge win for the majority of clients. even if they're very experienced and know a lot about nutrition, for example. Because nutrition is tricky, right? There's so many different models. And just allowing our clients to take this one step at a time. But over time, right? That's the key. We found to be so much more valuable than have like this one session where, oh my God, that was a great session. But then 3 days later, they forgot about it. They don't follow through. Tell me in the chat box if you agree with that. And I answer your questions. Thanks. They're really good questions. And they're valuable, very important, right? But think about it this way. You remember when fitness was kind of hot or actually it wasn't hot, but it was like an insider thing, fitness, right? And you had this more expensive type of fitness studios. A few people could do it. And they're still around, right? Worth $1,000 a month to go into a fitness studio. But what shifted is, the big shift was everybody had access to a fitness studio, I don't know, 20 years ago maybe or something, right? Once it was a membership model, which means it was under $100 or $50 or whatever it is, right? And obviously quality ranges, right? But the idea was you make it more affordable for a client. And I think that's a big one, which you guys said for yourself, right? And people think the same way. For example, the pilot project we're starting right now in New York City, right? Brooklyn, at a hospital. They said, our audience, the people that come in here, they need to think about, do I spend $30 a month for food? Or do I be hungry, right? Or do I have to go hungry or something for family, right? There's very low income. So health coaching is no option, right? Unless it's affordable, unless there's a base foundation in terms of health coaching that allows them to have someone they can talk to. And think about it this way, right? Like Healthy Wealthy, we have kind of two packages in a way, but basically, think about it. It's the base foundation that we can reach a lot of people that we help to improve a little bit. Think about it. 1% a day. Type in the chat box. Do you feel you, as a client now, right? We're coached, but we are clients too. We are people that need help in so many ways, right? Do you think you can improve 1% a day? If there's a health coach, for example, that is there with you and says, oh, how about we focus on little tiny things, and do you think you can improve 1% a day? Type in the chat box. Do you feel that's possible for you personally, right? Just very small improvements, maybe 1% a day, or even 1% a week, right? Whatever it is. Do you feel that's possible? Type in the chat box. Yes. Yes. Of course, accountability is key. And you know what? I talked to hundreds and hundreds of clients and people in general. Everybody said yes. And see, that's, wow, now there is an option, there's an opening, right? Because think about, if we improve 1% a day, where are you going to be 90 days? That's the power of micro steps. And so what we and I didn't know that actually I'm so interested in public health, which has started the last few years, because I just feel like it's unacceptable how people suffer. I mean, let's be honest. Not just physically, but also emotionally, depression, loneliness, kids having social anxiety and all these things. It's unacceptable. And so I think we need to step up our game, which I said a couple of times, and healthy wealth is a way. And there's other ways. A lot of the things I said, you can do yourself. I hope you do, right? Not meaning you have to join Healthy Wealthy. I would love to, because I think one of the power is if we build this platform, right, which is basically you, the way we see it as a nonprofit, right? We just do the platform. We make it as easy as possible to make this connection. But it's you do your thing wherever you are, in whatever community, however many clients you want, part-time, full-time, and so on, right? But I think if we're fragmented as a community, right, if we have lots of different schools, lots of different things, which is great, right? But we don't have enough reach, then it's just nothing's going to happen. We're going to be, in 5 years, we're still going to be here at the Health Coach Summit and say, yeah, I have 2 or 3 more clients today, right? I hope you know what I mean, right? So we have to scale this because people need our help. It's as simple as that. And that's our way of doing it. Always within evidence-based lifestyle medicine and health coaching. So it's a membership kind of a platform, right? So let me go down here. Now, this I think is important. We started to realize, well, who do we want to work with? Who are the main audiences that we want to invite or that we want to reach out to? And so we basically are very clear. We have 3 platforms, or 3 groups, basically teams, as we're calling them. Teams is any organization or business or group that is bigger, larger, right? So we have healthcare. And I just go quickly through it. A couple things. What the hospitals, for example, and others told us, just the concept that the doctor refers a chronic disease patient, like Dr. Yamani did, to a coach. It makes it so easy. You know why the iPhone, Apple, was so successful? There were smartphones before, but they made it so easy that everybody could use it. That's exactly our model. You know why Spotify? There was Napster and others. It was difficult. It was so difficult to use, right? Spotify, super simple, bam, explodes, right? The same thing here. If you tell a doctor, especially hospitals and doctors that are overwhelmed, which most of them are, right? Hey, it's as easy as writing a lifestyle prescription, right? A referral to a doctor, to a coach, and I kind of take care of it. I take care of your clients. There are details, right? But that's going to be worked out. We have a pilot program that basically we give our coaches, right, the ones that we learn work, and you just use them and duplicate them, right? Same with marketing materials. Why do we have to reinvent the wheel, right? If it's, we know something works, let's just everybody duplicate it, and that's what we want, right? We created so much materials as part of the training also, and just show you how to use them. Who wants to reinvent the wheel, right? It's so much work, crazy. So we share that as part of our community, right? So we're calling that the referral process works. And that's what doctors actually are very happy about, because at that hospital, they said, yeah, we have to train our doctors. We have to write a curriculum. We have to train our physicians and our staff in lifestyle medicine, and said, that's great, but that's going to take years and years and years. Don't have the time for that. We need to get things going now. So to us, this is the solution for healthcare, that the doctors, clinics, kind of outsource. We're calling it outsource, right? They outsource to health coaches that not necessarily are part of their staff. Because if they have to add staff and change their structure, like Dr. Yamani said, they just, oh my God, no, big hassle, don't want to do it. So you make it as easy as possible for the providers. And they get all the benefits, right? So same with corporate. I'm not going to go too much in there. And as you can understand, right, we can also afford, make it much more affordable. That's the whole idea, right? Affordable, still with the health coaches earning well. That's the number one priority, and keeping it at a very high quality, right? Just because someone has a foundational offer of services like the group coaching, which you saw the talk yesterday or listened to the talk yesterday, amazing, right? The results if you just do with Healthy Wealthy, chat and group coaching, clients love it. That's the future. At least that's our opinion, my opinion. Not just mine. I mean, that's why Dr. Imani and others joining our network, because they say, yeah, that's a way that can really work. Now, youth, I was so surprised when we had our last couple of weeks ago, our Healthy Wealthy Coach meeting. So many said, wow, the issue with youth is so big. And if you want the planet to be good, right, and have a next generation that is just really competent and healthy and knows how to establish healthy habits, we need to do something, right? And so a lot of our Healthy Wealthy coaches start to work with youth. And luckily, we have this amazing educator in Los Angeles. She has a kindergarten, developed a charter school, and she's just amazing. And she's gonna, with others in our group, right, we're writing a kind of a youth-based from preschool to high school curriculum and ways. How can we make this fun? Right? Kids don't want to be told what to do. Even we don't want this as an adult, right? They want to have fun. So we're creating something fun that still teaches them like health and life skills and success skills. Okay. Let me ask a few, check the questions here. So what does security? Oh, it's HIPAA, all the good stuff. I mean, we try to do everything even possible to make it very secure. How much do they actually earn? Yeah, let's go there right now. And actually, it's just very simple. I guess that's the big question, right? Because many of you might say, well, how does that work financially? Let's focus on that part right now. And then please ask me other questions, because it's really important I get your feedback, because I want to test. I want to be tested, right? Are we totally off with this or not? Right? We just launched it a couple months ago, right? We built it for a year longer. And we just, we have about 50 coaches now in the platform, and just started several months ago, right? So it's rather new, which is good, right? So we have a lot of flexibility, and because we are community-based, right? We would talk, we share, hey, do this, do that, right? Is this good? Oh, I do this. This really works for me. Cool. Why don't you do the same thing, right? So we learn from each other, which the growth is so much faster than we have to kind of figure everything out ourselves. Okay. So about the finances. So first of all, the whole point is that you connect online or offline, right? Can be both. Could be like local. You use Healthy Wealthy platform to manage your local clients. Plus you offer online, or it could be only online, right? So however you like that, with individuals, families, teams. And we have only three things. We want to make sure the app also and the platform, right, is simple. It's no fluffy stuff that nobody needs just to distract us and the client. The 100% focus is client, you practice the new habits that we, in our coaching group sessions or whatever, chat sessions, we decided, or you decided to focus on, right? Clear focus on habit change, 100%. So group coaching. And obviously, because there's not a lot of training out there, we include that in the training, because to me, that's the future. Group coaching is going to be the future. If you say, I want to do this myself, please do. Right? Focus at group coaching. Very powerful. Personal coaching. And by the way, we say this, actually, I need to change that actually. It says unlimited group coaching. So typically, okay, give me a second. Let me just complete. So there's personal coaching sessions included, unlimited chat coaching, chat support, and unlimited micro habit improvements, which we call lifestyle prescriptions, which is not a prescription in a medical sense. It's a habit improving micro habit, right? So typically the way the flow goes, a client signs up. And for example, think about somebody signs up for the annual membership, which makes a lot of sense because they save a lot and they get a lot more bonuses and all that, right? And if most people sign up for the annual one. They have 360, right? Think about it, 10 clients sign up a month. You do the calculation, right? It's really that simple. Simple. That's what we want. So 10 times 360, right? And the way the flow we found works really well is first, there's a connection with chat. Why? Because we also used to chatting, right? WhatsApp or whatever, SMS, like, whatever people use. In this case, that's inside the app, right? So people, clients install the app, you would install the coaching side of the app, right? You sign up and all that. And that's, we're going to all teach that, right? But the whole point is the chat, once we train our clients to start with chat. And we have people in their 70s, 80s. And like Dr. Johannes said, if like Medicare patients, they might not know this, or, well, we just spend one session, 20 minutes or whatever it is, to guide them through the process, how to set up the app. And so they are really there and they're going to love it so much. It's like this connection they have with you, right? This energetic connection. Chat is number one. That's one aspect. Then, for example, you schedule one or maybe several topic-related group coaching sessions. And the beauty is, see, what we found, let's say you have 100 clients. You might say that's a lot. Well, it depends. If you have 100 clients that you want to do 60-minute or 2-hour sessions, that's a lot of clients. You are burned out. So what we do, we train you, or we say, use a mix of chat, group, and personal. But in any case, right, group coaching, you can do so much. Most of what we can do in personal coaching, we can do in groups. Instead of talking one-on-one with someone, we talk to 10, 50 people, right? And it works amazingly. And it builds community, right? Now, and then after chat and group, maybe 1 or 2 group coaching, and somebody says and chats you, hey, I really need to have a one-on-one with you. Okay, book a one-on-one with me, right? Why we did this, and we were really planning this out a long time. Of how does it work, right? How does it work financially? How does it work in terms of time spent? We kind of calculated, and this basically, let me scroll down here. So the easiest way is you think about clients times 30 a month or 49 a month, right? You just multiply. That's really when you have the income, right? And basically the platform, right, that allows us to build and the servers and all the stuff that you don't know about because it's a pain in the ass, right? To deal with all this in the back end, right? Which we have our team that helps and that does all that. But we just charge 10, 15%, depending, right? So basically about 90%. Depends a little bit on what the situation is, like with teams and big groups, it might be a little bit different, but the vast majority of that payment from clients, the membership payments, right, goes to you. Like they sign up, within a few days, the payment goes into your bank account. We automated the whole thing. See, I believe in automation, right? Because to really scale something, you have to automate, right? You have to automate everything that the software or whatever, something in the backend can do. That's what we're trying to do. So you guys don't have the work. We don't have the work as much, as minimal as possible. And most important, the client, it's easy, right? Easy for clients, easy for you as a coach, and also the doctors or whoever you're going to work with. So that's kind of our philosophy. So maybe 10, 15 hours a week, that's maybe this here. Or if you have about 30, 35, 30 hours a week, it's about this, right? I mean, you just multiply. Kind of, if you do the annual 360 times how many clients you have a month coming in. Now, we calculated most, and again, nobody's at 250 yet because we just started, but some of our coaches are at 10, 15, 20 clients, and they're building up with pilot projects to much larger. 200 are easily possible. And again, we train your teachers. I know it's also a very different model, right? But the idea is that we reach a lot more people while we have actually less stress and burnout as coaches, right? Earn well, and the clients improve in a sustainable, ongoing way. And think about it. If you have these, let's say 100 clients, right, that you build up over a few months, right, over time. And by the way, you can have your own clients that you invite. Just think about how many clients would you be able to bring in that might say, hey, 30,000 a month, that's actually pretty okay, right? Much easier entry point. Then you can work with teams like a doctor's office, church, youth, hospitals, right? And we help you with that, obviously, how to do that. You might have 50 coming in that you work with, that somebody refers to you over time. And then through our platform, we have people sign up, and they might pick you or choose you through a search, or like in New York, they ask, they're very specific. They say it has to be very specific kind of coaches. They have certain specifications, language skills, right? Have to have, for example, a lot of Caribbean type of background if possible. So they had a very specific request. And so we are assigning 3 or 4 of our clients to that project, which either 50 or 100. We haven't finalized it yet, the clients, right? So that every client would get 15, 20, I'm sorry, every coach would get 15, 20 clients through this hospital project, pilot project. So again, marketing and all that, we said, let's just make sure we provide that, and it's going to grow, obviously. The more we know what works even better, then we update, and all of our coaches can use that, right? And again, please understand, this is 100% nonprofit kind of project in the sense that we just need to do something different. It's just not possible otherwise, right? And that's a worldwide phenomenon. It's like, I don't know if Peace is in here. Peace, maybe type in the chat box if you're in here. She's amazing in Africa. I mean, there is mostly no healthcare system. I mean, it's mind-blowing. And so our goal there is to create a lot of well-paying jobs, which for us might be, I mean, $700 a month, $500 a month, well-paid a month, right? And they just help 10, 20 clients. So the whole idea is, like Rwanda and Nigeria and other countries, kind of build that health coach, lifestyle medicine healthcare system up, because the other healthcare system is not working, right? So huge possibilities there. And Peace, thank you so much. You're doing absolutely amazing, absolutely amazing. Gosh, so guys, I know I could talk forever, but I hope I could inspire you. That's my goal, really, or my point of sharing this with you, right? We'd love for you to be part of Healthy Wealthy, obviously, right? And you just go to the website, healthywealthy.net and HWC, or just if you go to Healthy Wealthy, which is basically, Healthy Wealthy is basically if you want to sign up for a coach, right? Which I hope you do too. But the whole point is we need to make things more easy for our clients, and we cannot wait for healthcare to change. Trust me on that, please. I hope I'm a very positive person, very, very, very. But these monster organizations, right, industries, and by the way, when I did the lifestyle medicine documentary, we did this, I think, a few years ago, 3-4 years ago, and we started out in the documentary. You know, every industry in the world has been radically transformed and disrupted. Think about music with iTunes. Think about books, Amazon. Think about shopping, Amazon, right? Think movies, Netflix, right? Now with AI, it's even more transformation and change. But guess which industry has not changed much? Healthcare. Every industry has been disrupted, pretty much except healthcare. And so I think we need to disrupt healthcare. Don't tell anybody. We do this very quietly until we have enough of us be part of this big community. And I hope you join. And again, I hope there was a lot of other tips and tricks and ideas that I could share with you, just to think outside the box and say, hey, I can do that. I could go to a church locally, right, and say, hey, I'm a health coach and I want to do this and that, right? So, payment, Yvonne, and guys, don't worry. It's like all set up in a way, and there's a lot of options. We use Stripe actually. Yeah, we use Stripe actually to pay out. So in most countries that works. So if clients come in, they just automatically just deposit into your bank account. If not, we have other ways, right, to pay out. Peace is here. Yes, Peace. You're great. Thank you. Thank you. Let me some of more questions, please type in, and maybe in a few minutes we kind of have to go. Let's go. We're over time already. Oh, do you have to take a Healthy Wealthy Coach certification? Yeah, you know what? Go to the website, because see, one of the things that we found, the differences in coaching are so vast. From some training programs just focus on the very, very basic coaching core competencies and all that. And so, yes, we have a training, and it's you can learn so much. I mean, for example, right, we focus a lot on emotions, beliefs too, and stress, like you've heard, because that's like most of the clients we start to see, it's a lot of emotions, life stresses they have, and yes, nutrition too, but we need to know this. So we focus on that a lot and teach you very simple coaching skills that allow the client. Let's just say we use the SUT scale a lot, right? So if somebody, we say, like, I feel so much stress in my life, right? And we say then, how strong is that stress from 0 to 10, right? 10 being the strongest. I might say I'm at 7 or 8 actually. Oh my God, yeah. And then through questioning and guiding them and listening, we move them down to 0 and to the plus side, which actually, what's the option? What's the other habit? What's the habit you want? How do you want to react with this type of stressful situation that you experience again and again, right? So we're moving them into healthy habits. And it works just so well, right? And so that, I think we just feel this is essential. And yes, there's a certification, also NBH-HWC credits for the training, right? And see, the thing is, because again, we have this nonprofit, we are nonprofit, but also the mindset that lifetime, right? You're part of this network. But the training is just basically because we feel we want all our healthy, wealthy coaches to be somewhat at the same level, right? So we know we also very confident, right? That they know the core competencies, they know what not to say and what to do, and just do a great job with clients, right? And obviously, lifestyle medicine, and we address also the root causes. Optionally, we also have this organ, mind, brain anatomy charts, which kind of just introduction of which specific, somebody comes to you, for example, with skin eczema. What's that about? Right? I think we also, as health coaches, we need to know anatomy, by the way. I think that's just essential. Actually, we need to know organ, mind, brain anatomy, which is basically the connection between specific organ symptoms and the specific stressors that affect these organ tissue. Because then it's so much easier to work with clients. It's like we hear this again and again. They say, how do you know all this about me? Well, because if certain symptoms appear, like Dean Ornish says, we need to ask, why does that organ react? Why is it not your right toe, and why is it your hip? That we need to know some of the foundations of anatomy and biology and organ, mind, brain anatomy, as we call it. So just go, and this is just the app. I mean, just quickly, and I know we have to go, but very simple. And one of the things that a lot of us love, and a quick story about myself. I mean, I'm very bad with habits. Really, I mean, it's like, you know, I start something, and then after a week, like for example, vitamins, I take my vitamins for a week or two, and then I forget about it, and then for a month or two, I don't take it. Like what we do with our clients, right? The clients add their lifestyle prescriptions, which is they write it for themselves. We don't do that, right? They have to write it. Actually, we make it a point that you as a coach cannot do that. They do that for themselves, right? So, for example, break. If I sit 4 hours on the computer, right, certain times, then I just need to have a reminder pop up and say to me, take a break, right? Or no food. This is mine, by the way. I'm sorry. It's kind of private, but it's okay. No food after 19. So that's, I've noticed when I do that, and that's what I worked with my coach, right, with Krista, and said, if I eat after 6 or 7, I feel like I can't sleep well. Okay, now no food after 7, my time, right? And so the app reminds you, so it's a habit tracker, but it's also very specific, very small micro habits, right? So some of us have, a client might start out with one little habit and then they're building up. But the point is, I do most of these once in a while, not, but I do it pretty much all day long, every day. Every day, which I never did before, right? And obviously people can schedule personal consultations, group meetings. And another thing is, we use the dopamine effect, basically the reward mechanism. So every time a client completes a habit, they click done and bing, they get an RX Heal coin, which means that's the health value, the wealth value. So with these coins, I have 6,500 collected over the last 3-4 months. They can then later on get additional training, products, things that we're going to add to the platform. So this has value to them. This is real value, right? And so with that reward mechanism, it's more fun, first of all, for clients. We want to make it fun. And by the way, don't join Healthy Wealth if you don't have fun or don't want to have fun, because we need to make it fun for people. It's not like a serious business. Health coaching needs to be fun and happy and jokes and whatever, right? People want to have a good time. And by the way, it makes the difference in the world. Just if like they feel bad or something and you crack a joke or you have a good time or whatever it is, right? People feel so much better already, and then they're much more open to actually work with you and continue to improve their habits. And as you heard with Dr. Yamani's work, now we have the absolute proof that this is working, with PHQ-9 improving like 70%, which is this depression, low energy, anxiety, like the psychological, mental, emotional state, 70% in 4 months, just for the coaches. And by the way, what Dr. Yamani instructed the coaches is just be there, listen, be their friend, right? Very core competencies in terms of health coaching. So it was incredible to see these results. And for doctors, for healthcare, hospital visits from like, I don't have the stats right now, like they dropped dramatically with huge cost savings. So, and again, that's my, not just the vision, but that's the reality. That's what's going to happen. Over the next 10 years, there's going to be such a need for highly qualified health coaches. I know you probably have heard that before, but now I think we are something has changed over the last years, right? And especially that's our goal, because with Healthy Wealth, we are not dependent on healthcare. One of the things I said from the beginning, I do not want to develop something where we have to beg healthcare to refer clients to us or that we're going to be reimbursed. This has to be standing alone by itself. And it does, because you can work with any group. It doesn't matter. With this price level, with being a more membership, it's so much easier. Okay, last question, and then we have to go. A couple more questions, actually. So I hope I stimulated some of your thinking and ideas. Thank you for the last 4 days. You have a lot of great information. And please, information is good, but implementation is what matters. So if you just take that with you over, from these 4 days, lots of information is great, lots to learn, you get better and better. But it doesn't help anybody if you don't implement what you've learned in your own life and with clients. And the same is true with clients. If they do not implement what you say, if they know it, but they don't do it, it doesn't help them. It's a waste of your time and their time. So focus on implementation in your life and in their lives. You like the reward mechanism? Yeah, it's so much fun. It changes the dynamics. It's crazy how that works. Yeah, it's a 3-month program, which is live classes, the self-study, right? And so many of you are super experienced, but I can guarantee you get so much out of it. That's what our last cohort said. They just love it. And they get so much for it. Our health and wealth coaches being responsible for bringing their own clients. Yeah, it's a combination, right? So it's a combination of bringing your own, which I think is important, right? Because that's how we learn, reach out, right? To bring your own clients. Could be starting with family, could be people you talk to, right? Anyone you talk to. I mean, if somebody has health issues and you offer them high quality personal health coaching and they pay only $30 a month on an ongoing basis, right? It's a membership. That is opening so many doors. Yeah, group coaching, we pay a lot of attention to that because that's kind of like the core. Chat and group coaching is the core, right? Because you can have easily 50 clients in your group coaching session. And you grow, like you start with 5, 10, and grow it as you move along. Yes, send us an email. Let us know. Make sure you stay part of our community. Whatever you want to do, however you want to go. How can I connect? Just to go to the website, Healthy Wealthy or Lifestyle Prescription. There's a contact form. Just send an email. Thank you again. So, okay, one more question. So when we take the exam, pass it, and get the 24 credits, do we still need to go through your certification program? Well, you don't have to, but it would make sense. It's always good to have another certification, right? So you're going to be a certified health coach. But again, this requires that you already are health coach trained. So if you're totally new, then talk to us, and we have other options to go to the full NBH-HWC type of training program. But this is basically Healthy Wealthy is for existing coaches because, that's important in terms of quality. Here we go. Thanks again, everybody. I think there's probably more questions, but we're going to end the Health Coach Summit 2023 right now. Yeah, thank you guys so much. This was amazing. And, thank you to all the speakers. Wow, the quality of information and skills you've learned is just wonderful. It was wonderful. Most of you have the replays. Please watch the replays. If you need the CE credits for this Health Coach Summit, just complete the replays, right? And then go through the exam that is there in the student portal, and you get your CE credits. Once we have our next podcast, make sure you join, right? And thank you again. Share, spread the fire, spread the word, and be confident, guys. I hope you don't mind if I say that. Like, work with your own health coach. If you feel like you need more, build up this confidence, get your own health coach anyways, if it's Healthy Wealthy or otherwise, and be confident. What you guys do is amazing. It's effective, right? And so with that mindset, reach out and just change lives. Thank you, everybody. See you very soon. Stay in touch. Watch our emails. Watch for our emails and new things coming up very soon. Thank you again. Thank you.